Ladies and gentlemen, our program will begin momentarily. Please make your way to the Moonshot stage on the ground floor. Again, our program will begin momentarily, so please make your way to the Moonshot stage on the ground floor. Ladies and gentlemen, our program is about to begin. Please take your seats and silence your mobile devices. Our program is about to begin. Please take your seats and silence your mobile devices.
We meet in an hour of change and challenge, in a decade of hope and fear, in an age of both knowledge and ignorance. The greater our knowledge increases, the greater our ignorance unfolds. Despite the striking fact that most of the scientists that the world has ever known are alive and working today, the vast stretches of the unknown and the unanswered and the unfinished still far outstrip our collective comprehension.
I used to characterize my business interests in media, film, television, as a storytelling business. Everything is a narrative. It's the oldest form of communication.
Condense, if you will, the 50,000 years of man's recorded history. 10 years ago, man emerged from his caves.
What appealed to me conceptually was the stories of people's lives on a universal basis.
Only 5 years ago, man learned to write. The printing press came this year.
People want to get a sense of who you are.
Last month, electric lights and automobiles.
Traditional business and venture capital investments don't dig that deep.
Some would have us stay where we are a little longer.
What's your value system? And why are you doing this?
We set sail on this new sea because there is new knowledge to be gained and new rights to be won. And they must be won and used for the progress of all people.
The moonshot is all of us who understand the urgency and the need to reimagine the fight for the 21st century. How can innovation in science, medicine, and technology transform the healthcare system to deliver better care and to save lives?
The lack of people who have no access to what I have. You know, I'm a former CEO. I happen to have Parkinson's. Look at me now. So, how can anybody argue that a poor child born in Iraq, drinking dirty water with no access to medical care, why is that a good thing? If we don't solve that, then all the political systems, the right, the left, are meaningless.
Right now, we are at an epic moment in time. At StartUp Health, we are in full support of not only the cancer moonshot, but we've created additional moonshots that are going to affect the health and well-being of everybody on this planet.
Health moonshots, not just digital health and wellness companies. We're organizing and supporting a global army of entrepreneurs in StartUp Health.
Healthcare has been incredibly siloed. Everyone is trying to protect their own ideas.
Information is not available because it's contradictory, it's inaccurate, it's all over the place, you don't know where to find it, when you need it, you don't have it.
At the same time, there's this digital revolution taking place. There's this pressing, urgent demand for new solutions.
Mindset matters most. The most successful entrepreneurs and companies have what we call the health transformer mindset.
The transformation of healthcare can only be done together, in unity and in collaboration.
Why some say the moon?
We can bring access to care to everyone in the world, no matter how much money they make, no matter where they live.
Why climb the highest mountain?
We want to invest in and support in every health transformer, every entrepreneur of consequence for the next 20 years.
It's about the everyday person who is going to have some innovation or invention that changes the world in terms of health and wellness.
It's about to dream a dream that's impossible.
Millions of people are praying that we succeed. Every damn moment counts.
Okay, yeah, we can see you coming down the ladder now. Roger. Clear.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
Please welcome to the stage StartUp Health's president and co-founder, Unity Stokes.
All right. Welcome to a new decade, 2020. Welcome to the 8th annual Startup Health Festival. To all of you on live stream, welcome. Thank you for joining us. I'd like to start by thanking all of you. I'd like to thank you for sharing your time with us. I'd like to thank you for being a part of the Startup Health community. And I'd like to thank you for doing what you do. Everybody here, we all care about the same thing. We're all trying to transform health. Over the next 2 days, we're expecting 2,200 guests. 2,200 guests. I don't know how we're going to fit everybody in this space, but we're going to do our best. We've got 275 founders from startup health companies here that are going to be here over the next 2 days. And one thing that's really cool, we've got innovators, investors, entrepreneurs representing 35 countries. So it truly, truly is a global community. Here's a cool fact that we're really proud of. Unlike in the tech world or even across the street, here, 41% of startup health companies participating have a female founder or co-founder. 41%. Soon, hopefully 50 or even 60%. So we're working hard on that. Incredibly, and this exceeded our own expectations, there's already more than 2,300 pre-scheduled meetings taking place upstairs over the next 2 days. 2,300. There's still time to book more meetings using the Startup Health app. Again, I don't know if there's going to be enough tables, but we will get creative with you, standing meetings, whatever it takes. There's health transformers here that need your support. They need your wisdom. They need your guidance. So please take time to meet with them. Over the next 2 days, we will learn from a diverse group of extraordinary people. We've got over 40 fireside chats taking place here on this Health Moonshot stage. As Steve knows, about a year ago when we started planning today, we said, let's simplify. Let's do 2 or 3 fireside chats. There's too many awesome people in the world, so somehow there's going to be 40 fireside chats here with health transformers, entrepreneurs, global leaders, CEOs, executives. We got caregivers, patients and their advocates, and we even have a 4-month-old baby, which I'm really looking forward to. It's true. And as you may have seen the cameras around, but if you tune in to Startup Health TV, we're also going to be featuring 100 interviews over the next 2 days with startup founders. 100 interviews, broadcasting live downstairs. If you get a chance to join in on the fun, hope you also do an interview. And hot off the press, Startup Health Magazine. This is issue number 5. This features the superheroes of our time. This features health transformers. These people are upstairs, they're here, they're downstairs. This is you. We're trying to share your stories with the world. So hope you all get a copy of that and pass it on to other people as well. So where are we? We're nearly a decade into this mission at Startup Health, working to achieve 11 health moonshots. And I gotta say, it's hard. It's really, really hard. And it takes a lot for me to say that. But as everybody here knows, trying to transform this industry, especially from the entrepreneur's perspective, it's not easy. Over the past decade, the Crine families and Stokes families, the Startup Health team, our partners, and a community of hundreds of health transformers, we're going all in. We are all in on what many believe is an impossible dream. We're trying to improve the health and well-being of everyone in the world by 2040. You know, we set out to build a global platform to invest in and unite thousands of health transformers. These are the world's entrepreneurs dedicated to achieving health moonshots so that together we can impact billions of people's lives. It's been rewarding, it's been challenging, but here's our message. Might be the 8th annual Startup Health Festival, but we're just getting started, and we need all of us to work together. So, to kick things off, my business partner of over 20 years, brother from another mother, co-founder and CEO of Startup Health, is going to share our plans for the next 20 years. And he's going to share a concept that we've been working on called health moonshot investing and really share why we are more energized than ever. Steve?
Great job, man. That was awesome. Love it, brother. You too. Good morning. Good morning. Good afternoon. For those watching on live stream, I am honored once again to, with Unity, welcome you to not only the Startup Health Festival, but coming into our world for a couple of days to see what we're doing all 365 or 366 days of the year. And as Unity explained so eloquently around why we're doing what we're doing and what we've jam-packed into the next 48 hours, we thought it would be helpful to set some context before we do our first fireside chat. And as part of that context, this idea that we began back in 2011 was to really set out and figure out how to do the impossible, the seemingly impossible goals of achieving health moonshots. And of course, the technology we know didn't or doesn't or won't exist for a while. For many cases, the data, the collaboration, the unification, but we really knew that we needed to do something meaningful to try to pioneer a new way of thinking about how to invest in health innovation. And this idea of health moonshot investing really goes back almost 60 years to when JFK proclaimed not only to Congress, but to everyone around the world who watched that famous Rice University speech, that by the end of the decade, we're going to land an American on the moon and bring him safely back to Earth. Now, the technology didn't exist, the funding didn't exist, none of the things that would ultimately allow us to merely 8 or 9 years later land Neil Armstrong on the moon. And what was really fascinating, if you go back and you really understand what happened back then, there was a whole bunch of different things at play. Many people will say some of the instigation was because of people beating us to the moon. Some people talked about the idea that we were doing something that was going to waste a lot of time, money, and energy. And most people started out saying it was impossible. But what is incredibly inspiring is to look at the fact that 400,000 people from 20,000 companies over 8 or 9 years helped allow this picture to be taken of Neil Armstrong. And what's fascinating about that is that everybody hailed Neil Armstrong as the hero, but behind him were 400,000 people. And that is very much the core of why building a global army of entrepreneurs and innovators and investors for us became so clear that this is what we needed to do. But what really struck a chord for us was what happened at home right when JFK was making this broad proclamation of doing this incredibly impossible goal. Neil Armstrong's daughter was diagnosed with a brain tumor, and less than 3 months later passed away. So could you imagine, in 1961 and 1962, this man losing his daughter, yet 8 years later, standing on the moon, thinking, and everyone around the world thinking about this, but not knowing behind that spacesuit was a broken man who, if he could have given up all of that, would have done so in a moment, would have given everything to have his daughter back. And so the theory behind everything we're doing is that no matter how much money you make, no matter how much money you accumulate, no matter who you know, no matter what you could achieve, it doesn't matter when it comes to your mother or your father or your sister or your brother or your child or your friend or yourself. And so this is a picture of Bill Gates and his father, who, for those who haven't seen, his father was diagnosed with Alzheimer's, and his father's progressing through the stages of Alzheimer's, and Bill is making a significant focus on investing in the Alzheimer's moonshot, the idea of actually curing Alzheimer's. And what most people don't realize is not that long ago, maybe 10, 15 years ago, Bill's mother passed away after being diagnosed with breast cancer. So think about this. Guy's got all the money in the world, but loses his mother to breast cancer in her 60s. Father's gone through stages of Alzheimer's, and it doesn't matter that he is the wealthiest man in the world. So that is at the core of why, instead of looking at the moon and seeing if we could do another moonshot, we wanted to look back at Earth and see if we could take Earth and think about all of the 7.5 billion or 8 billion people on this planet and see if we can focus on achieving 11 health moonshots. And the idea of every one of these 11 moonshots contain dozens of other sub-moonshots. They're big categories like access to care. So everybody in the world, no matter how much money they make, no matter where they live, can access the very best care in the world. Reducing the cost to zero, bringing it down so that whether it's technology, data, or services, we are making healthcare accessible and affordable to everyone on the planet. Curing disease and ending cancer. The idea of prioritizing women's health and children's health, using nutrition and fitness and brain health as inspirational health moonshots so that we can all rally as entrepreneurs, as investors, as customers and partners, as researchers, as clinicians, really leaning in so that mental health and happiness, longevity and addiction, when we look back in 2040, we will be able to say it was achieved because back in the 20-teens or the 2020s or even the 2030s, we focused on doing it together, not doing it in siloed efforts as organizations or individuals trying to do it alone. And so the Health Moonshot investing model is designed to do a lot more than invest money. So when I said looking back at Earth and seeing what we could achieve, we thought building a flywheel around the definition of Health Moonshot investing so that you could understand investing capital, which is what most entrepreneurs just think they need, is actually just the beginning. So we're investing in entrepreneurs all over the world at scale. We invested in 20 entrepreneurs over the last 90 days. We've invested in over 300 entrepreneurs over the last 8 years, and we're just getting started. The idea of investing capital is just the beginning, though. Investing in uniting the entrepreneurs together in a global army. Investing in broadcasting their stories of progress. Unity talked about the magazine, StartUp Health TV, all of these things, broadcasting stories of progress so that you can read about them, listen to them, watch them, tell their stories of progress. And whether you want to join them in that effort, whether you want to collaborate, whether you want to invest, the idea is to really rally around the hope and the opportunity for us to all do this together. So connecting with a global network of investors and customers and partners is a big piece of the equation for Health Moonshot investing, as is finally the ultimate word of collaboration. The idea of two people or two organizations or dozens or hundreds or thousands of people collaborating, not trying to do it alone, bringing their unique abilities to the table so that each one of us has a role, just like landing Neil Armstrong on the moon was done by 400,000 people. Each one of these health moonshots is going to be achieved by us all working together. So we've built a platform to do just that. You're seeing one of the many pieces of the platform, but investing in entrepreneurs at scale, uniting them together as a global army. We've got 7 different things that we do for all of the entrepreneurs so that they can tap into the power of the peer network. The idea that they're not alone. The idea that they have a personal board of advisors, whether it's on an 8 to 10 person video chat or whether it's coming together in a room like this, they're not alone in doing this. And that's a big piece of it, as is our media network that's designed to tell these stories. So what most people don't realize is that when you open up the magazine and you see those ads, and when you actually watch a podcast or come to any of our events, we don't do advertising and sponsorships. Every ad is a house ad for our companies and for our investors and partners to promote them and the great work that they're doing. We don't believe it is important to take advertising dollars to do that. We think it's important to take aligned organizations who for the next 10 years or 20 years are really committed to achieving health moonshots. So 315 investments we just made on Friday, our 315th investment in 25 countries. It's fascinating when you start to meet the entrepreneurs and you see different mindsets and different business models and different things shared around the world by entrepreneurs who one day were alone and the very next day they're supported by an entire community who for the last 8 years and for the next 50 years are going to be committed to achieving health moonshots with the same ambition and the same values and the same goals of doing this together. So look at these statistics, and this is one of the things that I'm most proud of. The idea that in the last 8 years, 22 of our companies have been acquired, but that's not the big deal. The big deal is that over 8 years, 315 investments, 252 companies, that's 80% of our investments, are still active. Most of them are here. And while they might not all be rocket ships to the moon, per se, like the unicorns in other industries, they're working tirelessly on something much more important than just a game or an app to let people share pictures of things that ultimately aren't going to matter at the end of the day when that diagnosis comes in or that prognosis comes in. So this is just the beginning. It's the first 8 years. And the next decade and the decade after that, we're going to be able to look back, and without a shadow of a doubt, by 2030, the entrepreneurs that we've already invested in, the entrepreneurs that we're going to keep investing in as we do thousands of investments all around the world, are going to work on the ultimate report card, which is, if you haven't read the UN Sustainable Development Goals, 17 goals that act as a report card for all of us to measure ourselves 10 years from now. In 2030, look at those Sustainable Development Goals. There's one dedicated specifically to health. It's number 3, and it contains the roadmap for all of us to be able to make sure that we're not just looking short term. We're looking at a decade out and saying, what can we do together? And we believe the decade after that gets enabled even more so that we can achieve the health moonshots. So we're just getting started. For those of you who were with us in 2012, our very first year here at JPM, and really when we launched the Startup Health Festival in earnest in 2013, you can see that we made a commitment, not only to each other, not only to our families, as Unity said. We made a commitment that we were going to spend the rest of our lives going all in on making sure that we can not only organize, invest, and support a global army of entrepreneurs working on health moonshots, but we can bring together all of the people and all of the power that comes from linking arms across the aisle, across the country, across the world, to make sure that we're doing this together. So, as part of the kickoff for the festival and our fireside chat, I'm going to ask you to do a little exercise. For those of you in the room who are passionate about or interested in or already excited about one of these moonshots, I'm going to ask you to stand up when I call the moonshot. And I want you to look around the room as I do this. But for those who are interested, excited, already working on, already investing on the Access to Care moonshot and the Cost of Zero moonshot, please stand up. Who's working on the Cure Disease or End Cancer moonshot or wants to be? Everybody still keep standing. No one's sitting down. Cure Disease, End Cancer. Women's health and children's health. Nutrition, fitness, brain health. Mental health and happiness. Longevity and addiction. And now for those of you who haven't chosen or selected or figured out which moonshot's most exciting to you or most passionate, you stand up too. Everybody stand up, all right? Now, I want you to do something. You might think it's a little funny, a little odd. For those who've been here before, you know what's coming next. I want you to link arms to the person to your left and to your right. Now, if you're not linked to your left or to your right, so there's a little aisle, I want you to link arms. Keep going, all the way. All right, and if there is anybody not linked right now, please link up, because we're not moving on until everybody's linked up here. Does that mean you two? Yes, it's going to in 2 seconds. Thank you. All right, so now we're going to link in here. Unity, link in here, right over here. We're going to switch arms. Come in here. So I want you to link with Justin right there. All right, we're linked together. So here's the idea. None of these moonshots are achievable alone. So if you work in an organization, if you're an investor, if you're an entrepreneur, and you're like, yeah, I got this, you're absolutely wrong. This is going to happen by linking arms with everyone around the world who's passionate about, excited about, and confident about achieving health moonshots. And I am positive that when we stand here at the Startup Health Festival in 2030, and we're here in 2040, we're going to be able to look back and all the progress is going to come from those that believe that with the right mindset, the right vision, and a community of people who are as passionate, as committed as we are to achieving health moonshots, it can be done. Thank you so much for being here and spending the next 2 days, spending the next 10, 20, 30, or 40 years doing this with us. Thank you so much. Have a great day. You stay up. So, you got to see the energy shift that comes from this idea of linking arm in arm. One of the things that I want to do to kick off the first fireside chat is just give a little context to the gentleman I'm about to invite up here. This entrepreneur, this innovator, this storyteller is 15-time Emmy award-winning filmmaker, Nick Nanton. Please, Nick, come to the stage. Everybody welcome him. And I want to give some context as we begin. We're flipping here. You're sitting here. I'm here. Sorry. So I want to give a little context. Nick, if you haven't seen any of his films, his documentaries, just check out Amazon, Netflix, Hulu, the movies, or Broadway to see the incredible work of Nick Nanton. I'm going to let Nick explain why he's up here because it's pretty fascinating. But over the next few minutes, we just want to sit down and share a little bit more of the context of why there's cameras up and down, especially on the third floor where you're going to see Nick, and give context to really the idea of telling the health moonshot stories. So thanks, Nick.
Thank you all. All right. Well, thanks for having me. So I'm making a film about what you are doing. Part of it is selfishly because I want to spend time with the smartest people I can. But as I've been around the world, made more than 60 documentaries on entrepreneurs from every realm, one of the things that I realize is that you are inspiring health transformers today, but there's generations of other industry transformers that are out there in the school system, somewhere right now being told they're broken, being told they don't fit, and they're the ones that are going to change the world. So what I want to do is leave a trail through this film and others that can be breadcrumbs to others who are looking to join a community like this. So I'm excited to be here, man. Let me ask you this idea first, this question first, Steve. So you guys have this idea of we can do more with healthcare now with the convergence of technology and everything coming together, and you create this vision. When you first share this vision with the first, second, third person, what do they say to you?
Well, it depends who you share it with, right? Who I shared it with. And I think, I think like most entrepreneurs, when they share crazy, really seemingly impossible ideas, most people don't understand why we're trying to either be so ambitious or try to achieve something as impossible as health moonshots. But we try to make sure that the people we're telling it to have the right mindset. And so for a lot of it, whether it was our families, as Unity alluded to when he did his intro, our friends or those in our community, I think we were met with quickly a very easy way to sift through the kind of people we wanted to be around. So very quickly sharing that was a bunch of people that wanted to be involved and a bunch of people that thought we were nuts. And many of those people that thought we were nuts came around. That's okay. But the ones that don't move to the side, because I think what has been evident over the last 8 years is that it's working.
Love it.
So can I just add, in 1975, John Bogle launched the first index fund, and they called it Bogle's Folly. He was considered crazy. This is Vanguard, 1975. Just the concept of creating a new model, which we all know today is an extraordinary model. Also in the 70s, economist Muhammad Yunus, which he won the Nobel Prize in 2006 for micro-lending, microfinance, working to end poverty by rethinking how to invest capital in everyday people in Bangladesh. These are extraordinary models that have been deeply inspiring to us as we think about what's needed for health. It's a new moment. As Steve outlined, it's not just about investing capital. We do need to invest billions and billions of dollars of capital, but we need to do this in an index of all the entrepreneurs and innovators of consequence. We need to not treat them as individual entities. We need to unite them together around common goals and purpose, just like the moon landing mission. We need to broadcast and share their stories with the world, so that my mom can understand where the progress is being made, and people everywhere can support these health transformers. We need to connect them to the networks of customers and entrepreneurs that are going to really move the dial and help them scale globally. And we need to make sure that the capital is flowing to these emerging innovators to make it easier for them to get access to the financing they need so that they can focus on the innovations.
Love it. Now, one of the reasons I love your answer to that question is because it would be very easy for the hundreds of people here to say, well, they've had it easy. They didn't have any turmoil. And so one of my mentors one time told me, if you share your vision with someone and their first thing out of their mouth isn't, how can I help? You should probably just move on, right? So you've created a community here that is designed for that. We'll talk about community in a second, but I also want to ask you, Unity, you brought it up, microloans and microfunding. Health Moonshot investing has been being compared to that. People have been trying to help at-risk, underprivileged people for years, but something about that microloan formula made it suddenly click and work all the way around the flywheel. What did it take to create this system now that I do believe is the microloans of Health Moonshot investing? What did it take to create that?
So we're seeing the need. A new model for investing is needed because a lot of the venture money is de-risking. It's moving later. It's taking longer and longer for earlier stage companies to raise capital. There's models for banking for small businesses, but if you're trying to create an equity value company, a new source of capital is needed, right? So we got to unlock that capital. There's plenty of capital in the world to invest in health innovation. We're talking about a $10 trillion industry. Right? What we're doing, this is meant to be sustainable. This is meant to really grow and scale. And the opportunity is here. We just have to think about it differently. And just like Muhammad Yunus did when he recognized that there's all these people in Bangladesh that have these amazing ideas, these amazing opportunities to grow and grow out of the system that they're in. Health transformers have that same opportunity. If we just give them the fuel they need, if we just support them, if we band together and put wind at their back to all work together to achieve these health moonshots.
Now, you guys are creating an army of global health transformers. I've noticed that armies don't win when they don't collaborate. One of the things I think has been such a problem in many of these sectors, but health and technology are two that fall victim to it as well, is the loss of innovation due to duplicated efforts because of lack of collaboration. I noticed twice today already, I've heard this concept and seen a little bit of it, of circles, this idea of collaborating with a close-knit group so that it's not such a lonely entrepreneurial journey, and to capture the innovation that's happening and to springboard off each other. Steve, tell me a bit about what Circles is and why you think that's going to be the vehicle to move this forward even faster.
Yeah, so the genesis for the idea of Startup Health actually came from a couple of things that I noticed as an entrepreneur, as you mentioned, back in the 90s, when I realized how lonely it is being an entrepreneur, but if you can connect with, whether it's 8 to 10 people on a regular basis or access to hundreds, if not thousands of other entrepreneurs or people, you really feel supported and you feel much different than you do being alone. And so the idea behind not only the community of hundreds, soon to be thousands of entrepreneurs all over the world, is the power of 8 to 10 of those entrepreneurs getting together every month or every other month or even every quarter to really be a personal board of advisors. And this is actually not designed just to be about your business. It's designed about the things that come from being an entrepreneur, especially in this industry, and your personal life. And so Health Transformer Circles, which I'm really excited about, really came from my own experience and our own experience being in YPO, Young Presidents Organization, that have for 50 years benefited from the power of peer support. And so a lot of entrepreneurs not only don't have access to others that feel the same thing they feel, but are as ambitious as they are as confident as they are, and are trying to do something as seemingly impossible as they are, like achieving a health moonshot. So Circles and everything that we do to unite the entrepreneurs around the world, whether it's intimate as an 8 to 10 person forum that meets virtually every month or every other month, or coming together globally at Startup Health Festival or any of the events that are going all around the world, it makes each of these gigantic things just a little bit easier to do it with people that care, that support you unconditionally, and that from our standpoint are as committed long-term as you are to achieving that.
Yeah, I think the biggest opportunity we have, the biggest multiplier is collaboration, right? So much of the industry is siloed, protecting your own innovations, protecting your own IP. I am certain the solutions for many of these health challenges is locked up, sitting on a shelf somewhere.
Already.
Yep. And if we can break down those silos, understand and share together what's working, what's not working, reinvent the business models, learn what's working in India, bring it over here, learn what's happening in Finland, bring it over there, connect the dots. We will speed up the innovation cycles. We will be able to transform health and accomplish some of these health moonshots if we work together.
Now, I could do this all day, but I know I'm about to get the hook, but I have to have one final answer from both of you. JFK in a decade put a man on the moon. We're in a new decade right now. What's your vision for Startup Health by 2030?
This global army of entrepreneurs, investors, innovators, our partners who are committed every year to investing like we are in these entrepreneurs are not only able to look back and say we achieved the UN Sustainable Development Goals, but we're well on our way to achieving our health moonshots. And I wanted to say one thing as we wrap up about the power of mindset. And if you've been to any of our events or festival, for all the entrepreneurs who are in Startup Health, we obsess about something we call the health transformer mindset. And the power of not only mastering the mindset yourself so that you can every day wake up and fight the fight and overcome the challenges and the negativity and all the things that are standing in your way, but you can attract everything you need. The investors, the customers, the partners, the team members, the co-founders that magically, like you are going to be there right by your side. And so the health transformer mindset and mastering that, and also looking for others who share the same mindset and staying away from those that don't. By 2030, if everybody here in this room and everybody watching on live stream were committed to doing that, I am positive, without a shadow of a doubt, that report card the UN came up with and outlined the 17 goals and goal number 3 about health, totally achievable and totally doable if we do it together. And I know you didn't ask about 2040, but I do believe that the groundwork we've laid over the last 8 years and the groundwork that we're going to leave and build and the foundation in the 2030s is going to be why in 2040 we can achieve these health moonshots.
If we have anything to do with it, by 2030, the world will see the superheroes of our time, not just as the great athletes of the world or the great political leaders of the world or the financiers or the big tech titans. They will be health transformers. The people dreaming impossible dreams will be the superheroes of our times, and we will all join together supporting them in achieving health moonshots.
Excellent. Thanks for letting me be here, guys.
Thank you, Nick.
My pleasure.
Thanks.
Please welcome to the stage Dr. Zubin Damania of Z-Dog Industries and Dr. Marty McCary, New York Times best-selling author.
Hey, guys. Nice. Marty. After you. Hey, everyone. So I found out like 5 minutes ago that I'm the moderator here. Whereas I thought...
My plus one.
That's right. I was his plus one. Now I'm the moderator. So I'm Zubin Damania. I was a Stanford hospitalist for years and years. Quit, moved to Las Vegas, worked with Tony Hsieh, had a healthcare startup called Turntable Health, which failed.
Did really well, didn't it?
Yeah.
Sorry
so I'm already ahead of most of these guys because I have the failed startup. Now I do a show called the Z-Dog MD Show on the internet, and we try to shine a light on bright spots in healthcare. And one of the bright spots I found was this guy here, Dr. Marty McCary, who is a Johns Hopkins professor of surgery and does islet cell transplants. By the way, for those who aren't surgeons, you never touch the pancreas. It's a terrible idea. He does it for a living. Okay, it tells you that he's fearless. And you wrote the book Unaccountable, which Fox's The Resident is based on. And I understand you're a consultant for The Resident.
Not when they do CPR on the show.
I believe they were compressing a stomach the other day. So, but your latest book, The Price We Pay, is what really intrigued me because, first of all, it made me think you're going to need professional security. Because what Marty does is he shines a light on the fact that our major hospital systems are suing patients who can't pay the inflated charge-master bills they're given. These are patients who work at Walmart, who are unemployed. These are people who can least afford it. And many people on the front line, physicians like myself, don't even know that it's happening. How did you even get involved in that? Because you had a pretty cush gig at Hopkins as a tenured professor.
Well, first of all, if I do get killed for any reason, all my passwords are ZDog number 1.
We have something in common there, too, then, I see.
It's not being recorded, is it? I think, first of all, great to see you again, Zubin. If you guys have never seen the readmission video or any of the ZDog videos, I mean, if you guys seen, like, the readmission video, it's like, I don't know, 13 million views. Moral injury video talking about how burnout is really a form of moral injury in healthcare. 40 million videos, the nurse video, something like that. So I just love people who want to push the field. And we got too many people in healthcare just collecting their paycheck every 2 weeks and not asking what's wrong with the system. And I think that's why people see you as a voice, because they're frustrated and they want to do something bigger and get off the treadmill. And you got off the treadmill. But what I did was basically in the course of our research is discovered that these prices that we have are in bills that are uninterpretable by the hospitals that are issuing the bills. And when we challenged hospitals and just inquired, hey, this patient got charged $80,000 for an operation where the reference-based price is $20,000, they would frequently say, invariably, look, Marty, nobody pays those prices. That's the sticker price, and we work with everybody individually. Well, first of all, we said, what is this crazy game we've inherited of inflating prices for the purposes of offering secret insurance discounts? This is a crazy game. We've got good people at hospitals working in a bad system. This system has gotten completely out of control. So we started asking the question, are people really expected to pay these prices? And discovered that some hospitals, about 20 to 30% in the JAMA study, will aggressively go after patients with what I call predatory billing, if we can use an honest term, and price gouging, and sue them in court to garnish their wages. Most common person sued was a Walmart employee, followed by food service workers, postal workers, and even hospital workers like housekeepers. So we started telling the story. And we went around the country. I defend any patient that's being sued in court pro bono for free. I will go to those judges. We win 100% of the time, and we will keep going to stop predatory billing once and for all in the United States. And so we're going around. Thank you. It's really public accountability. That's what we're doing.
And it gets to the heart of this thing, right? These folks are trying to innovate. We're trying to actually do what America does really well, which is compete, innovate, bring things to the market that are actually disruptive and actually increase efficiency and provide value, right? At least some things do that, right? Yeah. And what happens when patients don't trust us, when we have these opaque money games, when our system is so dysfunctional, first of all, it creates what you referred to in my moral injury video. It was a video where I said, it's not burnout when they say we healthcare professionals are burning out. That's a victim-shaming kind of thing. It's really moral injury, which means it's good people with certain values in a system where they're asked to do things that are entirely antithetical to their values. We serve so many masters, the employer, our patients, our family. And when you hear something like this, you realize I'm billing a 99239 discharge 35-minute code. That's generating a fee for the patient of this that then is causing my corporation that hires me to go sue this patient. And then the patient goes medically bankrupt. Well, now, not only is it moral injury, it's moral devastation. And on top of that, so what's going to happen when this outrage reaches a level? If we don't own it and take care of it, what's going to happen? The government's going to come in and be like, hey, we're just going to socialize this. And then all of us are screwed, all right? Because we can do this in a way that nowhere else in the world has done it, which is American innovation, universal coverage, all of us competing to provide the best care that actually prevents disease, that's affordable, and that's technology enabled instead of enslaved. And we give that up if we acquiesce to these money games that we currently play.
You know, people think docs are burnout, and we've got record high rates of burnout because we're working too hard. But I would suggest it's not that. I would suggest the moral injury argument that you've articulated very well is it's the loss of autonomy. It's doing stuff that we know doesn't matter. It's not having control. That's what the frustration is with the electronic health records. That's what people are talking about. That's where they're seeing you as a voice in this incredible message where you're saying, look, we committed our lives to working our tails off to help people. And what we found is now we're in this system where we lose autonomy. I've really enjoyed getting to know you, but I think it'd be helpful for people to hear. At some point, you basically said, I want to get off this hamster wheel and try to do something with impact. And I think you and I have seen too many episodes of the TV show Silicon Valley to ever do a startup, so right. God bless you guys.
Yeah.
But you decided to, do something. And so what was that aha moment?
I wanted the doors that go like this, Marty, instead of the doors that go like this. No, what it was for me, so when I was at Stanford and Epic went live, I was there on call that night. And all these patients lining up, new residents, it was very stressful. Epic goes live, we're trying to figure it out. All of a sudden, I found that I'm treating a computer screen instead of a patient. All of a sudden, I found I'm treating a computer screen to get through my day instead of teaching the residents how to do medicine. And so what you said about, hey, we're actually pretty resilient, we actually work pretty hard when we care about what we do and it feels like it matters. Well, clicking boxes in a stupid electronic health record that's a glorified cash register that does nothing for patient care, that sucks data out and gives it to people that don't know what to do with it, that doesn't feel very good to me as someone who gave up my 20s to care for human beings. So what you guys are doing, if you are doing something that helps solve that actually takes something off a clinician's plate, that actually adds value to this and allows us to actually work smarter and not harder, then you will succeed, right?
We get the brightest, most creative, most dedicated people that go into medicine, and they're driven by compassion. What happens? Do they change that mission? Do we beat the Krebs cycle into them so many times that they have become these robots?
Pyruvate. Yeah.
Pyruvate.
We do condition them. So some of our biggest fans of our show, are medical students. And when I go speak to medical students, they all tell me, they're like, we're learning a bunch of stuff that doesn't seem to matter, half of which is going to be proven wrong, and they don't tell us which half. We're being conditioned, and then the American Medical Association makes a statement like, maybe we should teach medical students how to use the electronic health record earlier so they're more inclined to be effective.
That went over real well.
That went over really well. They had to issue an apology, and I did some rant, and probably am never going to be employable again, but it doesn't matter. And the idea that, again, we can change medical education, we can focus on what matters. We really do need to create more primary care physicians who understand prevention, that also there is a mind-body connection, which we ignore, because it's very hard to do surgery on the mind-body connection. It's very hard to remove and accurately put back. And so
I can do surgery on anything, by the way.
You know what? I believe you.
Yeah.
I would trust you with doing surgery.
Got the flu, I can operate on it.
Steel heals and it can't hurt you if it's in a bucket, they say. But all of this stuff, I think, no wonder medical students are upset. They're looking at their mentors and going, these guys hate their lives. They're telling me that this is the future of medicine, right? So if we don't start doing something, this is why I think what you're doing this book, when I read it, Marty was going to come on the show. He sent me the book. I'm like, great, another hardcover book that I have to pretend to have read before I do the show. I started reading it, and I'm like, wait, what? I'm like, and the thing that made the book particularly impactful is not just the outrage. You need that. So you're running a startup. You better get people outraged emotionally about the problem you're trying to solve. But then he says, okay, now you're outraged. Here are companies that are doing it correctly. Here are bright spots. And we try to do that with our show too. Let's get a bright spot on the show, whether it's something that actually is artificially intelligent instead of just slapping an AI label on it, or whatever it is, if it's going to help prevent violence against healthcare providers, that sort of thing.
The system just seems so broken that when docs are going into med school now, they're literally telling us, we don't plan to practice full time. I mean, I think I heard a statistic that half of our medical students at Johns Hopkins do not plan to practice full time. Why would they practice in office-based medicine, full-time primary care? God bless those people. I could handle 1 hour of that in med school, where at the end of an hour, I saw 4 patients between 8 a.m. and 9 a.m., 15 minutes each. Each patient, I was like, let me get back to you. That's a deep issue. We're going to talk. I'm going to ask somebody about that. I'm not sure. I'll get the answer. And at the end of 1 hour, I literally went to my preceptor, and I'm like, are we doing this all day? Because I'm spent. I'm burnt out from 1 hour. And people do that for a living. I mean, you did that, right? Primary care, office-based medicine. And I think people are saying, how about these relationship-based clinics? How about IORA and ChenMed and Oak Street and Landmark? And how about this relationship-based clinic that gets at the underlying root causes of disease? And how about talking about sleep? May contribute to dementia and Alzheimer's. That's what we're finding in our research. It contributes to high blood pressure instead of just throwing meds at people. How about we talk about food? Things that we have never really had the funding to study. And people are now saying, hey, let's get involved in that. Let's talk about that.
Yeah, and this idea that people are dying more of diseases of despair, so our life expectancy is decreasing. Hey, here we are, the smartest kids in the room. Why is America so screwed up? The people are dying of suicide, drug addiction and abuse, these preventable chronic diseases.
One of the biggest problems I see in seniors, public health problem nobody is talking about, loneliness.
So Vivek Murthy, former Surgeon General, came on our show and talked about loneliness. And the most emotional part of that episode is where he talked about growing up lonely, being isolated, and then you project that on a 70-year-old person living in poor socioeconomic status. They're the only person there, no one's seeing them. Of course they're unwell. The mind and the body are one thing. Of course they're unwell. How are you going to solve that? Well, we could do hotspot medicine. Well, the data shows that doesn't work if you don't have the social structure to support it. So in this country, we medicalize our social problems. We think there's an app for it, but there really isn't. The app is bringing back communities and connection and then enabling it with technology that makes us more efficient, more connected.
Do you think people are seeing this big gap in medicine, this sort of pill-popping culture and this lack of addressing the underlying root issues? Is this the movement in healthcare to move towards addressing the real source issues?
I think people are really good at self-deception, denial, and wanting a simple answer. And I say this from personal experience. So, I lied to myself about who I was. I'm a Stanford hospital doctor up until the end, when I realized, no, this is going to kill me. I can't continue to be on this hamster wheel doing stuff that feels wrong, even though Stanford's a fantastic institution. It's not picking on Stanford. It's just the fact that our system is so jacked up. You have to unplug. Well, most people would rather the comfort of being in denial about who and what they are, and so a pill or a quick answer will allow them to continue to do the stuff that hurts them. And until we address that, then if you want to have like a Medicare for all you're doing is paying for people to do the wrong thing to themselves at scale in a broken system that you now codify. Fix that, then I don't care who pays for it. It can be the government, it can be whoever.
We have a study out of Johns Hopkins asking the question, what percent of all federal spending goes to healthcare in its many hidden forms? And do you know what the answer is? 48%. Half of Social Security checks now go to Medicare copays, deductibles, coinsurance, and uncovered services. The Defense Department has its own healthcare system. That's 8% of their budget, separate from the VA, which is 4.5% of federal spending. And we pay for healthcare benefits for 9 million federal workers. And interest on the debt is in part interest on the healthcare spending debt. 48% of all federal spending goes to healthcare. So when I meet with the politicians, the candidates, and they say, hey, let's talk about what more we can do in healthcare, I tell them, we can keep throwing good money after bad into the broken system, or we can cut the waste. And right now, we're at 48% of all federal spending that goes to healthcare. What are you proposing as a candidate? You increase that to 50, 90, 500%, because that's still not going to cover some of these ideas that are out there. How about we cut the waste and let the free markets work? And by the way, people are hungry for honesty in pricing. I mean, billing quality is medical quality, and financial toxicity is a medical complication. And in order to rebuild the trust in American hospitals, we've got to address our pricing failures. Right now, 64% of Americans avoided or delayed medical care for fear of the bill. That's a disgrace. We have a public trust crisis.
I think in our 5 seconds left, that's a perfect call to action to think about. We can fix this. We can talk about problems all day, but you guys and everybody together, we can actually together collectively fix this. Our job partially is to shine lights on things that are working, so hit us up, zdogmd.com for me. Where can they find you, Marty?
MedPage Today. I'm excited about this new role at MedPage Today. And if you guys have not seen these videos, check them out. I mean, what is like 50 million collective hits on these different platforms. When you guys see the videos, you'll see why. It's like a gateway drug to YouTube.
It's a death spiral, people. Enjoy it. Thank you so much.
Great. Thanks.
Thanks, Marty.
Please welcome to the stage Sarah Halubeck, CEO of Luminary Labs, and Ed Simcox, Chief Technology Officer of the U.S. Department of Health and Human Services.
Good morning.
Good morning.
How you doing?
I'm awesome.
I'm doing awesome. How are you guys doing? Okay, come on. How you doing?
How about that last fireside chat, guys? Huh?
Gateway drug to YouTube.
I highly recommend that you go check out Z-Dog's videos if you haven't seen those, and I highly recommend that you check out Marty's book as well. It is a real game changer, and it's very disruptive in a very positive way. Anyway, little editorial there.
Agreed. And so today we're here to talk about something that is really quite important and very frequently surprising. So when we say chronic disease in America, most people immediately think of diabetes, heart disease, and increasingly cancer, as people are living longer with cancer. And even though 1 in 7 Americans are living with kidney disease, and it's the 9th leading cause of death in America, we rarely talk about kidney diseases. So why is that, Ed?
Well, that's a great question, and that's something that we spent a lot of time thinking about. 1% of the entire federal budget every year. Marty was just talking about different percentages of the federal budget that go to pay for health care. 1% of the entire federal budget every year goes to pay just for dialysis treatment in the United States. The reason is because most dialysis is provided by CMS, through Medicare. And that's more than that's more money than the entire budget for NASA and the Department of Commerce combined, just as an example, just to kind of put it into context. And we have seen no innovation in this space, especially around dialysis, since President Nixon in 1972 signed the end-stage renal disease bill that allowed people access to dialysis through Medicare. So number one, I think we got complacent and comfortable with the system that was providing care. And listen, dialysis was a miracle therapy for its time, but it hasn't changed in 60 years. The underlying technology is exactly the same. We've miniaturized the machines a little bit. We've added some new filtration technologies and things like that. But to get back to your question, why is it that we don't hear a lot about kidney disease when it's the 9th leading cause of death in the United States? And I think there are a few reasons. Number one, it's downstream from a lot of other chronic conditions. So basically, cardiac issues and diabetes contribute quite a bit to kidney diseases. And when we say kidney disease, understand that there are preventable chronic forms of kidney disease, but there are also other causes, genetic causes to kidney disease as well. And we don't want to lump them all together. But a significant portion of kidney disease is downstream from cardiac issues and type 2 diabetes. And so that's why I think it doesn't get as much attention. Another reason it doesn't get as much attention is because it's because of the way that we've paid for it in the past. People don't have a lot of visibility to that. You know.
Well, that's going to change.
It is.
So
it is.
Last year, an executive order was issued to encourage people to start addressing this problem because now we have new tools and ways of working at hand. So can you unpack that for me a little bit?
Sure. So I'm proud to say that the president signed an executive order last year to address kidney care in the United States. It's called Advancing American Kidney Health. And just to give you a little bit of background and perspective on executive orders, so there have been approximately 15,000 executive orders in the history of the presidency, and there are 12 that are specific to healthcare. But this is the first executive order ever to take a comprehensive approach to solving a particular disease state or set of diseases. And we realized that we had a really big issue to tackle, and we needed to tackle it from kind of an ecosystem approach and look across the continuum of care, look at what patients go through, look at the state of the science, and most importantly for CMS and for HHS at large, look at how we pay for this care. So we're rolling that out now. We have new rules coming out through CMS. We have basically two rules. One is a mandatory rule, and one is an opt-in rule model. And the opt-in model has basically three streams of payment. I won't get into the nitty-gritty details on how that works, but understand that a lot of people are working very hard to figure out how to shift from paying for a unit of care to shifting to value to really positively impact patients. So there are really three parts. I just mentioned the new payment rules that are coming out. Another one is around prevention and awareness. So we have a real issue with primary caregivers in that while they do understand type 2 diabetes and they understand other well-known disease states, a lot of them don't quite know how to address kidney disease in its earlier stages. In fact, most of the time, people don't learn that they have kidney disease until around stage 4 of the disease, or actually when they go into kidney failure. So we have a lot of work to do to educate primary care as well as educate patients so that they can become better advocates for themselves and more curious about what kidney disease means to them. So that's the second part. And then the third part is really around transplantation. So addressing how people are able to get organs. So dialysis, again, is great for what it is. It's a brutal therapy, but really the best therapy is a transplant. And so we have issues that we need to address there. We're wasting organs in the United States, for instance. The supply chain is broken. And a lot of this has to do with the government and rules. The way that we evaluate organizations that procure organs and deliver them to recipients The rules are arcane and they're old, and they create disincentives, and they create a perceived risk among folks that are procuring those organs. So what we're doing here as part of the executive order is helping to de-risk de-risk the environment and get more organs to more patients. Right now, what we see is we're wasting a lot of viable organs every year, which means people aren't getting those. Another thing I'll say is that approximately 724,000 people have end-stage renal disease, and 100,000 people go on to dialysis every single year. And within 5 years, half of those people will be dead. So we really do need to focus on organs, getting more organs to people for transplant.
Yeah. So I'm going to lay this out very simply. New rules equals new opportunities.
Yes, absolutely.
Inventors, investors, the ecosystem at large can play. And this is very reminiscent of 10 years ago when Startup Health was founded, and I remember that moment where the federal government did a lot of work to share with the community what is possible versus what is not possible. So I would take Ed's words to heart and know that there is a lot more that will be possible, but it will require you. So let's talk a little bit about the ways that people can engage and perhaps speak to KidneyX.
Yeah, so we heard from Unity today about the Moonshot program, right? Multiple moonshots and then the principles that surround those moonshots. And KidneyX is really my office's moonshot and HHS's moonshot. I report to the secretary at HHS. There are 11 agencies within HHS. They include NIH, FDA, CDC, CMS, and so on. We realized that we had a lot of work to do around the kidney space. So we created KidneyX, and it's really our moonshot. And we modeled it off of the X Prize Foundation. So I'm sure all of you know the X Prize Foundation. The idea behind it is to raise money and give prizes out to drive solutions to intractable, pressing problems that humanity faces. And we thought that was a perfect model for us in this particular case. So we're starting with dialysis. I mentioned it's 1% of the entire federal budget, and I mentioned the issues associated with it. When I first got into this role, I had the opportunity to go meet with the White House Chief of Staff for Innovation. His name is Chris Liddell. He runs the Office of American Innovation. And I gave him my pitch deck for my office. Like, this is what I want to do. This is the value I want to drive for the American people, and how I hope that we can help people through innovation. And he, about halfway through, kind of closed it. And he said, hey, this is awesome. I understand everything you're doing here. I just want to ask you one thing. How are you going to help millions of people and millions of lives and or impact billions of dollars of taxpayer money? Because it's supremely important, and you need to wake up every day thinking about that. And that's exactly what we're aiming to do here with KidneyX. So KidneyX is a multi-prize project. We're starting with redesigned dialysis, and we've already given out 15 prizes of $75,000 apiece just for ideation, just surfacing ideas and beginning to build awareness and urgency and collaboration among innovators such as the folks in this room. The next phase of that is we're in the middle of that one, and that's our proof of concept phase. That's the bridge phase. As many of you are probably aware of that model. So we want to start to actuate these things. We want to see business models maturing and everything. So we're going to be giving away 3 prizes of $500,000 apiece in the second phase. And then the final is accelerating commercialization, and this is where we want to help people really coalesce, understand. We want to de-risk the environment for investment. We want to help people understand how they can commercialize their products, how to work with the FDA, how to work with CMS to get paid for your innovations, as well as what we know is that we're going to have people that have components of solutions. So we want to be able to help folks synthesize and combine their components of solutions to create a product in the end. And so that's kind of the motion we're going through, the flow of the prizes. So that's redesigned dialysis.
And you also engaged patients.
Yes.
Through the Patient Innovator Challenge.
That's something I feel very, very strongly about. So we need to understand what patients go through, right? So my office is responsible across HHS for human-centered design and design thinking, journey mapping, putting ourselves in the shoes of a user or a patient or customer, and we can't be successful without doing that. So we kicked off another prize, and this prize is to award patient innovators who many of them sit in dialysis chairs for many, many hours a week, and they come up with hacks for their own care. They have thoughts, hey, why does this device that's going into my arm look like this? It's painful and it's awkward. I think I could design something better. So we're working with patients and surfacing those ideas through that prize.
Well, that's what I love about this initiative is that it's an ecosystem play. And when we started working with HHS to support KidneyX, I was surprised at how many people didn't see themselves as part of the solution. And it boggles the mind. So whether you're a patient or a caregiver, a tissue engineer, data scientist, you probably have a way of contributing to KidneyX and ultimately to the solution.
Absolutely. And we know that ideas are going to come from many, many places. We're not even sure where they're going to come from, right? So we have, one of our prize recipients was a group of grad students at Stanford. And we also have seasoned scientists. We have nanotechnologists. We have people from really all walks of life. And I would encourage folks in the high-tech innovation space to think about your technologies, your services, your solutions in this context. Anybody in the room, think about what you do. And is there an adjunct available for helping us fix kidney care in the United States through KidneyX? The prizes are, you can go check it out for yourself and see. You can get detailed information at kidneyx.org and see if some of your technologies would be useful.
Yeah. So maybe it's good to close on what's coming next. So you recently, HHS and KidneyX issued an RFI for the Artificial Kidney Prize. And can you comment on the scope and scale of what that might be as you're designing it right now?
Yeah, absolutely. So I told you about the executive order, and the executive order directly instructs us to go after an artificial kidney. And that truly is our moonshot. We know it's not going to happen overnight. We know that we have a lot of work to do to get there. But we have a plan. We have persistence, and we have the 8 C's that Unity spoke about. So we're pretty bullish about this. So what does success look like? What success looks like is creating a way for us to get people off of dialysis using an artificial kidney. That could be an implantable kidney, or it could be a wearable kidney. And again, we're also looking for components of a solution like that. It may not be either one of those things. It may be something completely different. It may be a new therapeutic. It may be something digital. Nothing is off the table as we begin to explore this space and put this prize together.
And whereas the previous challenges ran for a number of months, the RFI suggests that this might run for years.
Totally.
This is a true moonshot, and that the prizes would be commensurate with the type of effort one would need. So that's very heartening to hear, the long-range moonshot. So maybe in closing, where can people find more information about these challenges, about opportunities to engage with KidneyX?
Yeah, so look up KidneyX, kidneyx.org, and go to my website at HHS, so hhs.gov/CTO, to learn more about our programs. And please don't be a stranger. The government, your federal government is open for business. That's why I'm here today, is to tell you that. So all of you all of the investors in the room that have been reluctant to invest in these health startups, understand we're looking for ways to de-risk that environment. We want to make everybody successful. And for you innovators out there, understand that we hear you and we know what you go through, and we want to help you out.
So it's not only possible, it's imperative, and the government's open for business. Thank you, Ed.
Thanks so much.
Thank you so much.
Please welcome to the stage Startup Health's Shauna A. Butler, nurse, economist, and host of the See You Now podcast.
So glad to be here amongst the innovators and the leaders and the health transformers, and a new word to add to your lexicon, the entrepreneurs. And I brought my posse along with me because when we talked about linking arm in arms and having that group, that set of people who are down in the trenches with you to help make these changes happen, that would be this group called the nurses. And I brought a few of them along with me today. So if I could invite my guests up here, Molly McCarthy, Christy Henderson, and Linda Moyer. Thank you. Give it up. So I want to set the stage a little bit for you here. So across the globe, I think you probably all heard, health systems are really struggling. They are strained to meet the current demands, and they're doing so in the face of current and really looming workforce shortages. There is a shortage of all healthcare workers, but where it's being particularly hit is within the nursing profession. So by 2030, the World Health Organization has noted that we're looking at a workforce shortage of about 9 million nurses, 18 overall with all healthcare workers, but 9 million nurses. And so if I put that on a daily context, we're going to need about 3,000 new nurses a day. So with that in mind, and the World Health Organization, their mission, their moonshot is to create great health, good health for all. And in order to do that, they've recognized that the only way that that's going to happen is focusing on the largest segment of the healthcare workforce, and that is nurses. They represent 50% of our workforce. And I want to say that again, half of our global workforce are nurses. And in the face of that, and recognizing this big moonshot, this big challenge, they have designated, and it's really a designation, but it's more of a call to action, that 2020 is the year of the nurse and midwife. And it is an international campaign that is focused on how do we elevate the role, the profile, and more importantly, move nurses into these roles of leadership and tap into this huge pool of insights and expertise to drive this transformation to moving us to health. So like I said, I brought my colleagues, my posse with me, because oftentimes nurses, we wanted to think in terms again of partnerships and collaboration. And another really important statistic is that out of that half of our global workforce being nurses, 90% of those nurses across the globe are women. And so oftentimes at the leadership of health leadership and technology companies, we often don't see, first of all in health, we don't see technology companies, we're increasingly seeing that. We haven't seen nurses and we haven't seen women. So I am here to help you see a new face of what healthcare systems are looking like. So in the context of that, Christy, how is it, can you give us in the context of your current and your past roles, how is it that technology companies are really tapping into the insights and the expertise and particularly the unmatched feedback loops that nurses have with patients and data?
Yeah, so it's, we're all here for the moonshot. We're all here to really fix an industry that's not working at all. And so as tech companies and all of you are looking to solve these problems, you're looking for people that really understand the problems that are out there. What are the gaps in the system? You're looking for people that understand the customer, who's our patient. You're looking for people who have deep understanding of operations so that that new idea, that new technology can actually be implemented successfully. And you need somebody that's trusted by all the stakeholders involved. That happens to be a nurse. And we're just a few examples of those that bring those skill sets to the table. It's not going to be easy, it's complex, and it's really hard, but nurses are in all areas of the health system. And so what you see and what most people think of when they think of a nurse is they think of that nurse at the bedside doing direct patient care, and they're needed there and they are there. But they're also CEOs, they're also helping develop product, they're helping build the business models that are bringing sustainable solutions to the healthcare industry. So it's an exciting time.
So can you share with us just a little bit, give context, like your current role and your past roles, because they're pretty darn impressive.
Yeah, so as a nurse, I started as a bedside nurse in the emergency department of a trauma center. And this happened to be in Mississippi at the University of Mississippi Medical Center. And from that, I then became a nurse practitioner, but went to solve a problem of access to care for emergency care, which was with telemedicine. Formed the Center of Telehealth, was the Chief Telehealth and Innovation Officer at an academic medical center, then took that and replicated that model for a national health system, and now I've joined Amazon. So nurses are everywhere, and they're making a really big difference.
So do you have anything to say to Amazon, Miss Molly? Molly Microsoft?
I'm not sure. Promise you won't tell. First of all, it's great to be here. I actually spent my career here 20 years ago, where I transitioned from clinical nurse really into technology at a medical device company down in San Carlos. So it's so fun to be back. Been at Microsoft for 6.5 years and have really seen Microsoft transform both from a technology perspective, but I think really from a cultural perspective under the leadership of Satya Nadella, really moving more towards an open platform, more collaborative. Diversity and inclusion is so important, not just in terms of who we're hiring, but also where they come from and what their backgrounds are, so that we're making and designing and developing for really on a global level. So really within the healthcare group at Microsoft, there are 3 areas we focus on. I'm going to glaze over the first one because that's really digital transformation and helping our customers. The second one I'm going to highlight because I think it's really the most important, and that's really empowering the frontline clinicians, the nurses, the physicians, the nurse practitioners, the physician's assistants, as they do their job, as tech becomes more and more in their face. And really looking to put them back at the bedside, so working with technologies such as like ambient clinical intelligence in terms of intelligent scribes, et cetera. And then finally, just really thinking about personalized medicine and not just the physical aspects of an individual, and this is where nurses are very well positioned, really bringing in other concepts, social determinants of health, their community, their family, where they live, do they have access to food and care? So those are some of the 3 areas we're looking at Microsoft.
And Linda, you've had a lot of experience from the standpoint of thinking about the social space. And oftentimes when we talk about the clinical workforce and we're talking about nurses, we're very focused on the acute care settings. But with your role in some of the startups and some of the other technology companies, you've really had a focus on people in their homes, their native environments when they're not in healthcare systems. What have you experienced there?
Sure. I've seen a lot of roles where they're looking specifically for a nurse or clinician, and otherwise not, and where nurses could uniquely add value. Everything from operations and mapping out workflows to product development and management, really getting those insights from the users, to marketing, sales, business development, implementation, and customer success. These are all areas where nurses have unique insights and can add value.
Yeah. Well, when Z-Dog was up here, and gosh, I just want to give a shout out to Z-Dog for all of those nurse videos that he has. They're great. And I think my favorite one is the man in the mirror. I don't know how many of you enjoy that one. But one of the things that he mentioned was the importance of gaining trust. So every year, the Gallup poll surveys the public to understand who they trust and by how much, by what degree. So just last week, the Gallup poll released their results, and 18 years in a row, nurses are the most trusted profession. And not by a little bit, by a lot of it. And that trust is earned every single day. Millions of interactions that really help to build the public's awareness of how you would interact with a nurse, why you would interact with a nurse. And trust really, really matters. And Christy, as so many of the roles that you have had to bring out new products, new ways of delivering care, and trust is really important in that. So can you speak to how are the tech companies leveraging the trust dividends that nurses have to help us think about care in new and different ways.
Yeah, I wish it was as easy as buying a new technology solution and just implementing it. Unfortunately, there's humans involved and there's behavior change. So it really does mean that you have to build trust. If you're going to get engagement, if you're going to get adoption, you've got to have somebody that's a trusted partner in that process. And that means somebody that's listening, somebody that understands on the front lines what's really being done and how we can implement it in the best way. And so, I guess my new slogan of the day is, if you want to make a change, hire a nurse.
And Linda, you've been doing a lot, your stint at Facebook. Mm-hmm. What was one of the things that you found as far as being a community manager that using your nursing credentials was helpful with?
Yeah, so I was involved with strategic partner relationships for the health communities. There's millions of people using the group's platform to provide education and support to each other, bypassing the healthcare system, realizing there's gaps. And it was and oftentimes when I would reach out to them, I would introduce myself as a nurse, and that established the credibility and fiduciary responsibility that I think nurses feel for advocating for patients, and to really bring those insights back to the team to help with the prioritization. But I think the nurse helped establish that credibility with the users.
And you've seen a lot of that with the new product developments that you guys have. You have so many different partnerships.
Right.
How does that play into developing new partnerships and collaboration when you're walking in with, hey, let me show you this new shiny technology, and how many people have PTSD about
Yeah, well, I think, when I came to Microsoft 6.5 years ago, it was really during the kind of closure, to some extent, of EMR implementation, and not many people were thinking about the cloud or moving to the cloud within healthcare organizations. So I think, with Microsoft, historically, we've really been targeting the IT professionals. Right. And so Microsoft made a concerted effort to look at the healthcare industry and bring in individuals with experience that could actually have the conversations with clinicians, with business line individuals, beyond what the gadget or the technology is. And to the point earlier about changing behavior, I think it's so important. So we have nurses at Microsoft in our research group who are looking at user interfaces. We just hired a chief nursing information officer, one of my colleagues, and we actually, one of the areas where I really feel like in the future is our customer success unit. So doing that implementation, so not just with Microsoft, but with our partners as well. I think it's so critical to have those conversations where I know, okay, you've been here before, you've done that. Immediately, you're put on a different credibility level than someone else, quite frankly.
Well, the other question, the new role that I get to have is as a host of the new podcast called See You Now. So it's being, when we talk about collaborations and partnerships, I'm really excited to be collaborating with Johnson & Johnson in the American Nurses Association on bringing you spotlighting the stories around human-centered innovation that are being driven by nurses. And one of the insights that we have been surfacing, a lot of this through research that Johnson & Johnson has been doing in their Future of Nursing campaign, is that people really don't know what nurses do. They don't necessarily understand all the different places where they are innovating. And one of the pieces that we found as far as why trust is so important is that on a daily basis, nurses are trusted with billions of dollars of pharmaceuticals, of technologies, of data. That's a really big one, and increasingly so, but also our most precious assets, the people that we love, the people that we care for. And as you guys are talking with your customers and your clients, and then also a lot of the startups that are coming to you, how can you help them leverage this understanding of how important it is that when people are sharing with you really intimate details of their lives, really sensitive data, how can we build the trust to say that it is safe and secure and it will be protected? Have you got any insights? You've been doing so much with the American Telehealth Group. What are you guys doing to send that message out?
It's about education and awareness. To your statement earlier at the very beginning, people don't really know what all nurses do and their capabilities. And so it's around just, okay, don't worry about the letters behind somebody's name. Look at the skills and characteristics you need in an individual. And go out seeking that, but that means you need to open your eyes in your candidate pool and make sure consciously that you're intentionally looking at a diverse group and not going out there just for letters behind a name. And so if we've talked about the things that are needed to really make a difference, and we've told you that there's nurses that are exactly meeting that profile, make sure they're in your candidate pool and really are being very thoughtful, intentional about potentially adding them to your team. You won't be disappointed. In fact, I think they'll exceed your expectations.
Yeah, and I think, to that point, Christy, it's really smart business, as you were mentioning before, the percentage of nurses in the workforce in the U.S., in the world, and think of it from a market perspective, how you can penetrate market with these folks, not only helping with design and development, but the implementation and truly adoption. You're not going to have a new technology implemented or adopted in a healthcare setting without the involvement of nurses.
And the two hashtags that I work with quite a bit is hashtag technology needs nurses. So part of that is identifying what the unmet needs are, and if you're designing a product and you're trying to solve a problem, to really understand the problem. The other one, speaking to this nursing shortage, is hashtag nurses need technology. There are so many problems that really need attention, so many needs that are unmet. And so, Linda, you've been very focused out in the community. What are some of the very specific conditions, populations, processes, procedures where you've had direct contact with the public saying, here's what I need help with? We've got all of these entrepreneurs out here. How can we help them focus on what problems actually need to be solved?
Yeah, no, great question. I think the two areas that I've been really interested in, and where I think my clinical background brought unique insights, was data analytics. So bringing insights and efficiencies from this data, and then also patient engagement and behavior change, and especially in regards where I've been focused is chronic care management.
Yeah. So diabetes, hypertension,
heart failure,
CHF, COPD, asthma, chronic conditions.
All
of them.
All of them. All ages, right?
All ages.
All ages. And then the other part is the locations. I mean, technology is dramatically changing who's delivering the care, where it's being delivered, when it's being delivered. You really are sitting in that company that's really thinking a lot about delivery of all of that. What are the new opportunities for where care can be delivered?
Well, that's the exciting part. If we're really listening to our customer, our patients, they're going to tell us where they want this, and that's how we're going to get the engagement. If we create something in a boardroom that isn't informed by our users, we're not going to get the results that we want. We've got to put it out there, get their feedback, iterate. And, as I think about the journey that I've been on in nursing and where all we've delivered care and how we've solved problems, it's so rewarding to be able to work with the different technology companies to say where we're still not meeting the mark. We're not there. Look out there. We're not there. We've got some incredible technology. The adoption of all of this is growing rapidly, but we still have a broken health system. So we've got to partner together to really come up with solutions that the users will adopt.
Also, I think moving from sick care to health care, and I think nurses, when we're trained, really looking at individuals holistically, so not just one particular system. So I think nurses are well positioned to help that transition as we move towards more of a preventative model.
So given where you guys sit in your companies, you have very senior roles. And what I'm curious is, as these tech companies are thinking about how do I solve these problems, I don't think that the call to action has been ask a nurse. But Chrissy, have you got some guidance or tips that you would offer to tech companies? How would be the best way to leverage the skill set that nurses bring to this?
They need to be embedded in the teams. I mean, from the very beginning all the way through to deployment. Your product is going to be better. As you're getting stakeholder input, have that nurse there. They're speaking on behalf of oftentimes women, the highest user of healthcare and the decision maker for families. They are the ones that can help you understand where your roadblocks are, what customers are going to think of it, if there's going to be trust issues from the patients, all of those things. So have them all the way through the process, and you'll be successful.
Linda, you've had these roles in startups and early stage. Where do you see the value of startups and early stage companies engaging nurses and diverse voices? And we have not mentioned the people who are the experts in the conditions, frequently known as patients. And you are so close to that voice. And that is one thing, is that sometimes it can be hard to engage an entire patient population, but it's interesting by engaging nurses, it's a proxy for, because they can see the wide range of the way the human condition shows up, and it is frequently really messy.
Yeah, my first startup, we were doing predictive analytics and operation modeling, and I worked with the founder, who was a computer scientist, a data scientist, and an architect, and we'd go into these health systems to try to understand where we could bring efficiency. And it was because I was a nurse, I was more comfortable speaking the language, understanding the environment. I could ask the probing questions, and then when the models came back, they're not perfect yet, and there's bias and things, and so really asking those questions and assessing, is this model correct? Having that background really brought a lot of value to the team.
Yeah, I would agree with that. Just to tag on, I think when I transitioned from my clinical role to a product development role, I really sat in between the customer and our product engineering group, so software, hardware engineers, and was able to be that translator and really help them develop specifications that would truly meet the needs of the end user.
And I always like to end on a very positive thought. We hear about how difficult and challenging it is to be on the front lines and to be taking care of people, but I want to share what it is that I love about being a nurse. I love and appreciate the honor that it is to be in a very sacred space, to have people be at their most vulnerable when they are scared, when they are hurting, and to feel like just being present to them, being in a place where I can say, I see you. I am here, and you will not be alone. And there's a great deal of satisfaction and a touch of humanity. So oftentimes, we hear about all of the really big challenges, but I really like to leave you on a note that this is good, big, important, beautiful work that we do. And I'm excited that we have technology companies that are helping us to meet the needs and to reduce suffering and to multiply joy. So Molly, what do you love about?
I know we're on a lightning round, so I'll try and make it quick, but I think, I've been in technology for over 20 years, medical device mostly before Microsoft, and I think at the end of the day, healthcare is people care, it's relationships, it's partnerships with patients, and I say that really from the perspective of a healthcare consumer. And so when we think about high tech, we cannot disregard the high touch as well, so that's so just critical.
What do you love?
I think it's just to make the best products and have successful companies takes a multidisciplinary collaboration, and nurses need to be at that table.
I can have an impact at an individual system and population level.
Well, I just want to say thank you to Startup Health and to all of you for all the work that you're doing. And if you are on a mission or a mandate to improve health and human experience, you need a nurse. We're here to help. Thanks, guys.
Thank you.
Please welcome to the stage Startup Health's Portfolio Director, Paulina Hannon.
How's everybody doing? Good? Yeah? Well, I'd like to, again, welcome those of you who are just joining us to the Startup Health Festival. And for those of you who are coming in, we have plenty of seats. So just come on down, take a load off of your feet. You're going to be on them for quite some time over the next 2 days. So I'm really, really excited about this next panel, particularly because it is addressing a really large problem within our ecosystem. In 2019 alone, $5.7 billion was invested in access to care across 360 deals. And what this does is dramatically expand the way that each of us as consumers, as patients, are really able to understand our own conditions, our own lifestyles around the world. And so here to talk about how diagnostics is expanding reach of patients to be able to get access to care is Alex Ness, whose thermal patch can detect breast cancer. It's Karen Drexler, who's bringing centrofluidics literally to the palm of your hand. And Satya Alumalai, whose 30-second breath test is transforming patient monitoring. And leading the discussion with them is Peter Layden, CEO and founder of reInvent. Please welcome them to the Moonshot stage.
Thank you. Thanks for the intro, and good morning, everyone there. One of the reasons I think Unity asked me to do this was I have been around from the early wired days, the kind of early to mid-'90s. I've watched this digital transformation hit all kinds of different fields, media, retail, the whole thing. And now it's really interesting to see it through the prism of healthcare. The other thing is I run an event series here in San Francisco called What's Now San Francisco. And every month we look at a different field that's exploding in innovation, get someone to explain that to a broader audience. And so what we're able to see is how innovation is just exploding in all kinds of different industries. And again, I think what we're going to try to do here and in this group here is to start to think, how is it really these trends that have been actually playing in other fields, how are they also playing out in health? And so one of the ways we're going to do this is, one of the big things is we've gone from clunky big machines to kind of handheld supercomputers. And there's this kind of decentralization in these powerful tools is one of the things that's really driving the change in all kinds of fields. So what I'd like to do is have each of you introduce yourself, what you do with your company, but talk about the device. Every one of you has a device that you probably couldn't have done 5 or 10 years ago. And if you can just reflect on what's different and new about that device. Go ahead.
Thank you, Peter.
Or no, let's go with Karen.
Yes.
Okay, thank you. So Sandstone has a system that allows for centrifugation of samples to happen anywhere. We've taken a big clunky lab centrifuge, which is because it's big and clunky and hard to use, needs to be in a central lab. And we can literally put that power into the palm of your hand. And why that's important is because healthcare is changing. So in our case, it's not so much that we couldn't have developed this 5 years ago or 10 years ago, but the need in healthcare has really driven the changes. So we heard a little bit on the last panel. People expect to have access to care in different places. Not everybody wants to go into a lab or a central facility to get their health care. And having tools like this enables people in the remotest locations to participate in clinical trials, to be able to get blood drawn from the comfort of their home and have their samples pristine so that they can get access to the best cutting-edge technology. And we have things like cell-free DNA testing, which is the fastest growing area of diagnostics ever, where the quality of the sample is so very important because we're looking for minute trace amounts in the blood to help all of us with things like early detection of cancer. So it's really the market moving that has caused the need for technology like this at this time.
Alex.
Thanks. Always we have developed a device to patches for the early detection of breast diseases, including breast cancer. Our intention was, one, access to care, bring this device to everybody in the world, and second, to humanize a little bit more the process of mammogram. We found out that women do not like to have the mammogram done. It's very invasive, takes a lot of time, it's money, sometimes it hurts. So our intention was, okay, we have to take care of this. First of all, breast cancer is huge in my family. I don't know if you have suffered directly or indirectly breast cancer. But second is, how can we create this awareness for women to say, hey, there is technology, there are tools that will keep me abreast of potential diseases. So that's our intention.
Satya.
So from our perspective, I mean, especially for somebody who's, as a caregiver, I've been managing my mom with multiple chronic conditions. And the challenge is, like, everybody is taking a point solution approach, giving one device for a patient with multiple chronic condition. From our point of view, what we wanted to do is to bring high-quality, patient-centered care to the patient's home. So as a part of our solution, we built a single device that measures more than 10 vital health parameters in just 30 seconds, non-invasively. So this is something, again, patient can use every day, more like brushing their teeth in the morning, and then just use this device. And through this, we wanted to provide a more personalized approach to their health so that they can make sustainable behavior changes every single day. So as you were saying, it has been a challenge to bring this device. It's been almost 8 years of work. Today, it has become a reality because of the current situation.
And so yours is a tool that couldn't have happened 5 or 10 years ago. So this is the other thing is we're decentralizing these things from clinics, from hospitals, whatever. And through that, because we have ubiquitous connectivity, we can bring it out in the field, we can bring it into the home. So to what extent is what you're doing bringing down the costs of what used to be done in the centralized kind of situation? To what extent, is there any way to kind of gauge the price differentials or what's the kind of cost savings as we kind of spin this out of the centralized space? Any way to think about that?
Sure, and there are a couple of ways we can think about it. I'm sure we'll find a lot of others. But given the current paradigm of collecting blood into tubes and sending it into central labs for testing, for certain assays, there's a pretty high fallout. So there's a yield loss, and that has a cost. Many of these samples also need to be shipped very, very carefully. Overnight express shipping, temperature-controlled packaging, and we're streamlining all of that. So by the time the sample gets in the door with an approach like this, the sample will be not only higher quality, but it will cost less to get it in the door. So we'll save money for the healthcare system.
Now, one of the bigger trends you're all part of in the bigger sense is all this data is digitized. It's one of the things that your field at least has gotten through that hump. But the thing now we're able to do is use AI to kind of apply this data. And so I'd like to just tell us how that plays out in your devices, in your companies, but also in your field. And why don't you start, Satya, about to what extent are you able to do things now with deep learning and machine learning that we couldn't have done?
Yeah, absolutely. So around 8 years ago, when we had the first prototype, we went around different parts of the country, but everybody was like, what am I going to do with all these different sensors, right? It's really challenging. People didn't really get AI at that point in time. There was no value on this multi-parameter or a multi-biomarker approach. Today, with the value of AI, we can actually map the human health with a lot of data. So right now, that's why our device, or like any other devices that are out there in the market, getting more traction, because people wanted to collect a whole lot of health information rapidly from patients or from individuals so that they don't have to rely on just one indicator continuously on a daily basis. So what AI has done to us is like now they see the potential. Now they see like what all these different parameters can tell about human health. So it is driving us in terms of providing value to individual customers, especially, for example, Pharma, who wants to look at a patient when they go home with their drug or treatment strategy. They really need to understand what goes on in the home environment with these patients. That's where our device comes in and AI comes in to support our efforts.
Do you have any kind of application that's working in your space?
Yes, we have a complete ecosystem. For us, Peter, data is huge, it's everything. Especially considering that breast cancer, genetically, it's only past 7 to 9% of the cases. So with the device, this is our Trojan horse. With this, we intend to give a tool to women to preventively take care of the breast of their health. But what we want to understand is what triggers the expression of BRCA1 and BRCA2, considering that 90% of the cases are external factors. So that data is everything for us. Through the device, our app reads the result, whether you're positive or you're negative, okay? And we use machine learning to start collecting data about your habits, what you do, what you eat, what you drink. Is the wine that we drink? I'm from Spain, in Barcelona, and maybe there's a big incidence in Argentina in the wine. Is there anything in the sulfites that they use for the wine that creates expression of these genes? So we are trying to collect, actually, and create the first worldwide database of breast cancer, for then put it to use to research institutions and labs to understand what triggers the expression of those genes. And also, the whole ecosystem is we have to leverage on community. We found that the power of community, I mean, I've had this disease, you had this disease, what can we do together? What did you take, what didn't you take? It's much more than the data itself. It's the collaboration tools that we expect to get from our users that's going to help us beat the disease.
You're jumping ahead, we'll get to in a minute, the collaboration. Personalization, again, another big trend in tech. I've seen it in all kinds of different fields, but this dream of individualized medicine, we're here in the beginning of this decade. I mean, are you seeing we're now on, where are we in this continuum of like the kind of tools you have, but also broader beyond your specific companies? Are we now getting to the point where we can really start to target this kind of individualized, personalized data sets and really start to make that kind of precision, the precision kind of diagnosis? Go ahead.
Yeah, exactly. When it comes to precision medicine, again, different patients are different, and then today medicines are made for a patient and a disease and not for a specific individual or a specific patient. And that's where by using a technology like ours, we can actually personalize care. For example, using our device, we can measure multiple parameters, and the changes within those parameters in these patients, and every time when they go through drug trials. So we can profile individual patients, and then we can titrate the drugs better. So that using our technology, we can also identify early signs of a clinical deterioration early enough to provide value. And that's where companies, diagnostic companies, providing value to personalized individuals. Because for my mom with multiple conditions, she can just use certain parameters to monitor her, while others who doesn't need to use other parameters can still get an overview of their health.
Gotcha. What's happening now? I mean, a lot of these are in development, and there's a lot of kind of looking ahead and how can we do this, but yours is really making it, right now, it's applicable, right? Karen, do you want to talk about how does it make a difference in an individual's life, or how is it right now something that can make a difference, and how could you see that scaling in the next 5 years?
Yeah, so the initial use cases that we have out in the market now are in the remote clinical trial space, and in particular in the heart failure area. So patients who are at risk or have had heart failure tend to be pretty ill. For them to participate in clinical trials, you often need to get to them where they live. And being able to send mobile phlebotomists or give people access to the care in their home as opposed to requiring them to come into an academic medical center is enabling people all over the country to participate in clinical trials. It turns out that these heart markers are very sensitive to the way the sample is handled. So it's also a great match with our technology in that by preparing and stabilizing these pristine samples, we make sure the right information comes back in terms of their status for the clinical trial outcome.
Another big theme that we see in all these different fields is when you crack the product initially, usually in developed countries at a higher pricing, they can then quickly scale globally. And I just like to think how do you see that playing out with your tools, but also in your field? Go ahead, as someone from outside the States, how do you see it taking off globally, and how much will we see that happen in this decade here?
I think it's imperative to go globally, and that's the reason why many of you are attending this kind of conferences is our mission as human beings to bring and leverage on this technology to be worldwide. Yes, for us it's super important. The US is home to us. The device is going to be launched here first this April, but then again, this is any sickness. It doesn't have any nationality. It's global, it's universal. So considering different races, different chances of developing this disease, we have to understand what's happening, okay? Why, for instance, Latino women have more chances to develop breast cancer than white Caucasian women. So we have to go there, we have to decentralize, and we have to bring access to everybody, regardless of social or economic status. I feel that we are more connected than ever. But when it comes to health, we are not leveraging enough, whether it's for regulations or cost, okay, the power that we can bring to communities that they have no access to care. And I've been visiting hospitals in Europe, Africa, Asia, even here in rural America. We don't have to go outside home, you know. You go to certain states, you know, and they really have to go, drive miles to understand if they're sick, if they have something or not. So as entrepreneurs, as people, experts in health, it's our uttermost obligation to make sure that everybody has the same access, regardless where they live.
Mm-hmm. Well, do you also even maybe see greater potential and greater demand and greater could you see these as actually almost being primarily geared to global, given you got cheap, tools go into kind of
Yeah.
the hands of the periphery, isn't it? In some respects, almost more potential in the global market than what you even got in developed world.
There certainly is huge potential. So if we look at the issue of sample stabilization, doing highly personalized cell-free DNA testing is not likely to be pervasive in the developing world anytime soon because of the cost of sequencing. But blood tests are traditionally run in many of these markets by doing a finger stick and putting drops of blood onto a piece of filter paper, drying it out. And that is a really poor way to not only sample, but to handle the blood. We've got versions of this that will allow for capillary sampling in a way that it could be stabilized. So you have stable liquid plasma, even in these harsh, low resource areas, that again will allow people access to high quality diagnostic testing with a very straightforward solution. So we're very excited about the potential for bringing this into the developing markets.
Wow.
One of the big things they want to talk about here is collaboration and how that works in your field, how it works with folks outside your field. Why don't you jump in here about to what extent have you found collaboration to really be helpful in your building your business and expanding your model? To what extent have you seen kind of difficulties in kind of getting more of that? I'm just curious where you fit on the collaboration method. Why don't we start with you,
When it comes to
Sachin?
collaboration, you really need some data to actually first start some of the collaborations, right? It took several years. Our technology was a nice thing to have, but it didn't really add value to any of the customers. Once we have data, now customers are really interested in, for example, even doing a study at Johns Hopkins. It was a great opportunity for us to generate more data from that, and that leads to more money. And from a pharma perspective or from a peer perspective, the next step is to get a clearance, right? So, and then all these partnerships has been really instrumental for us to move forward, because for a startup, it is much more difficult to accomplish anything without the support of like organizations. For us personally, Hopkins, Novartis, and other pharma companies have been pushing us forward, specifically in the area of clinical trials, bringing virtual trials to patients' home. And for us, we wanted to help even the providers, right? We want a simplified solution so that providers can also adopt our technology. So testing all those things in the market, all these collaborations have been very vital.
How about you, Phil? How does collaboration play in your
For us,
business?
it's essential. And actually, it's collaboration that makes us better. In breast cancer, we want to understand the phenotype and the genotype of the user. As I told you before, today, for instance, through wearables, we can connect to Apple healthcare kit, and we can know your lifestyle. But then we have genomics. By knowing what's going inside of you, and today with the exponential growth of technology, the cost of genomics has decreased considerably. We can send to our users worldwide, a test to see if you have BRCA1 and BRCA2. All that collaboration, all those things allow us to create this amazing ecosystem, that at the very end is going to help us to determine through the use of AI the probability that each user has to develop this disease. I think it's essential, Peter. I think we have to leverage on each other much more than ever before. And I found that when you're working for a right cause and you collaborate with all these people amazing like you guys, magical thing happens. It's insane. We get there better and faster.
That's fantastic. You have a thought on that, the collaboration side?
Yeah, I mean, for us, it's essential. We're not providing the end diagnostic. We're providing the front end, the so-called pre-analytical phase of the assay. And there have been hundreds of millions, maybe billions of dollars that have been poured into some of these efforts, like with Grail, other companies, trying to get these early signals for cancer. And these companies know that they need support in the pre-analytical phase. So we find there's a lot of openness for people to work with us and help us optimize so that we can optimize the end result for the patients.
So one of the holy grails I know of, so we're at the beginning of the decade here. We're looking out 10 years. I love that big picture lens. There's so much talk about how the U.S. health system is let's say, suboptimal, not working in the way we want it, right? How do you think about the next 10 years? Do you see we're at some kind of new inflection place that with genomics, with the kind of new diagnostic, which the digital transformation, everything's digitally connected and all, maybe potentially interoperable, all these different data sets. What do you think about the next 10 years? Are we going to see, do you think we'll see incremental but positive change, or do you think we could even see some kind of radical and really big leaps in the entire system? Just curious.
I think definitely the digital therapeutics is going to play a lot of role in this case. I know there's a lot of apps available today, but then I look at it as more devices coming into play and coaching coming into play. Everybody talks about social determinant of health, right? That's where it's going to be, like not looking at a person individually, but then holistically, looking at their environment, looking at their habits, looking at their health, and everything is going to go to the patient's home. So I look at it as every single aspect of health is going to be more personalized and driving towards patients' home where they are and not to a hospital setting.
Any other thoughts? Next 10 years? Cheaper, better, radically different?
Well, hopefully radically different. We need it. I'm not sure exactly where that will happen, but we heard a little bit on the last panel, and I'm sure we'll hear it through the next 2 days. Where care is delivered just needs to change. We're not graduating enough primary care physicians. People are seeing a doctor, whatever doctor they can see, while they're in their pajamas sitting on their couch in their living room. Right? The delivery of healthcare as a whole just needs to change. I mean, I need to use technology to make that efficient and to get to people, hopefully in the earliest stages, when we can not only provide the best outcomes, but also save a ton of money, which obviously the U.S. health system needs to do.
Your thoughts?
Yes, I totally agree with them. I think it's definitely going to be better. Regulations and regulators have a very tough job to make sure that everything that we bring to life, works as it's supposed to work. And we all know, I mean, we know and the system knows that it's better to treat health than to treat disease. If we are able to be preventive, if we can focus on lifestyles, better lifestyles, we're going to see big changes, Peter. I have no doubt about it.
So when you look back, the last 10 years, the difference that we've seen in health for the last 10 years compared to the differences we're going to see in the next 10 years, as we're winding down this panel, how would you compare those 2 decades? Are you going to see like a very different, big changes and very different kind of future, or are we going to see kind of keeping on that steady stream kind of forward?
I think
we only got a few seconds. Last kind of thing, up or down?
There's definitely going to be a lot of change. I don't think it's going to be gradual because now patients have more ownership and patients wanted to be involved in their care. So it's going to be a gradual shift. And I also believe like even healthy individuals are going to focus on getting better care and not just wait till they get sick. Proactive care is where everything is going to go.
Yeah, the last decade really set the stage. We finally have payment codes for digital health. We've got the ability to have things connected, and now we really need to take advantage of those advances, of the ability to see patients where they are and get in early.
And a last quick word, where do you think?
Information is power. Therefore, everything is, we get more, like you said, Satya, we have more information at our hands now. So we want to push regulators and entrepreneurs and to come with better things. So yes, it's going to be amazing.
It's going to be a great decade. So with that, I'm going to end it here, and let's keep this conversation going through the next couple of days. Thanks.
Right. Thank you.
Please welcome to the stage StartUp Health's Chief Medical Officer, Dr. Howard Krein, and Dr. Dean Ornish, founder of the Preventative Medicine Research Institute.
Here we go again.
Yeah.
Yeah, I'm going to give you a hug because it's all about love, right?
It's all about love. That's right.
It is. Well, thank you so much for being here. Hey, everyone. Is everyone having a pretty good day so far? All right. So thank you so much for being here again. For those of you who were here last year, we had the honor of having Dean and Ann, his wife, on for literally, it was the first time.
That's right.
To talk about their book, Undo It, and we're excited that we were the first live interview.
That's right.
The day it came out. And since then, I know you've been on Oprah and on Ellen and Dr. Oz and probably thank you. A whole host of other shows to talk about it. National bestseller.
Yep.
So in the book, and I want to get right to the sort of the bread and the heart of the book, the bread and the butter is.
I didn't say the meat of it, but anyway.
The meat of the, I wouldn't say meat around you. So the bread and butter. It was almond butter, so it was okay. So in the book you put forth this theory, this unifying theory about disease, chronic disease. Can you share with us a little bit about what that means?
Sure. Well, I was trained like all doctors, like you were, to view heart disease and type 2 diabetes and hypertension and prostate cancer and perhaps even Alzheimer's as different diseases, different diagnoses, and different treatments. But after over 40 years of doing research, we found that these same simple lifestyle changes, a whole foods plant-based diet that's low in fat and sugar, moderate exercise like walking a half an hour a day, various stress management techniques including meditation and yoga, and psychosocial support or love and intimacy, or to reduce it even further to eat well, move more, stress less, and love more, that these same lifestyle changes could reverse the progression of a wide variety of chronic diseases that at the time were thought impossible. And the more diseases we've studied, the more underlying mechanisms we look at, the more evidence we have to show that with all this interest in personalized medicine, I mean, if you're talking about a targeted immunotherapy for a particular line of pancreatic cancer or melanoma, it's awesome. But for the vast majority of chronic diseases, it's these same lifestyle changes that could reverse and therefore prevent all of them. And I think that what finding is like, why is that? You know, it's not like you have to do one kind of exercise for heart disease and a different one for diabetes and so on. It's just exercise. If you like it, you'll do it. And I wondered, why is that? And what I realized is that the reason why these same lifestyle changes can reverse and prevent so many different chronic diseases is I really think that they're the same disease manifesting and masquerading in different forms. And I say that because they all share the same underlying biological mechanisms, things like chronic inflammation, oxidative stress, changes in the microbiome, in telomeres, in angiogenesis, in gene expression, in overstimulation of the sympathetic nervous system and immune function and so on. And each one of these mechanisms in turn is directly influenced by what we eat, how we respond to stress, how much exercise we get, and how much love and support we have. Eat well, move more, stress less, love more. Boom, that's it. And so it radically simplifies it for people. So it's not like you have to say, gosh, today, you know, what should I be doing? It's really the same for everyone. It also helps explain what are called comorbidities. In other words, you'll often find that the same person will have heart disease and type 2 diabetes and high blood pressure and elevated cholesterol and be overweight. Or entire countries like China 50 years ago where they had almost none of these chronic diseases until they started to eat like us and live like us and now all too often die like us. And so it makes it radically simple of what we tell our patients to do because, you know, it's the same for everyone. And the more you change, the more you improve. It's not all or nothing. To reverse disease, it takes a lot. To prevent it, the more you change, the more you improve. And you decide how much you want to change.
Yeah, and just to step back for a second, although it seems like it's common sense, like, oh, you eat well, you exercise more, you're going to be healthier. Truly, even the medical community, Dean really was the father of this idea that diet and exercise can truly change our health and wellness. And back when you started, I mean, it was, I got a little fly, it was a profound discovery almost, where people were like, it's not going to change it, it's going to be fine. And it was really your initial studies that sort of got the ball rolling and really got everybody on board with the fact that this really can be a health style and a healthy change to people.
It's true. I helped create a field called lifestyle medicine, which is using lifestyle changes not only to help prevent disease, which we all know, but to treat and often even reverse it, either in combination with drugs and surgery or often as an alternative to them. And when we started doing studies over 40 years ago, the idea that heart disease could be reversed was thought impossible, or type 2 diabetes, or any of these conditions. And to me, the reason why I spend so much time doing well-designed research studies is that the power of research is to redefine what's possible. And then by doing so, it can give many people new hope and new choices that they didn't have before.
It's amazing. So as I was preparing for this, we were talking about some of the new studies, the new things that you're looking at. So we're moving beyond just general health, and we're looking at chronic diseases, but you're now specifically looking at Alzheimer's disease too.
Yes.
Can you share a little bit about some of your new current studies?
Sure. Well, Alzheimer's, my mom died of Alzheimer's, and she was brilliant, and just watching her brilliant mind decay was incredibly stressful for everyone. And when you lose your memories, you lose everything. And Alzheimer's, unlike heart disease or diabetes, where there are other drugs or stents or bypasses, whatever, there are really no effective drugs for reversing Alzheimer's. And they've spent billions and billions of dollars looking for the blockbuster drug, but they haven't found it yet. And yet I think we're at a place with Alzheimer's very reminiscent of where we were with heart disease when we started doing studies there 4 decades ago. In other words, the mechanisms are the same that we were talking about earlier. The less intensive lifestyle interventions back then could slow the rate of heart disease building up plaque in your arteries. We found a more intensive intervention could actually reverse it. And similarly now, less intensive interventions of Alzheimer's disease, the finger study from Finland, the mind study and others have shown that you can slow the rate at which you get worse, but you're still getting worse, just more slowly. And so I think it may be true, and this is what we want to find out, that we can perhaps reverse it by making bigger changes in lifestyle. Now, we're in the middle of the study, so we can't say anything for sure right now, but it's a randomized trial with 100 men and women who get the intervention for 20 weeks or 40 weeks, and then we compare them. And we're looking at changes not only in their cognitive function, but also in their telomeres, and their gene expression, and their proteomics, and their microbiome. It turns out that the amyloid in your brain actually is produced mostly in your gut, and so it's a systemic illness. And so, and Alzheimer's is a profoundly isolating disease. And one of the things that we talked about earlier is that studies after study have shown that people who are isolated, lonely and depressed and isolated, which I think is the real epidemic in our culture, are 3 to 10 times more likely to get sick and die prematurely of virtually all causes when compared to those who have a sense of love and connection and community. And I think that's especially true in Alzheimer's, which is a profoundly isolating disease. What happens is, suddenly it's like, what was that person's name, and where did I leave my keys? And next thing you know, you don't want to go out because you don't want to embarrass yourself because you feel like you're not remembering things as well. Next thing you know, you're in front of the doctor, and the doctor's saying, I'm sorry, you've got Alzheimer's disease, and it's only going to get worse. Maybe we can help it get worse more slowly, but it's going to get worse. And by the way, we're taking away your driver's license, and so your world shrinks even more. And then you just have this incredible death sentence, like, oh my God, my brain is only going to get worse and worse. It's a little like reminds me of the scene in 2001 where they start to pull the memory cores out of HAL the computer, and they start singing, Daisy, Daisy as it goes. And so you get into this downward spiral where you think you're never going to get better, and you kind of lose hope, and you stop doing much, and it just all becomes self-fulfilling. So if we show, and it's a big if, but if we show that we can reverse the progression of early-stage Alzheimer's, then that will give millions of people new hope and new choices that they didn't have before. If we show that it does absolutely nothing, that'll be important for people to know as well, so they don't delude themselves. But I'm cautiously optimistic and hoping that we'll be able to show that, but it's premature to say anything at this time about what the outcomes are.
Well, I think that, like you said, with this unifying theory, that I think it'd be very unlikely that it doesn't show some improvement. So for your current study, you're looking at lifestyle changes. So it's not just diet and exercise. We were also talking about connections.
Yes.
And that it's important to maintain and continue to develop connections, because whether they're intimate or social, that they're actually helping and improve the synaptic connections too.
Yeah, I have this weird theory that, I didn't know this until I started doing these studies, the study on Alzheimer's, that except at the very end stages, those memories are still there in people with early Alzheimer's. They just lose the synaptic connections to them, which is an interesting metaphor. And so my kind of weird hypothesis is that if we can put people in a support group, which is one of the 4 elements of our program, and encourage them to form connections with each other, maybe that will help them form connections with those memories. And so in our studies, one guy might say, I was diagnosed with Alzheimer's, and I lost my driver's license, and my wife left me, my dog died, and one of the other guys said, I lost my driver's license too, but I got a bike, and let's go bike shopping together. Now they're out buying a bike together. Now their world expands, or they have the sense of love and caring from each other. And so It's a really powerful thing. We tend to think of advances in medicine as something really high-tech and expensive, a new drug, a new laser, a new procedure, a new device. And yet I think our unique contribution has been to use these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. People say, well, I get diet and I get exercise and I get, stress management, but love and support, that's kind of weird. What does that have to do with any of this stuff? And yet I think that both from the standpoint of motivating people to make lifestyle changes or even to take their medications, for example, telling somebody who's lonely and depressed and isolated that they're going to live longer if they just, change their diet or take their meds doesn't really motivate most people. They're saying, you don't get it. I'm just trying to get through the day. Why would I want to live longer? I'm miserable. And, again, study after study of showing that these behaviors are the most powerful determinant of not only our well-being, but even our survival. 3 to 10 times more likely to get sick and die prematurely if you're lonely and depressed. And over the last 50 years, there's been a radical shift in our culture with the breakdown of the social networks that used to give people that sense of love and connection and community. 50 years ago, people had an extended family they saw. They had a church or synagogue or a mosque or whatever that they went to on a regular basis. They had a job that they'd been at for 10 or 20 years that felt secure. They had an extended family or a neighborhood with 2 or 3 generations of people. And many people today don't have any of those. And as our country gets more tribalized and more polarized and the breakdown of these social networks, it's really, I think, creating a lot of despair. And there was a wonderful article by Nicholas Kristof in the New York Times yesterday about this community that of kind of middle class, mostly white people, where the mortality rate is going up, skyrocketing for the first time in decades because of the breakdown of these social networks. And so the time that we spend with our friends and family and our loved ones is not a luxury that we do after we've done all the important stuff. It turns out it may be the most important stuff.
Yeah, it's interesting that you brought up communities because and what's going on in our country and actually around the world, there is a lot of isolation. There's a lot of bad feelings and things like that. You mentioned that love, support, unity is all part of this. So do you think that bringing, whether it's our country, the world, people together in general actually helps with wellness and health?
Well, studies have shown that it does. London, England has a minister of loneliness now because they're recognizing this is such a big
really?
issue. Really?
I know that.
I really think that anything that brings us together is healing. Even the word healing comes from the root to make whole, and yoga is from the Sanskrit to yoke, to unite, union. These are really old ideas that we're bringing together. Now, one way to feel a sense of community is to have a common enemy, and there's unfortunately a lot of that happening in the country now, this kind of tribalization. But it's really a false intimacy, and there was a wonderful interview that George Lucas, about the Star Wars movies, did with Bill Moyers many years ago when the first Star Wars movie started coming out, talking about what is the whole meaning of Darth Vader and the Siths and all of that. And he was saying that if you have a community based on fear and anger, that invariably it becomes smaller and smaller because people start to kill each other off until finally you're just left with 2. You've got the Emperor and then you've got Darth Vader, and then one of them has to die. And so it's kind of the ultimate isolating experience. And yet all spiritual traditions really talk about love and compassion, what Aldous Huxley called the perennial philosophy, love and compassion, forgiveness and caring. Because not to get to heaven or to get good karma or some external goal, but what I've realized from studying with all these spiritual teachers and reading their works is that this is how you live a fun, healthy, productive, loving life. That when you demonize someone as the other, without making any particular reference, those Mexican rapists, those Muslim terrorists or whatever, as being fundamentally different from you and only different, that's when suffering begins. That's when illness ultimately begins. When studies have shown that the one emotion it's not type A behavior, it's not, talking fast, people who have a lot of chronic anger and hostility, that's the one emotion that's most strongly linked with heart disease and heart attacks, among other conditions. And so when you forgive somebody, it doesn't excuse or condone what they've done, but it frees you from the suffering, that carrying all that chronic anger. When you have that chronic anger, it makes your arteries constrict. It makes your blood clot faster. It makes the plaque build up faster in your arteries. It suppresses your immune function. It interferes with your mental function. And so when properly seen, that on one level, yes, we are separate, But on another level, we're part of something larger that connects us all, whatever name you give to that. And even to give it a name is to limit what's essentially a unity consciousness or a oneness experience, kind of like the projector, that's shining here. There's the light behind the projector. Then on the screen, you have all these names and forms that we can enjoy. But we can really only enjoy them if we also have that double vision and see the unity as well as the diversity. And then so things like love and compassion and forgiveness come naturally when you come from that place. There was a study that came out last year of 148 million tweets in Twitter. And they found that those that had the most anger and hostility had more of an increased risk of heart attacks and stroke than high blood pressure, high cholesterol, and all the usual risk factors. These things are really important, and we can change them.
So hate is actually, hate is a disease in itself, right?
Yeah,
if you spew negativity, it actually just affects you.
Yeah, there's that old saying, when you point your finger at someone else, you've got 3 fingers pointing back at you. It's when you have anger towards other people, it eats you up. And
So going back to the lifestyle changes. So if we get people to exercise more and to love more and to eat healthier, how do you create sustainable change in people? Because often people are like, I don't want to give up meat because I love my hamburger, or I'm not going to get up and exercise for 20 minutes in the morning because I really want that extra 20 minutes of sleep.
Yeah. Well, there's so many misconceptions around that. Am I gonna, the old joke, am I gonna live longer? Is it just gonna seem longer if I eat and live healthier? The only way to get to live to be 100 is by not doing all the things that would make you want to live to be 100. Variations on that theme. But it turns out that because these underlying biological mechanisms that we've been talking about are so dynamic, when you make lifestyle changes in the ways we're talking about, to the degree that you make them, most people find that they feel so much better so quickly in the ways that really matter most, that it reframes the reason for making those changes from fear of dying or fear of something bad happening to joy and pleasure and love and feeling good, which is ultimately what makes them sustainable. There's a wonderful movie that came out, a documentary called The Game Changers, about 12 weeks ago, and it's already the most downloaded documentary in Netflix history. It was done by James Cameron, who did all those wonderful films like Terminator and Titanic, and Luis Sajoyos, who got an Academy Award for The Cove, his first documentary. And the Camerons got interested in doing this when, besides being these great filmmakers, they're also explorers. And they learned that more global warming is caused by livestock consumption than all forms of transportation combined. So they went on a plant-based diet, and he felt so much better, he's actually making avatars 2, 3, and 4 at the same time now, sleeping on the floor in the studio, just because it gives you so much thing. And The Game Changers is really about all these elite athletes who raised their game, who became Olympic medalists and mixed martial artists, national champions, and heavyweight boxing champions, and so on. When they went on in fact, the Tennessee Titans, who now look like they're going to the Super Bowl, weren't even in the playoffs for 15 years until 14 of the team members went on a plant-based diet. And again, how quickly you can get better when you make these changes. So fear is not sustainable, and I think we're seeing that in the political arena now as well. What's sustainable is love and pleasure and joy and feeling good. And if what you give up, what you gain is more than what you give up, and because these biological mechanisms are so dynamic, you can experience these benefits very quickly. So your brain gets more blood, you think more clearly, you have more energy, you need less sleep, your skin gets more blood, you look 10 or 20 years longer. I'm 96, I think I look pretty good. Your heart gets more blood, you can reverse heart disease. Your sexual organs get more blood flow. There's a great scene in the Game Changers movie where they give these 3 elite athletes.
Hold on, this is going to make everybody a plant-based diet fan.
They gave this single meat-based meal to these 3 elite athletes in their mid-20s. And at night, they measured the frequency and hardness of erections the guys had when they sleep. It's a natural guy function. And the next day, they did the same thing, but they gave them a single plant-based meal. And then they measured the same thing. And the meat, by the way, was organic, grass-fed beef, those kinds of things. And they found that the single plant-based meal, those 3 guys, each of them had 300% to 500% more frequent erections and 8 to 15% harder erections after a single plant-based meal than a single meat-based meal. Apparently the film crew went on a plant-based diet after shooting this, But it illustrates so quickly that it's not about preventing something bad years down the road. Fear is not, you can't really sustain. We all know we're going to die someday, but who wants to think about it, right? But if you actually say, well, gosh, if I have heart disease and my chest pain goes away within a week or two in most cases, so that I can do those things that I couldn't do before. So for someone who can't walk across the street without getting pain, or make love with their spouse, or play with their kids, or go back to work because they have so much angina or chest pain, and then we found within a few weeks they're essentially pain-free and often can get off of medications they were told they'd have to take the rest of their lives under their doctor's care. They say, well, I like eating cheeseburgers, but not that much, because what I gain is so much more than what I give up. And yeah, I'll probably live longer, but more importantly is I'll live better, and I don't have to wait long to see the benefits.
So, interestingly, why do you think that this is all sort of coming to light now? Like, why now? What's important about this time? Or
That's a really good question. I think we're at a kind of one of those inflection points where there's a convergence of forces that finally make this the right idea at the right time after having been doing work for 42 years in this area. On the one hand, the limitations of drugs and surgery, drugs and surgery used appropriately can be life-saving. We've all benefited from that. But they don't really address the underlying cause of why we get sick. And studies are showing, for example, that in the case of heart disease, that there are now more than 8 randomized trials that have shown that in stable patients, stents and angioplasties just don't work. They don't prolong life, they don't prevent heart attacks. But they said, well, at least they reduce chest pain or angina. And they did a study a year ago called the Orbita study, where they actually, half of the patients, they put a stent in, the other half, they pretended to put a stent in. They put the catheter all the way up into their heart, didn't do anything, just pulled it out. And those people had as much a reduction in chest pain as those who actually got the stent. So apparently the stents don't reduce angina either. And we spend billions of dollars on these interventions that are dangerous, invasive, expensive, and largely ineffective. At the same time, half of the American population today has type 2 diabetes or is pre-diabetic. And yet the studies show that getting your blood sugar down with drugs doesn't prevent the horrible complications of type 2 diabetes, like blindness and amputations and heart attacks and strokes and impotence and so on, nearly as well as getting your blood sugar down with diet and lifestyle. In the case of men with early stage prostate cancer, the studies have shown that maybe 1 out of 50 men who get surgery or radiation who has prostate cancer benefits from it. The other 49 are often maimed in the most personal ways in terms of being either impotent or incontinent or both, for no real benefit at huge economic and huge personal cost. But if the only choice is between doing nothing and doing something, most guys are like, get this out of me, I want to be done with it. Except most guys are going to die with prostate cancer and not from it. It only becomes a life-threatening issue if it spreads. And so we did the first randomized trial with Dr. Peter Carroll, who's the chair of urology at UCSF, and Dr. Bill Fair, when he was chair of urology at Memorial Sloan Kettering Cancer Center, that these same lifestyle changes can slow, stop, and even reverse the progression of early-stage prostate cancer. And the only side effects are good ones. We're also reaching a tipping point with costs of healthcare. There's all these debates and the presidential debates about should we have Medicare for all or should it be the Affordable Care Act or whatever. But the bigger question is, what are we doing to treat the underlying cause of why we get sick in the first place? And we did a study with Highmark Blue Cross Blue Shield in Pennsylvania, where you live, and they found that after just a year of going through our program, and by the way, Medicare created a new benefit category to cover my program for reversing heart disease, and we've been working with ShareCare. They've been training hospitals and clinics around the country, and we're getting bigger changes in lifestyle, better clinical outcomes, bigger cost savings, and better adherence than anyone's ever shown. And Highmark found that they cut their overall healthcare costs in half in the first year, and by 400% in the subgroup of people that they'd spent at least $25,000 on in the prior year. We spent $3.6 trillion last year on healthcare, which is almost exclusively sick care, and 86% of that is for treating chronic diseases that can often be prevented and even reversed through making simple lifestyle changes at a fraction of the cost.
The interesting thing, and I know we're running out of time, but we talked a little bit about the fact that these lifestyle changes don't have to be done in isolation. It doesn't mean that you're abandoning Western medicine and saying like, oh, we don't need that. We're going to just all go for a run, eat healthier, and then we're done. Absolutely. It really is about combining everything together and using the best of both worlds, right?
Yeah. Well, I'm well trained as an internist, and so drugs and surgery have their place. They can be life-saving when used appropriately. The problem comes when, for example, someone with high blood pressure or high cholesterol or heart disease is told, take these statins to lower your cholesterol, take these blood pressure pills, and they say, doctor, how long do I have to take these? And what does the doctor usually say? Forever, right?
Yep.
And when I lecture, I often show this cartoon of doctors busily mopping up the floor around the sink that's overflowing. Like, how long do I have to mop up the floor? Like, forever. Well, like, why don't we turn off the faucet? Why don't we treat the cause? And what we find over and over again is that the cause, to a larger degree than what we had once thought, are these lifestyle choices that we make each day. And when people make them, to the degree they make them, they get better in ways we can measure. And they can, under their doctor's care, they can often reduce or even get off of drugs to lower their cholesterol, their blood pressure, their blood sugar that they were told they'd have to take for the rest of their lives, which not only is, you don't have the side effects and the costs of that, but empowers you, make you feel like, oh, I'm actually getting better. And so you get into this virtuous cycle rather than this downward spiral that we were talking about earlier.
Yeah. Well, I think we're out of time. I wanted to thank you, though, because you really have been an inspiration, both to me as I trained to take care of patients, to sort of find a better way, and also to Startup Health and the Startup Health community, because you really are one of the originators of how do we get rid of chronic disease, but how do we live healthier, longer lives that are more fulfilling. So thank you for everything that you've done and everything that you're doing, and I'm just excited to see the results of the study and move from there. Yeah.
Thank you, everyone.
Thank you so much. All right. Yeah, thank you. All right, I'm back on. How is that? Everybody miss me? There you go. Well, I am honored truly to have our next guest, yes, who is following the footsteps of some of your predecessors at this. This is Wei Wei He,
yes.
And he is the CEO of HLI, or Human Longevity, which is one of our partners and one of, I think, the most exciting companies around. So thank you so much for coming in.
Thank you, Howard.
As I mentioned, we had Craig Venter on, who was one of the founders. We had David Caro on, last year, and now it's your turn. So it's an honor to have you
That's
here.
great. Thank you. Thank you.
So while I was actually, let's just start off first. For those who don't know what HLI is, can you just give a quick little, just explain what HLI is and the power behind it?
Yeah. Well, HLI is really to put it shortly, is the Central Intelligence Agency for your individual's health information. So, because in order to do preventative medicine, you need to have a lot of data on you. Because now with the genome sequencing is completed, with all the technology is available, we can collect 150 gigabytes of data from your body within 3 hours. And so how do we analyze that data to provide you with solution to do preventative medicine or disease prevention? That's really the essence of what this company is all about.
It's a lot of data. How do you? So, and part of that is understanding what's noise and what's actual real
That's
data.
Right. Yeah.
So, as I was preparing for this, I was looking back at your history, your career, which is amazing. So I want to start even before we get into your path in training.
Yeah.
What got you even interested in medicine and health?
Yeah. Well, that's a good question. Actually, I'm going to be a little bit provocative, here. So we have probably over 100 people here. And we all know one thing, so far nobody can change. We're all going to die, okay? Do we have an agreement on this topic? Does anybody of you here knows exactly what you are going to die of? Whoever knows about it, raise your hand. What disease, what specific disease you are going to be die of? Nobody? Do you think your doctors know that what disease you will be die of? Okay, so actually, I'm glad I haven't seen anybody raise their hand. They already know what disease they're going to be dying of. So let's keep that as a question in our head. So my actually personal involvement in life sciences really started when I was about 7 years old. I was growing up in China, and my parents was sent to the countryside to be re-educated. So I actually grew up with my grandmother. My grandmother came home one day and was diagnosed with late-stage cervical cancer, and she died within a month of diagnosis. And I wish at the time, obviously retrospectively, I wish I knew her condition 5 years ahead of time, because clearly we all know cervical cancer is caused by HPV viral infection, and it takes years for that virus to transform your cervical epithelium cell and eventually create a tumor and eventually metastasize and kill you. It takes years. And there's all kinds of preventative medicine, including today we have a vaccine for that. So my interest in life sciences really started when I was very young. So my whole life is on, in research in biology. And so I came to this country, wonderful country, with $50 in '86 to do my PhD, and thanks to President Jimmy Carter, and I got a fellowship, and I have to be the top 50 student in China to qualify for this fellowship. So I went to Baylor College of Medicine and studied molecular biology. Actually, the first gene I ever cloned is a gene called PSA. And I then went to Mayo Clinic because my whole life's interest is in research and how to turn research into solutions. So I went to Mayo Clinic. We actually did the early clinical validation of PSA as a test for prostate cancer. Then eventually I went to Mass General for a few years. And I'm a PhD scientist, but I went to the surgical department. And my mentor, Pat Donahoe, is a very well-known surgeon. And my trade with her is that she will teach me how to do surgery. I will teach her how to do molecular biology. By the way, after 20-some years, I'm still working with her. So I was the very few PhD scientists spends a day a week in the operating room as watching. I cannot cut. But in 1993, purely by accident, I bumped into Dr. Craig Venter. So my relationship with Dr. Venter started in 1993. So he convinced me to leave Harvard and joined with him the first large-scale genomic company called Human Genome Sciences, and HGS was started in '93. We were the first company doing large-scale DNA sequencing, buying hundreds of sequencing machines and do large-scale sequencing. And we all know that Craig eventually started another company called Celera and was the first company to decode the first human genome. So when I left Harvard already offered me an assistant professor job, and that was like my whole lifelong dream is to become a Harvard professor. But Craig says, don't worry, we're going to change the whole world. We're going to decode the genome and all that. So I actually went with Craig to Maryland and started with Human Genome Sciences. 4 years later, I actually by then, HGS already went public. We're already trading about over $1 billion market cap. One day, I suddenly had the enlightenment that actually startup company is one of the best vehicles to commercialize innovative life sciences ideas. Because in the university, you can write a Nature paper, a science paper, you can write in a New England Journal of Medicine paper, but usually that's the end of it. In a startup company, you can form a group of people and raise enough money, and you can commit to a particular product or service and really go for it. So ever since that realization, I have been building companies. So I built my own company, Origin. I have started my own VC fund, ETP, which has funded about 70-some biotech companies. So one of the reasons we got involved in HLI, coming back 360 degrees, is I went to see Craig in 2015. Mm-hmm. And Craig said, I'm starting a new company called Human Longevity. And I think that's the round you guys invested.
Yes, it is.
So we put in $40 million into it in the Series B. That's how I got on the board of human longevity, because longevity is always something deep in my heart. And so we got committed to human longevity. And then I got on the board. And then a year later, I think the company really, all life sciences company burn money like crazy.
Yeah.
A year later, nobody wants to invest in HLI anymore. So we are the only one willing to put additional money into it. So now I have a job. But I'm the only CEO pays zero salary. So anybody come to negotiate with me about their salary, say, I will set the example for you. Okay, so that's how I got involved in HLI.
How's that for honesty, right? I mean, how often do you hear that? True honesty.
Yeah.
That's wonderful.
Yeah.
So now that you joined, so now you're running HLI. Can you tell? So part of the thing that I'm fascinated about. First off, let me just say, I think that the story of your grandmother really, especially in today's day and age, shows us that there is so much that we can do both. In technology, but like we were talking with Dean, is preventative medicine, just small changes. But as you mentioned, there's an HPV vaccine that literally, if we make sure it gets out to people, can really change the face of cervical cancer and head and neck cancers around the world. And we really are a global community. I'm sorry, this is one of my passions, is making sure that it's not just in the United States or in China or in countries that can afford it, but we really owe it to everyone that we get these vaccines out all over. So sorry, that was just a side note that I know that it's probably a passion of yours too.
Oh, absolutely, yeah.
With HLI, one of your products, Health Nucleus.
Yes.
Can you just share with everybody first off, what Health Nucleus is?
Yeah.
And I just wanted to see if you could compare and contrast it a little bit to what our current healthcare system is like.
Yes. Well, I'm a big believer in preventative medicine. And this is why I keep asking people, do you know the disease you will be, dying of? For my grandmother, maybe a year before her death, if we knew about her condition, it's probably a curable disease. So the Health Nucleus really is, in the layman's term, you can think about it as the Mayo Clinic Executive Health, except the Mayo Clinic Executive Health still don't do whole genome sequencing, still doesn't do whole body MRI. We are using the absolutely bleeding edge technology to collect 150 gigabytes of data on you. And do AI machine learning and analytic to do disease prediction. For instance, we have a dementia model, probably is going to get a 510K approval. So we can predict what's your dementia risk. And I'll give you a few anecdotal examples. There's actually a PNS paper coming out on the first 1,200 patients. So we already done 5,000 patients. These are not patients. These are people came to our clinic. They're healthy. They think they're healthy. But the reality is the PNS paper will show you in a week or two, 2% of them already have cancer in their body. They don't know about it. As 2% people has brain aneurysm. And 40% of people have high liver fat and metabolic diseases. I'll give you one example. And sometimes, when a physician tells you, your blood sugar is slightly high, doesn't mean anything. We usually don't take action because you don't feel anything. Your liver fat is at the 5%. What does that mean? So for me, I already, after I become the chairman of this company, I said I better look at my data and carefully. It turned out to be, when I look at my brain MRI, there's already these white matters in my brain, which is caused by the collapse of the micro blood vessel due to slightly elevated, blood sugar level. But my liver fat is 5.7. My visceral fat is 5 some liters. So it's actually the brain image really convinced me that I have to take action. So in the last 6 months, I lost 10 kilograms. Well, I have a lot of resources. I caught up.
For the Americans,
yes.
How many pounds is that?
It's about 23 pounds, right? So I lost, but I have a lot of resources. I actually did it a very easy way. I caught up my professor, somebody I know really well at the Harvard School of Public Health. He's one of the best metabolic scientists, and Toby, and he said, Wei Wu, I give you a solution. You cut down a little bit of your carb and then do 1 day intermittent fasting every week. So I followed his procedure. I lost, 20-some pounds in no time. And then I went back to our MRI machine. My liver fat already dropped down to 2.5%. I lost 1.5 liters of visceral fat.
Wow.
Okay, and my hemoglobin 1AC went from 6.5 down to 5.3. So you can take action on your health, but the most difficult part of health data is sometimes it's difficult to convince people. The art of persuasion. I always use an example. The people who work with me at Human Longevity, they always hear about this. I don't know if you guys ever heard about Dr. Samuel Weiss. The guy first proved to people that gynecologists should wash their hand to decrease women's death rate at birth by 20%. But that paper, using a lot of data, took 50 years to convince medical community to wash their hand. How many women has died because their physician didn't wash their hand? It took 50 years. The guy actually died in the insane asylum, before his medical practice was accepted by the medical community. But if today I tell you that, hey, everyone should cut your liver fat by 30%. Some people will listen, some people won't. So how do we create enough data, right? So the power of data is really, I think, the essence of HLI, because I personally think, anybody had a baby before, when the baby is born, we usually do a blood collection on your neo, and historically you only test 2 genetic diseases. But with the genomic technology, you can do, using the same cost, pretty soon, to have all 20,000 genetic disease tested in the future. And I truly believe, although our current service for HLI is pretty expensive, I'm a big believer in 10 years to collect 100 gigabytes of data on anybody in the whole world. 7 billion people is going to be less than $1,000. And you only need to do your genome once in your life. You don't need to do it over and over again. With that information, you can really come up with a low-cost solution to do predictive medicine. And some people have cervical cancer risk. Some, like Angelina Jolie, she's born with a BRCA1 mutation, so she has a high risk factor for breast cancer. So you need to know about it. Some people are carrying, cholesterol genes. So I'll give you one example. We have a 50-some-year-old people coming into our clinic, and his father died of a heart attack. His grandfather died of a stroke, and his cholesterol level is sky high. The physician keeps telling him to take Lipitor and exercise, but after he done that, his cholesterol level is still high. So after the genomic analysis, we immediately find out this patient has a PCSK9 gene mutation, which is actually inherited in his family. So his body has a totally different metabolic mutation, which creates a high cholesterol level. And we all know that there is a monoclonal antibody drug. You take one shot, your cholesterol level will go down on PCSK9 gene. There's actually also a, kind of a holistic medicine. If you take the Indian turmeric, a turmeric target is actually PCSK9. So if you want to be a little bit, less invasive, instead of taking a monoclonal antibody, you can take high dose of turmeric. Yeah. But now there's actually even an siRNA molecule just approved by FDA. It's one shot a year, your cholesterol level will go down. So because we know these genetic information about this particular patient, he can avoid his father's fate of dying of a heart attack in his 50. He can avoid his grandfather's fate of dying by a stroke in his 50, because he probably will, live a very normal life with, because of this monoclonal antibody or this siRNA therapy that, because we know about his genetic information. Better yet, he can know his son and daughter, whether we need to do even earlier prevention for cardiovascular disease, because this patient already have a calcium score of 110, which basically he already did a little bit damage to his, cardiovascular, vessel. So this is really, when we put all that gigabytes of data together, we can do wonders in the future.
Yeah. So, I mean, this really, it's cutting edge precision medicine
Yes,
is really
exactly.
what it is,
Yeah.
right? And the power, I think, is really, as you said, it's not just collecting 1 or 2 or 1,500 people. It's collecting a global amount of data that you can really do true predictive medicine at a personalized level. So the power of HLI is just going to increase and increase the longer and the more patients you get.
Yes, absolutely. Well, for example, you will see we're actually about to make an announcement on acquisition of a company called DrForMe.ai. And Dr.For.Me actually just announced last week a formal collaboration with Mass General Hospital. So actually, as a patient, if we have all the data on you, finding the right physician is actually critically important. I give you one example. People think lung cancer is one disease, but lung cancer is probably 100 different diseases, or maybe 1,000 different diseases. If you're a small cell lung cancer patient has an ALK mutation, there's a drug like Xalkori you can take. Or if you're a small cell lung cancer patient has a NRTK mutation, FDA just approved the drug last year just specifically for NRTK mutation. So if you are a lung cancer patient, you went to a physician, for his whole life has only been using chemotherapy, you may die after 2 months of chemotherapy, because doctor has their own momentum. They don't always learn the latest thing, because they may not know the NRTK mutation approval in 2019 by FDA. So, but if you know your mutation, if you have an NRTK mutation, then I would actually send you to a doctor at Mass General, actually did the phase 3 clinical trial on NRTK. Your likelihood of surviving 5 years is going to increase dramatically versus if you just randomly went to a chemotherapy doctor. So this is actually the platform we are establishing, is how to use data to make you live longer and healthier. Ideally, in Chinese medicine, there's always a saying, the best doctor is their patient never gets sick, okay? But those doctors never get famous, because people only get famous if they treated the terminal patient and they got 2% of the patient alive again. So if you're a doctor, your patient never gets sick, you're actually not going to be famous, but you will save a lot of lives. That's what HLI is really for. Thank you very much.
That is great. Yeah. Well, I want to thank you, because truly, as I mentioned with Dean, we at StartUp Health, first off, we're so excited to be partnered with you guys in this vision of changing longevity, making sure, again, that people live long, healthy lives. And I think the key is exactly personalized medicine and prevention.
That's right.
If we prevent it, then I think we're all going to be happier. Yes. So thank you so much. Big round of applause. Yeah. Thank you. All right. I'm not even going to step off again. We're going to just bring up our next guest. If he's, there he is. Please help me welcome to the stage Rishi Madrik.
Keep going.
I know.
They
kept me. I think I did this last year for the marathon.
I know.
Welcome.
Well, thank you.
Welcome. It's exciting to have you here.
Yeah, no, absolutely. Second time, so it's different this time around.
I know. So I'm going to start off. I just wanted to because I think it's an amazing thing for those of you who don't know Rishi. Started off in emergency medicine, right? And I always find this amazing as an emergency medicine doctor. But you were also an expert in blockchain. How does that even happen?
Mostly by mistake. I'd love to say it was a stroke of genius or an epiphany. It wasn't. My interest had always been in technology while I was in residency, while I was in my training. I'd done a lot of work in tracking patient populations and looking at different databases and how we interact with different databases and communicate information. And at the same time, I had friends who had gone the startup route and engineering route and said, have you heard of this Bitcoin, really, is how I got into it. And the two are different. And they said, listen, you should check out Bitcoin because there's a fun way to play online called Satoshi Dice. So it's not a very glamorous start, but that led me down this rabbit hole of understanding the technology of how this currency was transacted, how it was accounted for, and how it's also distributed and unlocked. And so that started, me down that path years ago. And I had tucked it away for a little while as a hobby and interest while, developing my first company around telemedicine, and brought it back as I sought a way to create security as well as accessibility around data and incentivize that patient interaction. So that's how it all came together for me.
Okay, and is that where BitMed came from that then, directly?
So my prior startup health company was BitMed, and we delivered a telemedicine product domestically and internationally. And we sought to subsidize the entire patient interaction at no cost, based off of data sales, de-identified data
at what
sales.
cost?
No cost.
Yeah.
And so we fully subsidized primary care, preventative care, women's health, even had started down the path of mental health, through just de-identified data sales and that entire process. And we leveraged blockchain to be able to incentivize to be the conduit for data transaction while rewarding our patients for participating in that interaction as well.
That's amazing. So what would you say to the people who say, you can't drive the cost of healthcare down to zero?
Well, I have about 100,000 interactions that are pretty wrong on that one.
I love it.
So that was a nice accomplishment. And that led me to discovering Rejuvenon and Fred Nazem.
Which is an amazing, another really interesting story, because you're doing your own thing with BitMed, and then just can you explain first off for those who don't know who Fred is and what he was doing and how you guys, this whole conference is really about collaboration and how you guys sort of got together and decided to merge.
Yeah, absolutely. So Fred Nazem was the co-founder and then CEO of Rejuvenon Global Health. He had a long track record in healthcare, has a long track record in healthcare.
He did.
Having just celebrated, I think, his 80th birthday, and I don't think he'd mind me saying that. But his track record, dates back to starting the earliest VCs out here on the West Coast, having IPO'd 3 companies that he helped co-found as well, and been a part of 60 other IPOs. He turned around Oxford Health and has led to its value creation since. And so he has been a cornerstone in healthcare and its development.
He's legendary.
Exactly.
I mean, he really is. He's legendary in healthcare.
And so it was an honor to meet him. And he and I actually met at Columbia, at a conference at Columbia where I was speaking. And Fred and I sat down for coffee. I admittedly did not know everything about what I just said. I just said, seems like an interesting person to talk to. And we sat down with coffee. And he described Rejuvenon to me there. And he said, I'm looking to create a way for people to access their health that 95% of the time that they're well. Yeah. I want to be able to engage with them in a personalized, accessible manner on their terms. And I've created this platform and this experience along with a score to help them create an objective score around their health, founded in science, and then execute on that score for a sense of betterment on their terms. And I was a little bit awestruck at that moment because that's the pitch that I give for BitMed, just from the other angle. My angle was always, we started BitMed to create personalized, accessible healthcare, by driving all the barriers down to zero, starting with cost. And so we wanted you to think about your health, to think about BitMed, but we engaged it from the sick care side. We had a team of physicians, a medical practice that covers the entire US, and at that time international as well, that would allow you to talk to us, address your primary care, preventative care, all those goals, and then get you engaged on your health from there moving forward.
Right.
I realized for BitMed, one of our struggles was we become problem focused. And the success that Fred and Rejuvenon had is they are people focused. They're focused on the person, not just their problems. They're focused on what are their needs, what are their goals, and most importantly, as you find when you engage with consumers in health, what are they willing to do?
Yeah.
That is another driver. Because if you create a plan as a physician, right? If you create a plan, they take the statin, go run 5 miles, and you're going to do great with your cholesterol. Then they go home and pop some Big Macs and never run again. You just lost. It doesn't matter if you had the right plan. That wasn't the right plan for the patient or for the member.
So I want to so when you go to the Rejuvenon site and you download your platform, right? That's one of the first things it has you do is answer a bunch of questions, and you come up with this sort of combined score that is a generalized health score, right? Mm-hmm. And it's all based on basically Nobel Prize true scientific data, right?
Yep.
And reproducible and trackable.
Yes.
And that's, I think, right, that's the power of this, is you can actually follow your progress and you can follow the patient's progress. One of the things that I'm amazed at, and that it fits right into our driving the cost down to zero, is what does it cost the patient?
$10.
Every time they come on?
So it's $10. You pay a $10 subscription fee to have access to your experience. You have everything planned out. Your initial wellness visit is free or included in your subscription.
Yep.
And if you need to do a sick care visit with one of our doctors or one of our specialists, it's $10.
Yeah.
No insurance. We're not, it's no hidden fees. There's no markup. It's just $10. If you engage on your health and you engage in your plan and participate, you can drive your cost again back down to zero. You can earn our Rejuvenon reward points to subsidize your physician visits or other goods and services in our marketplace.
Stop and think about that for a minute, right? You have access to physicians, to people to help you to stay healthy, or if need be, to get healthy, and the cost can be driven down to zero. I mean, it's revolutionary, and I mean, we're just proud to be part of your journey on that. But it's an amazing. It really is an amazing thing. So how do you get once you get patients onto the platform, how do you keep engaging them?
Absolutely. So it actually starts, what we learned initially with Rejuvenon is, you have your health score, which is 10 biomarkers that is based on that telomere science, right? Those 10 biomarkers have 3 unique traits. One is you can do them all from home. You don't need to go into a lab. 2, they're immediately relevant to medical practice. So just as it's important to our health score, it's also important to tell your doctor about your A1C, your systolic blood pressure, how much you're drinking, your activity, et cetera. So it has that relevance there. And the third component is it directly relates to the elongation of telomere length, which is what was shown to prevent or improve morbidity, mortality. Adding length to your years and quality of life to those years as well.
Right. And that is a malleable thing. You can actually, even though many people say, "Oh, we talked about to this with Dean," is what does health and diet and exercise and changing the lifestyle do? But that actually can affect the telomere length, and you really are increasing longevity, right, and
Absolutely.
health.
And so what we do is you get that score. That's your set point. That's where you're at. You're 67. You're 78. That's okay. That's where you are. And then there's a risk detection and treatment engine that starts driving this personalized experience for you. That is, where it really starts. Well, we added in a layer over that with the acquisition of BitMed. We introduced what's called the initial wellness visit. This is that no-cost wellness check. So when you come on, I don't really want you to answer any questions. I just want you to schedule your appointment. Let us do the heavy lifting, because that's how you get people to care about their health. It's too much to ask people for more once you've had them sign up. It doesn't work. What does work is giving people something of value when they sign up. And most people today cannot sign up to a service and schedule an appointment with a physician who's going to end with a team that's guaranteeing they're going to be with them throughout their health journey. So that's what we offer right when you sign up. And that's what's gotten us our adoption and really gets people going. That's that primary engagement. Now, once you're on the platform, that risk detection and treatment engine, that's driving an experience for you. So if you would, and so let's say for me, I could probably do better with my nutrition. Actually, I know I could do better with my nutrition because Rejuvenon really made me quite aware of that. And so my weakness is apparently high glycemic foods. So I get notifications.
I think it's all our weaknesses.
Exactly. But I get timed notifications to when I'm going to make my decision as to what I'm going to eat today or what I should pack for lunch. You know, should I have that extra snack before bed?
Yeah.
The app engages with me in a scalable manner because that's the artificial intelligence. Sometimes you need more than just you and a robot.
Yeah.
So we have user communities, people with you on the same experience to reach out for support, for information, things that you may not discuss with a doctor because we don't know.
Yep.
You know, it may just be outside of our respective scope as to what's the best grocery store local to me to buy this type of organic food. You know, that's a community question. And then finally, that care piece of having a physician at any time you want. You can do consults on demand, and you can schedule them if that's better for you as well. So that's how we start that engagement, through behavioral nudges, notifications on the app, our own chatbot, or really personality to the platform, as well as live human user communities. My opinion is that the best mix to engage in healthcare is the right mix of human touch made scalable through technology.
Right.
The technology should fall behind everything else. Our users don't know about a blockchain. They don't need to. No one cares. You know, our users definitely don't know about the artificial intelligence because no patient cares about your algorithm. What they care is that, is this service, is this experience about me? Is it relevant to me? And does it trigger me at the time when I'm going to make a decision?
Mhm.
And that's what Rejuvenon seeks to do.
So with a cost model that's so cheap to, I should say inexpensive, to take good care, preventable care, right? Because that's sort of going back to what we've talked about with HLI and with Dean. So much of this is prevention, right? If you can get your hemoglobin A1C down because you're getting reminded, hey, maybe skip that extra, like you said, high glycemic meal or snack, or, you know, hey, did you haven't exercised in a few days? Maybe, you know, go for a run or stand up at work.
Or earn a point for exercising, right? Sync your Apple Watch and go get that mile, you know?
Exactly. Yep. So as you move forward, do you see, where do you see Rejuvenon sort of settling in the healthcare system? Is it something where you think that health systems are going to start to do it? Do you see it by itself as a preventative medicine tool? Do you see insurance companies saying, hey, wait a second, they're doing what, you know, they're actually helping us reduce morbidity, maybe we should partner with them?
Yep.
Or all of the above?
So I see Rejuvenon's platform and experience as, if you will, a bit of health navigation. You know, this room is filled, right, with companies that have created brilliant solutions, right? But solutions don't matter if your patients don't know, if people don't know when to get to them and how to use them.
Yeah.
That's where we've fallen off in healthcare. What we're able to do is, you know, we offer our own solution to help the patient get started. We bring in partners that, you know, we vet and we provide solutions to them that are immediately relevant for them. So if you need that de-stress, improved sleep, you have diabetes and hypertension, let's bring in the right services. If we have them or if a partner has them, let's bring them in. Yeah. If you do a consult with one of our doctors, and listen, not everything can be handled over telemedicine. If we need to hand off care, then we want to hand you off in an appropriate manner. Let's find the right health system under your insurance to provide you with the best possible experience, both health-wise, but also address your personal needs, financial concerns, timing concerns, et cetera. When we look for partners now, we see, you know, our deployment, we have two primary business channels. One is what you'd expect a B2B2C, where we work with insurance companies, we work with, you know, employers to provide our service, you know, to their members.
Yeah.
But we also have a strong B2C channel. This is what we started, you know, since the BitMed acquisition. Because at the end of the day, whether it's an employee or it's just a person who saw an ad, it's a person using your product.
Yep.
They need a community. And Rejuvenon is a movement.
Yeah.
And so we want to create that. So we have social media influencers. We have other brands working with us to, you know, to sponsor giveaways or sponsor, you know, create brand awareness and interest to make it actually enjoyable and positive to engage in your health.
Yeah.
So those are the two channels, and we engage with partners on both.
Yeah. I was going to say, what an exciting time, because as you mentioned, as you increase the companies that you're partners with, as technology and data improve and provide you with more data points that you can actually be focused on, right, in your overall score, it's just going to get more powerful and more powerful.
Absolutely. It's interesting as I was listening to the last speaker speak about data, I couldn't agree more.
Yeah.
When you talk about population health and cohorts of data, but people in and of themselves are little treasure troves of data when you can engage with them longitudinally in a structured manner. And you can actually drive users, drive people, on how to engage in a predictable manner with their health and provide a service around that brings honestly back the magic of technology.
Yeah.
When someone logs in or doesn't even log in, but gets that alert at that moment in time to help direct their behavior to produce a tangible outcome for them that they were willing to do, you just won. Because they feel like they did it, and they also feel like, hey, this app knows me, this service, Rejuvenon knows me.
Yeah, and it really is an amazing thing. I know we're running out of time, but just when as a physician, I was always, and I don't want to say skeptical, but you're like, will people really adapt to little reminders on behavior? And something as simple as on the Apple Watch, the take a deep breath, that you get pinged every once in a while. And at first I was like, what's this? And I would just turn it off. Then I was like, well, let me see how it does. And it really does. It's a small lifestyle modification, but I think it does relax you, de-stress you a little bit, and say, oh, okay, let me get back to my day. It's not intrusive, and I think that the benefits can be absolutely amazing. And I think that the other thing which you had touched upon, which is this is really a combination. People don't understand that population health and personalized medicine are actually really intricately tied together, that you can't have one without the other. Yeah. So I think we're out of time, but thank you so much. I'm so excited to watch Rejuvenon grow and continued success.
Thank you so much. Thank you for having me.
All righty.
Welcome back to the stage, Startup Health's Stephen Cryan and Chief Digital Officer for Novartis, Bertrand Botson.
I think I can officially say good afternoon. Good afternoon, everybody. All right, I'm going to ask everybody to stand up. Let's get everybody up. I know. And we're switching crines. So I'm going to be up for the next 20 minutes with my good friend and our partner, Bertrand. But before I do, just hands up, stretch, everybody just do hands up and stretch. And like this, back, and up again. And there we go. Now, feel better?
You didn't tell me about this.
I know.
No?
Well,
okay, good.
It's great to be here. Bertrand, I have to give a little context for those who haven't been following the Startup Health and Novartis partnership over the last 2 years. But what's amazing is we're at the 2-year anniversary of sitting down.
True.
I think it was the Wednesday after the festival 2 years ago to talk about both you and Vas, who are pretty new to the roles of both CEO and Chief Digital Officer, about what your plans were to really reimagine Novartis for the next decade and beyond. And so as kind of a kickoff, I would love for you to kind of give a little color to that moment in time, where you were coming from and where you were kind of thinking, and then we're going to talk about what you've learned over the past 2 years.
No, I remember it was 2 years ago, was pretty much my first day on the job, and getting thrown into the arena of JP Morgan and without even knowing the healthcare space very well as part of it. So it has come a long way over the last 2 years, but I cherish that moment. I have to say, I always love coming here as well. Katia just brought me upstairs as well, and seeing I heard 2,300 one-to-one meetings happening as well over the course of the next couple of days. It's incredible what you've built in here with Startup Health. And candidly, I'm spending more time here in this building than I'm doing at JP Morgan itself. So this is a place.
Thank you. So by way of context, your background, because you're not from healthcare. You were at Amazon before. Just give a little context there, and most importantly, what you brought from the non-healthcare world to your thinking as Chief Digital Officer at Novartis.
Yeah, so my time at Amazon was a long time ago. I started there in 2003, but it was still a pretty small startup that was starting to professionalize itself in many ways. Probably the two things that I took away at the time were the absolute customer obsession and customer centricity. That's why I always love coming to those rooms, because that's what you get in spades, at least for all the ones actually finding a path. And the second piece is also the platform play, so the natural thinking about scalability from the very get-go. Even still being small at the time, it was obvious that this startup, Amazon, was meant actually to really scale at massive scale. And I think this applies to what we do in healthcare in many ways. We have way too many pilots, way too many small experiments going on, and not enough scaling. That's one of the reasons probably why we haven't cracked the code yet. So how do we equip ourselves for that? And we still have a long way to go to get to the right patient centricity or HCP centricity or nurse centricity that we will get there over the next 5-10 years together.
So on that day 2 years ago, one of your first days, what did you think you were signing up for in terms of not only taking the role, but taking it with a new team that really was going to make a much, I think, more ambitious commitment than ever before about the future of health and what Novartis and its partners and its teams were going to work on?
What attracted me to it was the fact that it was a white canvas. It was 2 years ago, you could sense. It was the time when data, digital, technology was all started to converge, and we were all trying to figure it out. But the fact that there was no playbook as such, you had seen it happening in many other industries, in retail, in entertainment, in many other spaces before, but everything was to be done here. There was a wave of freshness as well in Novartis' new team setting up with Vaz taking the helm. It has been largely a new team since then as well among my colleagues. And there was really a mandate to go and make it happen across all the areas of the business, from research and development, which had specific challenges in their own right. So how do we take out a good couple of years of the time to get our drugs to market? What if on the commercial side we could get twice as many patients, twice faster, and to reach them, get them on the right drug regimen to that type of speed? And on the operational side as well, big challenges of simplification of the operation, talking about billion plus of savings as well, to be able to reinvest that into R&D and commercial with the launches we had. So it felt like an irresistible type of challenge as well at the time, and certainly proved to be true.
And what would you say is your biggest either surprise or challenge over the past 2 years? If that was kind of what it was when you were bright-eyed, bushy-tailed, new on the job, what's been the biggest takeaway of the past 2 years?
Surprises. I think maybe a few. I think the first one is that pilot to scale has been a big one. And it's something that's not easy in this role, because I'm coming from an entrepreneurial background, naturally curious, naturally interested by many of the things that the room builds, and helping us, you take the 10 or 11 moonshots, how do we leverage the team here as an extension of our own team to really go after that? But at the same time, it's an industry plagued with plenty of pilots that are being reproduced all over in different countries, often doing 5-6 times the same thing without realizing it, and we don't scale. So we get a lot of energy in the system, but then if you don't pay attention, it doesn't scale, all this effort is pretty much for nothing. So I think I would define my year one was all about getting that energy, getting the teams organized, having clarity about what we really wanted to pursue, and the big underlying platforms we wanted to get. And year two has been more about shifting that energy, now that we started to make it irreversible, into big scalable areas that we can get. I think that has been one. Two is probably still the major gap that we have in customer centricity. It's still not in the DNA in healthcare in many ways.
Can you explain customer centricity for those who aren't familiar with how it's defined, especially within Novartis or the industry?
I think it's quite simply. It's putting yourself in the shoes of your end customers at the end of the day and building everything backwards from there. Amazon being incredibly good at that, doing the PR FAQ from fairly early on, even 5 years before it even starts, saying what does the experience look like at the very end, and then how do you assemble the team for that? I think we do incredible good things, but that's not necessarily in the DNA. And so that's where I find a natural fit between what we do and all the strengths and the muscle and the ability to internationalize and the incredibly scientific background that we have, with probably a lot of the more customer centricity that we find in this room.
And so I'm assuming that it's been smooth sailing with the team since you came on board, and everything you just outlined got done without a problem or pushback from the team?
Yeah, it took some work, and we're in the thick of it right now. Obviously, everything is still to be proven in many ways, but I think we have made some good forays. We have, for example, 12 big, what we call digital lighthouses. We talked about them with Unity last year on this stage. I'm proud to say that we have made a lot of progress on those, starting to really scale those. Those are foundational pieces that are starting to come to fruition. Long way to go, but at least we're in the game. At the same time, we have a few bold bets that we are looking into. Take, for example, our partnership with Stenson in China and how we can get to heart failure patient post-discharge, starting to really having proper MVPs and with real ambition for scale on the back of that. We have done, I would claim one of the aspirations is also to make Novartis digital. We have a long way still to go, but it's happening. It's really happening when you go on campus, you spend time with the teams. The natural appetite for data science, the appetite for partnering, the appetite to really nailing the experiences as well as really increased, and a lot of demystification. And finally, to me, the point that I'm really, and the reason I'm here and excited to be here, is how do we become a credible number one in the tech ecosystem, and or at least a major, a real player that can contribute to what you do. And I generally view this team here and the 315 startups you have as well on within Startup Health as an extension of our team. And it goes from how do we equip ourselves to be able to be a good partner with smaller startups, with academics, all the way to last year we have announced partnership with the likes of AWS, with Microsoft, with Tencent, so to scale as well in that dimension.
So you dug into this great blog post on LinkedIn, I think it was yesterday or the day before, outlining a lot of the thinking that you've done around partnerships. I'm going to ask you the same thing I asked you about lessons. Like, what has been the biggest learning from contrasting these large partnerships with the Amazons to, there's been, I think, 11 or 12 collaborations and partnerships at the startup level with startup health portfolio companies. So if you kind of use that as the bookends, what's been the biggest thing you've learned on that? And some of this is in the post, but I want you to elaborate a little bit.
A few things. I think the first one is a candid realization that it's hard to work with us. We are big Novartis, 110,000 people across the globe, plenty of very matrix in many ways. So when you take that as a starting point, but we need that help deeply because we need the extension of our team in the dimension, is how do we rethink that? How do we make it much easier? How do we become much more single point of contact? So that's why we've launched the Biome. That's why we've made a partnership with Startup Health as well, with the team being even embedded within the Biome as part of it. So almost in the shoes, if my customer is a startup, my customer is a partner, how do we really rethink the relationship so it's much easier for you guys to work with us? So in terms of a single point of contact, in terms of type of help we can have, but also in terms of data assets that you would want to get access to trials, you name it on the back of it. So Jeremy, Sven, Robin, and the team have really come, I think, a long way of trying to set that up across Novartis, including legal, including procurement. Now, at the same time, it's hard because it also means that a big learning was also to have to say no to many, because it's naturally exciting once you get the get-go on that and saying, yes, we want to work with many more startups, you get flooded to some extent. So how do you stay true to your core? And they almost reverse it the other way around. It's like, how do you put yourself in our shoes? How do you think about the main challenges and the main pain points we have? You think about the key launches that we have ahead of us and where you can insert some piece of the solution where we really have some gaps as part of it. On the data play, there are massive data plays to be had, massive data harmonizations to be had. Who can best help us on that? So it has been a long journey of also a lot of no's, but with the one that we work really equipping ourselves to be able to go and scale those together in a more streamlined way.
Yeah, so one of the things that I remember both Vas, when we first met him, I think it was actually before he actually was in the CEO role, he spoke 2 years ago. You, of course, Jeremy and the others of the team talked about you didn't want to view customer-vendor relationships. You wanted to think about them as collaborations. You didn't want to think about investor-GP-LP relationship. You wanted to think about collaboration. That really sounded great, but hard to believe. And yet, over the last 2 years, you've made it reality. The idea that you don't treat your collaborations as vendors or vice versa, and you don't treat the companies or organizations like Startup Health that you invest in as just the investments do it for us. There's really a unique worldview that I think you and Vas and the team have executed on. Easy to say, I said, but execute on so well. What and why, I should say, do you think you've been successful at changing the mindset inside of Novartis, and especially with the partners that you now have over the last 2 years and bringing them along for the ride?
You're right. I have a very natural aversion to vendor relationship because it's arm's length. It's often synonymous with big waterfall, slowness, massive teams, ill-defined definition of when you get it wrong, not adjusting. I'm coming from a world of 2 pizza teams at Amazon, where it's like, what's the minimum team setup that you get together? What are the complementary type of skills that you bring on that? So that's the nature of a partnership, truly of a partnership. And again, we see many people in these rooms upstairs have complementary skills that we don't have. So how do we bring those in? It's not easy to do. So we've been talking a lot about, and still are, about productization. I think we have some great beacons within the company now where it's starting to work, and it's a joy when you get that, when you see those product teams of 8, 10 people really going after it, iterating quickly. When it's no slides anymore, it's purely based on demos on a bi-weekly cycles. That's what gets me really going. And I would love to embed that everywhere we can. Vaz would love that as well. And so that almost to some extent, how do we aspire in 5 years to be more startup Novartis? Not only with startups, it's also the way we have set up the partnership, for example, with Microsoft, is with 3 different facilities where we are co-locating the team. We're very specific about the type of challenges that we're taking on. There is a portfolio of challenges we're taking on, but they are really organized along those lines as well with complementary skills. We have teams from Amazon, from AWS on the pitch with us, including in some of our manufacturing facilities. It's incredible to see the natural DNA of each being actually spreading from one to each other. That's incredibly valuable for us. It may sound soft, but incredibly valuable. Same at Tencent. The speed at which our team and Tencent are working together, figuring it out in some of the most complex challenges are really rewarding to see. So that's what we aspire to get to.
So I had the honor and privilege to come to Switzerland a few months ago for your leadership meeting with your top, it was like 200 leaders, 300 leaders around the world. And I was really blown away, pleasantly surprised, but blown away by how quickly the mindset shift took place within the organization and how digital at the finance level and every aspect of the organization has been completely transformed. What did you do inside of the very short period of time, that you really had done it to really be able to make the leadership team meeting from 2 years ago be radically different than the one you did this year in Switzerland?
Well, first of all, thank you Steve for joining us as well. I think there was some magic in the air on those 2-3 days. Maybe for the benefit of the audience, we do indeed a leadership team event once a year where we get our top 300 leaders all together. Usually, more traditionally, we would review the entire strategy, all the business planning, etc. And credit to Vaz for that, being one of our, going big on data and digital being one of our top 5 priorities. We decided, you know what, let's give it a moment where we've made enough progress. We're at a moment in time when we want to make it irreversible. How do we decide to make actually those 3 days entirely about that theme? So that was a decision at first, to say, first, it's one of our top 5 priorities globally. And 2 was to say, let's take the entire time, aside from the first hour that was on strategy, the 2.5 days were entirely around going big on data and digital. Implicitly, it's more than that. It's also a cultural agenda. It's also the unboss movement that we cherish and we're really trying to
unboss. Just explain that one piece, because I learned a lot when I was listening to the team that was there. Unboss and unbossing.
We believe that there is a lot of empowerment to be done among our team, especially in scientific teams where it's all based on learning, as opposed to, we've been students of Microsoft from that, instead of know it all, moving to learn it all. How can we have a culture where we define some ground rules of the game, we define the boundaries of the tennis court, and then we let the team really operate in that. So what we call the unboss movement. Not something easy, by the way, because unboss doesn't mean anarchy. It means being comfortable to deal as well with complexity and dualities all the time as well about how you do your role. But we think the digital agenda comes naturally into the unboss movement that we're aiming to get to.
So there's an interesting thing. We've spent a lot of time, Unity and myself and a number of the team members, meeting with CEOs of pharma companies all around the world. And what's fascinating that we quickly learned many years ago, and I think it's even more true today, is whatever the CEOs and the teams are working on today is not necessarily going to affect the short term. It's actually a decade or 2 out. And at the same time, you're inheriting stuff that was from 10 or 20 years ago. Was there anything that you had to do from prior kind of Novartis to really make a radical shift for the 10-year kind of trajectory out? If I think about 2030, we talk about our big health moonshots by 2040, the UN Sustainable Development Goals by 2030. When you think about your tenure and Voss's tenure, we know that you kind of get a baton passed to you and you pass the baton. How do you think about that in terms of just your own legacy there, but also what you've had to kind of do to shift from where you got handed and what you want to hand off?
Yeah, I think it goes back to your question about the learnings. Is one of the main one we had fairly early on is like you can dream as much as you want about it, and including our type of moonshots, our big what if that you have been party to on that. If you don't have your foundation in the right place, it's not going to happen over the next 5 to 10 years. So a very first step we did was what I referred to earlier as the 12 lighthouses. So those were 12 infrastructure programs that we put in place. Those are not my programs. Those are programs that are held by the executive team overall. We are holding hands on those 12. We keep shaping them as well when we get it wrong. We killed a few where we got it wrong and we adjusted accordingly. But those are programs where we gave ourselves the freedom to say, we'll take the next 2, 3, 4 years to really invest in those. So we'll put the right capital. We'll put some of our very best brains as part of it. When do we need to complement it with the right partners as well to be able to make some of those happen? A lot of those are non-sexy pieces, like take our main initiative that we call Data 42, is how do we make sense of the 2 million patient years of clinical trial data that we have? That's pretty hard work on that. So how do we find the best partner to help us on that and really creating those data lakes and those foundations? How do we then invest in the right type of data set that could feed into that? And clearly as well, investment in talent. Where do we have gaps in talent on as we have 12 mega launches ahead of us, digital marketing, how do we invest massively in data science and AI because we know this is coming? And to be able to do what we're dreaming about, we need to have all those foundations and talent in place.
Yeah, it's definitely an exercise in both being patient for the long term but disciplined on the short term to be able to make that happen. I think one of the things we outline as part of our core values and our mindset is this idea of long-term commitment, knowing that we don't choose partners and we don't hope to have partners to choose for short-term. And I think one of the things that's really interesting about Novartis and everybody around the Novartis ecosystem, I think, are playing in a very unique way, thinking about the future and playing an active role in shaping the conversations. As part of that, I want to open up and allow for there to be Q&A to you because I know there are people with questions for you. Yeah. So there's 2 microphones. If anybody has any questions, I'm going to take a couple as we wrap up. One kind of leading question to what I just explained is this idea of collaboration. What does it mean to you when I think about there's entrepreneurs in this room at all stages of development, many of you partnered with, many that want to partner with you, many that you're going to want to partner with. What would you want to say to them in terms of that comment you made earlier, it's not easy to work with us? What do they need to remember at every step of the way?
So I saw a few friends just while walking upstairs. I saw the founder, for example, of Doctor.com. I saw some Komodo Health and others. So really great partners. We've done 12 plus partnerships just last year alone on top of some of the big ones I was referring to earlier. To me, there are 2 sides to that. There is one which is, and that's hence the investment in the biome. How do we put ourselves into your shoes much more? So the close proximity, hence the investment in startup health is critical to us and being partners in the first place. But maybe a message to me the other way around that is easy maybe to underappreciate is the mirror of that is how do you put yourself into our shoes? So our teams are incredibly, it seems like a lot of people, 100,000 people, and it is a lot of people, but our teams are incredibly busy. They have, often it bounces from one department to the other. Often the problem is not well defined, and then by default, someone gets excited, but it doesn't really get the traction. And the danger is like a startup thinks, great, I'm working with Novartis, or I'm working with that big pharma, I'm in there, but if we cannot build traction together, it's an illusion. So my step 1 would be how together do we really define the 5, 10 challenges that really matter? And for that, a practical invitation would be just, even on our annual report, just to look at, or in all of our statements, the type of launches we talk about. When you look at some of the ophtha launches we have, some in cardiovascular that we have right now, you can quickly get a sense of the typical pain points that we're going to have to go and launch those. We are quite vocal and transparent about those 12 lighthouses I was talking about. We can quickly see the things that will get massive momentum and on which we're putting meaningful budget and talent behind. So come and help us on those. If you come and help us on those and you really have solutions that help on those, the best will really find their place and will let you amplify yourself. And our commitment, I would say, to the room is that we'll say no to many, but once we come in, I think what we have to offer is not just even a national play or local play, is that if it works, and that's my absolute obsession coming from pilot to scale, is then how do we get you, if it works in the US, do we get you in France, in Spain, in Germany, in the UK? If it works on a few trials, how do we get that embedded across our portfolio of trials where it makes sense as part of it? So that's what we have to offer. But I'd love us to put ourselves in your shoes and you to put yourself in our shoes on the big problems.
Love it, love it. And I think the dozen companies in the Startup Health portfolio that have partnered with you have said time and time again, we got started and then it just expanded from there. So, you know, what you just described is exciting and thrilling. One question over here, and if there's one over here, yes.
Hi, Paulina Hannon, Portfolio Director of Startup Health. So I personally am really excited about your dozen partnerships with the companies and with the health transformers here. My question to you is, so we talked a lot about collaborations with the B2B side and how you're working with the ecosystem. How does Novartis think about really partnering and engaging with patients and with families, caregivers, nurses, the people who are really on the front lines?
Yeah, I'll take a very concrete example. I was referring to Doctor.com, and I don't know if the founder is in the room, but...
Andre and Rita, you guys here? They must be in one of the 2,300 meetings upstairs.
There was a very concrete example where we're launching, and Ronnie and the team working on this is in the room. The credit goes to them collectively. It was, look, you have 100,000 patients suffering from ankylosing spondylitis in the US, for which we have a drug that could be eligible for. How do we go about that together? How do we identify them? The problem statement in that case was, look, it takes 8 years for those patients to be on the right drug regimen. 8 years. So it means those patients are starting from primary care to trying to find their way, Dr. Google, then getting to a specialist, getting to another specialist, and there's a lot of inertia in the system. It takes a very long time. So there we looked at, okay, that's a simple but highly complex to go after problem statement. What we love is we launched a campaign called, or they launched a campaign called Pain in the AS, ankylosing spondylitis, and with Doctor.com, of finding what are the different partners we need to go and effectively identify those patients, activate them, having the right content, creating the right trigger, where can telemedicine help in that space? So it's not telemedicine abstract, it's more, once we have identified them, how can we effectively have a relationship pretty quickly, having the right content with our medical team and our commercial team on the back of that. And they managed to get, actually in no time, to get, if I'm not mistaken, 35,000 of the 100,000 eligible patients to get to that. That's very front line. You could apply that logic, back to my point earlier about finding the pain points, to pretty much all of the key drugs that we have. I have another example in mind, which is we have a drug in ophthalmology that we just launched, of which I'm very proud of, because my granddad, who is 97, is suffering from wet macular degeneration. It's an injection in there. And there, the problem is different. The problem wasn't a complete patient experience you create. It was more, as soon as a patient gets into the doctor's office, the doctor gets a lot of choices among 3-4 different drugs, and there's a battle of the fridge. Those ophthalmologists can decide among those. They have to take the stock. They often carry for a couple of millions of dollars into the fridge, but they don't know if with us they are going to be reimbursed. So there we played, it was more a data play of who can help us almost in real time when the patient come in, for the doctor, for the HCP and the admin team to know that effectively they would be reimbursed if they administer a drug on that. So again, horses for courses on those, but really framing the problem and then the best partner to go and help us meet that. In that case, Komodo Health.
Excellent. Well, we're out of time. Bertrand, I want to thank you. The last 2 years have been a thrill and incredibly inspiring that you guys said something 2 years ago and you did what you said you were going to do, and have been a really terrific partners, not just to Startup Health directly, but these entrepreneurs in our portfolio companies, raving about everybody around the organization that, just like leadership does, talks in a very unique way for a pharmaceutical company, especially a long-standing one that I think has been historically more difficult to work with. And I think you've made a quick mindset shift with everybody that works with you. So thank you for your partnership. Thank you for coming here once again and giving us an update, sharing your learnings. We look forward to doing it again next year. And as you continue to share your learnings, hopefully it becomes more obvious to others about how intentional you're being and committed you are to transforming health and really making an impact on the health and well-being of everybody you serve. So thank you very much.
Thank you to you, and thank you to the room as well. And those, I mean, again, I find it mind-blowing that we have 2,300 basically one-to-one meetings happening upstairs. I think it's not, I've never seen, I've come in from several industries before, I've never seen something like this. This is incredible what you've created. I think the sense of purpose in health probably creates some of that as well, and the appetite naturally around that. Those type of moonshots as well is something really unique that you don't get in many industries, but it's kudos to the team, and thanks for pushing us to make those happen.
Thank you. Thank you very much, Bertrand.
Please welcome to the stage Chrissy Farr, Tech and Health Reporter for CNBC, and Dr. Ashvini Zanuz, Chief Medical Officer for Salesforce.
Well, thanks for being here this afternoon. We've got an exciting, I think, 20 minutes ahead to chat with Ash about all things Salesforce. But before we get into your current role, and you are essentially, doing a lot of the health work here at Salesforce, I wanted to talk to you about what you did before that, which was actually a lot of work at the VA. So maybe we could kick things off there. Just what was the scope of your role, and what were some of the projects that you pushed through in government that you're most passionate about?
Yeah, so let's see. I've been out of VA now for about a year and change, so I think I can finally start talking about it a little bit without it getting printed in the press, although I'm talking to Chrissy Farr, so one never knows. So when I first joined VA, I was in VHA, which is the largest department under VA, which is the healthcare branch. It has about 360,000 employees, and they care for 9 million active lives, and overall they have about 21 million veterans that they care for at any given time. So really, large group of people, large scope. They have not only a provider but also payer. And I was responsible for the operations and running of this group called the Deputy Undersecretary's Office for Healthcare Policy and Programs. And basically what that was is all of the research department, the R&D, informatics, connected care like telehealth.
So you're the tech person?
No. So I ran also all the programs, primary care and specialty care programs that was run out of all of the VAs. So the 178 medical centers plus the thousands of clinical facilities, the clinical programs that were administered there came under our purview. We didn't actually manage the facilities, but we ran cardiology and setting the standards and setting policy and thinking through how it would be delivered and standardized across the VA, across all of those specialties and primary care programs. So it was a pretty broad overview, and then from there I ended up in the Trump administration as the Chief Medical Officer responsible for digital modernization.
So one of the things that you and I have talked about is telemedicine, because that was something that you helped kind of bring to the VA in its current form, which now involves a lot more practicing across state lines. So how challenging was that to get it through? Because, I think a lot of people would say that nothing really quickly ever happens in government, and there might be truth to that.
And I think that's actually okay. I think when you're impacting the lives of like millions of people, you have to be a little bit more thoughtful about how quickly you want to move. But in terms of telehealth, I before my stint at VA, I was the congressional fellow, and I served in the Senate. And we had tried really, really hard to get a bill through to have telehealth inside of the VA that involved not only VA employees, but also all the contractors. Unfortunately, that bill failed. It didn't go through for several reasons. So when I came over to the VA, it was one of my top 3 priorities of things that I wanted to accomplish was try to get the providers inside of the VA to be able to practice across state lines. It was successful. It did take some time, but President Trump actually had signed off as an executive order. It was one of his early executive orders that he signed that I really, really, liked. It was called the Anywhere to Anywhere legislation, and then it ended up going to Congress and got passed as a bill. When I started, I think we had about 200,000 unique visits in the VA for telehealth. And within a year or so, we were up to 2.2 million visits per year. Wow. So it can have pretty significant impact when you actually, take on something like that.
So for some of the entrepreneurs in the room, I'm sure there's some here, they would love to know how to even work with the VA. And I personally hear this question a lot. Do you have any advice for just like how do you find the right people to hear you out if you have an idea that could be taken to that veteran community?
Yeah. It's funny because people want to meet with me a lot of times, and the first question they ask me is, how do I work with VA? So I get asked this all the time. There's no secret sauce or secret recipe to working with the VA. It's a pretty big entity, and it's hard to kind of know who to go talk to. Some of the things that I would say generally are, try to find a sponsor at your local VA. Generally, working in pilot, having a pilot at the local VAs or 1 or 2 VAs is better than going after central office. When you show that you've shown value and you've proven success, then VAs generally tend to adopt. Other VAs will tend to adopt, and national VAs will take it on. So, go talk to the local chief of staff, who is equivalent to the chief medical officer at a VA, to try to get buy-in, or the chief medical informatics officer to get buy-in. Beyond that, I would say, go to the Hill and make them aware that you exist and that you have value. If you have peer-reviewed publications, they really like it. If you've invested money in research, they tend to like that. But the one thing I would advise against, and again, I say this as somebody who's been lobbied at, and then at the VA having dealt with this, I would advise against going to Congress and having them put things into legislation to help your cause, or having them call over to the VA and asking them to work with you. I think you and I talked about this earlier. It's like, having your mom or your dad call you and say, hey, you should date this girl because this is a good thing. Nobody likes that, right? And so, I would generally say make people aware, but don't force their hand. And I think this has worked. We have a lot of tech companies that we've seen, diabetes companies that have come out and gotten more funding. They have a lot of success now inside of the VA, and because it's such a large organization, you get access to all of these patients you get to work with.
So let us talk, I guess at this juncture, about your transition into tech. We've seen this a lot with people come, from government and then end up at some Silicon Valley tech company. And is this like an alumni group? Do you guys get drinks and kind of talk about jobs out here? How does that work?
I think that's actually a really good idea, and we should do it, because I've been seeing a lot of news of people coming and getting hired into all of these companies. The one thing I was thinking about was we should have a doctors group of all the clinicians that get hired and out of clinical practice that come in, but I think that's another group that's really good. So at least for me, I didn't really have plans to come to tech. I didn't apply to any tech companies, and it wasn't intentional. It just so happened that I got recruited, and I met with a lot of different tech folks because of my prior job, and I got hired. But I was telling you this earlier. I have a kitchen cabinet, and I advise everybody to have kitchen cabinets, whatever stage of life you're in. And I have this for my radiology practice, when I have questions that I want to ask somebody, to my, tech stuff, because, again, I went into tech because I wanted to help move things along, not because I wanted to be a tech or an entrepreneur or any of these things, to business. I have a cabinet of people that I think I respect, and they're my mentors, older, younger.
I like that you call it a kitchen cabinet. I haven't heard that before. Like a collection of humans.
Yeah, it's because it's not official, right? It's like people that I hang out, I'm making coffee in my kitchen, and I'm making breakfast, and I call them, and I'm like, hey, I have a question. So this happened more frequently than not, where I've called Bob Kocher, for example, has been a really good mentor to me, where it's not like I talk to him every day, but he's been a big part of my life decisions over the last 10 years.
For people who don't know, he's an investor that was also
he's a VC.
Part of the White House.
Yep. So he was a congressional fellow, and then he served in the Obama administration and came back, and he's a VC and an active investor. And I've called him at every step of the way, where I've said, should I do this? And it was the same when I come back and I was looking at various tech companies in the Bay Area, and Salesforce being one of them, where I said, should I really do this? Is this the right place for me? And what value am I going to add, given all my experience? And what is it that I'm lacking, right? Like, what should I be doing? When should I say, I don't know this stuff, and pass it off? So I think having a kitchen cabinet has been really valuable for me.
I'm curious, did anybody in your kitchen cabinet say, don't come into tech? Because there's definitely been some controversy. If anybody's reading the news, you see health privacy scandals, and we've also seen several big high-profile failures from companies trying to get into healthcare from the tech world and finding that they just can't get it right. So did you get that advice, warning you off the tech world?
So I don't think anybody said don't go do it, but I think I did get a lot of really good advice about why I should and what I should be thinking about or watchful for, right? So We definitely had discussions about clinicians coming into tech and having to deal with product and tech people and what that culture would look like. Also,
that's often not, that doesn't work a lot of times. You see that happen, you know, especially physicians who don't have the background in leadership and management, and then vice versa with product, where they
and it's not even that. It's just about, like, you know, we go into clinical practice, especially academics, and you're used to doing the research, getting results, getting it tested, and then putting your paper out there. By the time you like start writing it and submitting it, it could be 2 or 3 years, right? And most tech that I know, it's like move fast and break things or disrupt, and that doesn't really work the same way in healthcare or even pharma companies, because things just take time. You're gonna have failures, and I think we've seen a lot of that. And so I definitely got advice about whether how should I be thinking about working with product folks or technical folks, engineers. How should I be thinking about working with like salespeople, right? Because I was on the other side and people would come and sell things to me, but having to work on this side collaboratively with people, not to just be an evangelist, not to just come up on stage to say, you know, my company is great, everything's great, do this, versus, you know, what kind of role should I have inside of the company? So I got really good advice on when to push back, when to be a steward of data and privacy, when to like speak up as a healthcare expert who's actually dealt with people's, you know, privacy and security issues, and push back and say, here are things you should be thinking about, right? So I think that was really important. So nobody said, don't go do it. And I think the third thing that people said to me, not only for a tech role, but also going into government, is how important it is that people who have healthcare expertise, whether you're a doctor or a nurse or any sort of like a clinician, or you've worked in a pharma company, these are really valuable experiences. And when you can come into an environment and make it work with the product and tech folks, you can really have a product that's actually useful and provide value. So I think it's positive. If somebody came to me, and I do talk to a lot of folks who are thinking about transitioning, now I can sort of give them the similar types of experience and advice. Not everything has been rosy and peaches, but I think they're learning experiences, and I think that's okay. Yeah.
So with Salesforce, from what I understand about what the company is doing in health, it's a lot of taking of the CRM product that's been around for a long time and applying that to the medical space. But you see, tech companies do varying degrees of this, where they stick with their core competency and what they know, or they try to do something very ambitious because they can, and they have endless resources. And as we all know, there's a lot wrong with the healthcare system that could be fixed. So where do you balance that? Just doing what Salesforce knows how to do versus doing the things that you might feel like are additional, or something that you feel you care about personally that in theory the company could do?
So I think that's a really good question. I mean, look, I think people don't go into a tech company and they don't want to be entrepreneurs, or they don't want to innovate because they want to stay stagnant or stale. So having said that, though, you want to, I think in general, and I can only speak on behalf of Salesforce, I can't speak for other companies, but Salesforce has been in the business for 20 years on how to deal with customers and how to bring information together, right? And they've done a really good job. They've grown, and we continue to grow. And so why not bring that to healthcare, where you have all of these disparate silos of data? You're not really integrating. People are creating networks around whatever it is that they're trying to sell, and getting people to stay inside of that network and not talk to other networks. And I'm not just talking about EHR companies. You could be talking about other systems, whether it's oncology systems or billing systems. They're trying to create these large networks, and they're like, well, if you stay in our network, you can have interoperability. And so I think that we're really good at connecting people and connecting things, and then providing intelligence on top of that to say, let's give you some analytics, let's give you some visual tools, and let's have you make decisions and give you next best action. And this has been really successful in other sectors for us: financial services, retail, right, telco. So why not bring that to healthcare? It's completely necessary and needed. So I don't think we feel the need that we need to go off and do something completely different. But I think you've heard at Dreamforce, we announced that we're working with UCSF on the blockchain component. So
yes. What is blockchain? I still don't understand it, so
yeah.
I'm hoping you do.
I probably understand it a little bit better than you do, but not much more. But look, I think from the way I understand it is it's a ledger where they're keeping track of who's touching your data, right? And I learned about this when I went to a conference with MasterCard years ago when it came out, and they were talking about Bitcoin, and they talked about how they're tracking all of your money as it's moving along, and you could do that in healthcare. And I thought, wow, that's really great. Look, think of all the great use cases if it actually works in healthcare, right? So not only can you track all the data for a person that it moves along, but you can also track things like pharmaceuticals. So think of opioids and all of the different opioids, all of the different medications that people get out there, all the fraudulent stuff that happens with it. If you're actually able to produce something and tag it and have it watch from when you put it from molecule to put it in the market, and it gets tracked to the pharmacies and tracks out to people, you have an entire ledger of how this thing is traveling. Same goes for insurance companies for claims. You can track a claim the same way. So lots of interesting use cases
But
with
it's still
blockchain.
early, right? From what you're seeing?
Yeah, I mean, I think that these are all at least from what I see, pilots and proof of concepts, which is what we're doing with UCSF. And if this is something where we're working with an institution where there are going to be people's data involved, and so we're big on privacy, and we're going to make sure that there's consent. We don't have any patient data yet, but when there is, patient trust is very important for us, and patient data and consent is very, very important from a privacy perspective. So we're going to have that.
So when we were talking about things that you feel personally passionate about that may or may not be connected to your day job, you've told me a little bit about your Ditch the Disc project, and I wanted you to share that with everyone because I just think it's so classic of the healthcare system that you mentioned you had a special computer at home that actually takes CD-ROMs and has a disk drive.
Yes.
Because in healthcare, we still share CD-ROMs. It's so insane. And faxes and pages is still a thing.
I do have a fax, and I have a computer that has a CD at home. And I'm a radiologist, for those of you that don't know. And I still and I do practice, not as often as I did before, but I do get people's CDs for second opinions, and a lot of times it comes with its own viewer, and sometimes it works and sometimes it doesn't. And so the whole reason I started the whole Ditch, so I in my as a volunteer project in my free time, I work for the American College of Radiology, and I lead this initiative called Ditch the Disc. Kind of how Axe the Fax came about. And I started this earlier last year because my mom years ago was diagnosed with ovarian cancer and would go around from treatment to treatment. Not only would she carry around bags of her printed out sheets of paper from her EMR, she also had all of these CDs that she carried around. And I had a Sony Vaio that I purchased. It had a CD drive. Because a lot of times you'd go to hospitals. Apple Computer, I think they got rid of CDs, 8 years ago now? I don't know. I can't even remember.
I don't
have a
know where I
CD?
would find a computer that would take a CD-ROM.
Yeah, it's so disrespectful to people that you're going to make people go to hospitals and have them wait in line to get your CDs and take it to another hospital. And neither you can look at it nor the doctor. You're waiting around outside. Hopefully you're going to bring a good book or something to read out there because trust me, in the back, I'm hoping that this viewer that they put on there is actually going to work with my system, and I can get this put into my PACS system. It's just outrageous. And we're talking about interoperability. It's been only about 10 or 20 years we've been talking about interoperability. I don't hear anybody talking about imaging interoperability, and it's really important when people are sick. They're carrying around their CDs for cancer care. They're carrying it around for other types of chronic illnesses. And it's not just DICOM imaging, right? It's beyond that. You've got pathology reports that have to go out, pathology images. You've got cardiologists that are doing angiograms, and they have stuff they have to send out. So it's neurosurgeons that are doing things. So you've got all these specialties and people who are sick that have data beyond what's in your EMR that's going out there, and we're expecting people to carry this around, to be transporters. And I'm like, is this really what we should be doing to our patients who are sick? And so, I reached out to Geraldine McGinty, who is the chancellor for the American College of Radiology, and I was talking about this. And when we all got together, they said to me, Ash, we've tried to do this. We've tried to do this for 10 years. You're not going to be successful. I don't think, people don't know me all that well, but when you say no to me, it just energizes me to go find a solution. And so I said, great, I'm going to go find like the most, the smartest people out there, get them on a group, have a task force, and find a problem for this. And luckily, we have RSNA that's come on board, the Radiology Society for North America. They've been working on this image share for providers, for hospital to hospitals, and a lot of vendors that have signed on to their project. And then, personally for me, I want a patient-mediated form. People say, well, why should patients have, CDs, or why should patients have their images? Well, you know what? Maybe I just want to post it on my Facebook. Like, what do you care why I need to have it? Maybe I want to go to a different doctor, right?
Yeah, maybe I want to walk it across town and give it to the next physician, which I've had to do.
Yeah.
Then it scratches up in your bag.
Yeah. And so we should have a easier way for patients to be able to transfer things. And maybe Apple and another company will come along and say, we'll put it into our Apple Health Kit, or something on that sort.
Apple.
If anybody's here and you're interested. And so my goal is to get everybody aware that this is really important, and I'd love to move this forward. I've talked to ONC with Don Rucker, and we're hoping to, we've gotten comments into TEFCA so that they're starting to think about interoperability. Anybody who is in any HIE business, I talk their ear off about this stuff. I think it's really, really important, and I'm obviously really excited about it. It's my side gig, but just as important as my real gig.
All right, so I've got one last question for you.
Yeah.
And of course, it's a really easy one. So you are a radiologist in background. How long before AI replaces you and your entire specialty?
How long before AI replaces airline pilots?
Or journalists?
Or journalists. I mean, maybe articles write themselves. I mean, look, I think that's silly. I've heard this before, and people have said, oh, did you go into tech because AI has come along? I'm like, that's just ridiculous, I think when you look at the amount of work that I have to do, like honestly, before I came into this and I was practicing full time, this was my workflow. They would send me a CT. Somebody would call me and say, oh, there's an emergency in the ER. The patient is a trauma patient. Can you come down and take a look at the scanner, because we don't have time to send it to to process the images. Fine. So I go look at it, and then I have to call like 8 different doctors. I have to page them. I have to sit on hold for whatever number of minutes, or 20 minutes, while I try to reach them, get the OR going. I also do interventional work. I think there are all these menial tasks that can be automated. So, now I'm seeing AI that's actually getting put into the imaging systems. So CT scanners, especially CT scanners and ultrasound machines, have these things automated in there where somebody comes in and it's marked a trauma patient. It can not only automate that workflow that says trauma patient, let's move it up the stack, but it can also analyze the images to say, oh, there's an active bleed here, and call out to the radiologist as well as the neurosurgeon and get the room ready in case they need to evacuate the bleed. So I think there are all these tasks that need to get done, but I don't think anybody in here, maybe for a brain bleed, I don't know, but nobody in here is going to be okay with a machine telling you that you may have a tumor and you need resection without a person putting their eyeballs on it that has really training in the space, like subspecialty
and empathy,
training,
right?
And
like
empathy.
Can deliver the news in a way that is human to human.
And I think honestly, radiologists, our specialty does have to change. If you're going to sit around and just look at images and you want to monetize and you're going to read like 100 more images because your workflow is faster, yeah, I think the specialty will go away. But I think if you get into the habit of coming out of your space, going to talk to people and trying to understand what's going on, start having conversations with the people that are having these scans and getting them to the right place and getting involved and have the human experience, I believe that the specialty is going to evolve. So I don't think we're going anywhere anytime soon. I still plan on practicing. So.
Well, it was wonderful chatting with you. Are you still looking for volunteers for Ditch the Disc in case anybody
Yes. I
up,
actually have a lot of patients that have raised their hand that want to talk about things, but if there are any companies out there that are interested, not just to work with us as Salesforce as partners, but if you want to come talk to us about, pushing this along, I'd be
getting
really
rid
excited.
of dinosaur technology in health.
Yes. Fax machines, check. CDs, check. whatever else we can add in there, I'd be thrilled to move it along. So.
Well, thank you so much. What a fun chat.
Yeah, thank you so much. Thank you very much.
Please welcome Dr. Malia Sharvat, CEO and founder of Savonics, to the stage.
the Startup Health Stage artist and brain health advocate Susan Schneider-Williams.
Thank you, Leah.
Thank you, Susan.
Hi, everybody.
I am touched that you agreed to be with us here today. I think most people in this audience, I could see a lot of looks of surprise as we talked about the fact that Robin had Lewy body dementia. And I think there's a perception in the healthcare community that access is often an issue of insurance or money or connections. But, talk with us a little bit about how difficult it was to get the right answers, find the right doctors, and figure out what was going on.
Yeah, so Robin and I were trying desperately to get an answer. And, he'd been in testing for a solid year. And it was so difficult to get the answer. We had a lot of we had our general physician, general neurologist, motor specialist, 2 psychiatrists, a hypnotherapist, and assorted alternative doctors. And that was by the end, how many people who'd come into the fold of trying to get to the bottom of this. And the reason I mention all of those people is because it was a team, but they weren't acting like a team. And there were many, you could really look at what Robin's experience, what our experience was with Lewy body dementia, and our story is very much what you don't want to have happen. And it would be incredibly small-sided to point out, well, this went wrong, and that went wrong, and that went wrong. And believe me, that there's a large list of that. What I learned from what I dug into, I didn't get the answer. What Robin and I were looking for wasn't evident until autopsy. That's just the way it is right now. There is no biomarker for LBD. But in autopsy, they showed he had one of the worst cases they'd ever seen. Nearly every region of his brain and brainstem were infiltrated with Lewy bodies. So that's nearly no neurons were free of Lewy bodies. He was being choked, okay? So that was the, I guess it wasn't that, what I discovered in that and everything that I found out from that, because I had to really go on a discovery process to learn about this. It's not easy. And essentially, the takeaway was, well, you could list that all these things went wrong. And the fact is, it's really a statement about how complex Lewy body dementia is. And when I say Lewy body dementia, which has over 40 symptoms that don't all appear at once, it's hard enough to discover what it is and to diagnose accurately. There's 1.4 million people in the US that have it. It's commonly thought of as the second most common form of dementia next to Alzheimer's. And it's often misdiagnosed or switch diagnosed. Yeah. And what I want to say is that it's a statement about how the whole field of dementia and brain disease is so complex. So it's not that, all this stuff was done wrong. It's like, let's take a deep breath and realize we only know about 1% of the brain, and to expect that, we have this figured out, or we should, is kind of not really where it's at. Yeah. So to wrap all that back to the idea of team, one of the things what I often say to people now is, it is so important to have a team with you on any of these, as you start going down in these roads. Your team needs like a quarterback or a team captain, and everyone needs to be functioning together. And so, I don't think I answered your question, but
you did.
Went through a lot of stuff.
I think you did. I think you talked about the challenges and also the fact that we need better care coordination, right? We need doctors need to be talking to each other and sharing information. And that doesn't happen as much as we would like. And there was some mention of interoperability in the talk before ours, and that is part of the problem. Just even sharing records and information is really difficult within the current system. And your journey led you to get involved with the American Brain Foundation. So you're doing a lot of advocacy right now in brain disease. And I was really impressed with your work, and in particular, a goalpost that you've set for yourself for 2020. So you share with the Startup Health community a little bit about what you're working on right now.
Sure. So when to back it up, when I started diving into, now that I had the name of this disease, I started turning over every stone. You know, I didn't want my own, I don't know if I'm using this phrase correctly, but cognitive dissonance to try and tell me a story that would make me feel comfortable about what happened. You know, so I checked all the evidence, and my father's a pathologist. I'm sure I got that from him. And with what I found out, there was no way I could not do anything about it. There was no way I could not share what I found out. The fact that Robin is known by pretty much everyone in the world, and it's not right for misunderstanding to be out there. It's not right for him and for the people suffering from Lewy body dementia, from associated disorders or anything else. It's just not right. So, you know, reluctantly, I was in a position where I had to do something, because I just felt like I had to do something with this information. And so that's what when I started talking about it, and I've spoken around the country a bit, the American Brain Foundation came to me and they wanted to give me their Commitment to Cures Award, which was kind of shocking because, well, anyway, I just didn't expect that. And then I got introduced to them. And what I saw that was a good fit for me personally in my experience and working with the American Brain Foundation is that the big surprise about Robin's disease to me that I discovered afterwards was, while it was accurate that yes, he had Parkinson's, that was an accurate diagnosis, clinically he had Parkinson's, but pathologically he had diffuse Lewy body dementia. And when I came to understand from a neuropathologist who told me, he said, essentially, it's a spectrum disease. And I started to get really upset at this point because I thought, I come from a background in graphic design and marketing, and like this thing is so named so wrong, and all this misinformation is out there. But the reality is, Parkinson's is on one end, LBD is on the other end. And you know what? The common pathology is Lewy bodies. And so I just thought so that pushed me to want to learn more and more. And it brought me to the American Brain Foundation because they are looking at the interconnectedness of all these diseases. So we get to work with accomplished groups like Michael J. Fox Foundation, Alzheimer's Association, and many others to basically create little SWAT teams that go in on targeted offenses to deal with common mechanisms within these diseases and specific, whatever we can. It's really targeted at getting more money, more dollars for the researchers to go after these targeted offenses. And the one I'm most excited about right now is we've created the Lewy Body Dementia Fund at the American Brain Foundation, and we asked some of the families that we work with, like myself, who've been affected by Lewy body dementia, we said, what do you think is the most important thing that needs to be solved in LBD? And overwhelmingly, they said, we need a biomarker. And I mean, I was all in on that. We were dying for diagnosis, right? And so we took that information and we we assembled 10 of the top researchers in LBD around the world, and we asked them, would you agree with this? Is this what we need, what we should go after? Because we want you to design a research grant award. And they said, oh yeah, that's what we need. And so we said, okay. And they designed it, they finished it. It's a $5.5 million research grant award targeted at finding an early biomarker. And right now we've got about $3 million in commitments from some very prestigious groups, and I was just kind of joking in the green room, I really want the next $2.5 million by my birthday, which is in a couple of weeks. So, but I want to see this done because I know the researchers are dying to go after this, you know. And again, this is one tiny part of the big ocean of what needs to be discovered. But what I want to say, importantly, what they're finding out, and I'm sure people in this room are well aware, that if an investment in Lewy body dementia in this biomarker project could have a return in other synucleinopathies or Parkinson's. These things are more closely connected than we knew before.
Yeah.
And you as well you've got a program going on right now, right?
We're doing a big study. Yeah, we're doing a big study. I think, for me, when we very first met, you said a cure for one will be a cure for many. A biomarker for one will be a biomarker for many. And I think that's really true. And your moonshot, to use our startup language this year, is that Lewy Body Fund. So I'm going to make sure everybody knows how they can contribute to this fund before we leave today, because it's incredible work that Susan's doing. I think you go to the Brain Foundation of America's website, and then it's a /LBD.
Yeah, it's americanbrainfoundation.org/LBD.
Right, and to learn more about the fund and understand what we can all do to contribute, because I love her moonshot. We are actually, yes, we're doing a large study. So we're doing the first ever population health study in cognition. This is important because you mentioned that we know about 1% about the brain. That's true, and I want to bring us all back to probably before most of us were born, to 1948, when the Framingham Heart Study was launched, which is still an ongoing study of heart disease. We knew about the heart back then about what we know about the brain now, which is precious little. And from the Framingham has come the knowledge about blood pressure and heart disease, and cholesterol and heart disease, and exercise and heart disease. The Framingham is the most seminal medical study ever done. It's a population health study in heart disease. It needs to be replicated in dementia. We don't have 70 years. We can't wait this long. So we partnered at Savonics with the Boston University School of Public Health, who run the Framingham, to do a 3-year population health study looking at all brains, all healthy brains, and also brains with problems. We want all brains, all comers. Don't worry, we're not going to take it out of your head. We're just going to do some cognitive testing and take a health history. And if you're an Apple user, we're going to grab your data from the health app, so things like your activity and your heart rate and other things like that for those biomarkers, right? Because we're trying to look at what are the biomarkers for dementia early on. And we know them for heart disease, right? High blood pressure, high cholesterol. Guess what? Those are behavioral outputs, right? How do you get high blood pressure? How do you get high cholesterol? Largely diet and lifestyle. So we can even have biomarkers that are behaviorally driven. And so you can see here, I would like every single person in this room to enroll in the study. It takes about 30 minutes. It is an IRB-run study. We're not selling your data to marketing lists. This is a legitimate scientific study, and we'd love you to take part. And please do donate to the LBD Fund. We are personally involved at Savonics with research. Beyond that, Susan, you and I have had a lot of conversations about what could have gone better. And I think it's one thing to look back, as you said, and the problem list is long, but let's look to the future and think about how we can make it different. Robin's note to you, I want people to be less afraid. How can we use digital tools, do you think, to transform the future in the dementia space?
First, Malia, I want to say, I really want to thank you and what you've created at Savonics, because if you think about it, what you've done is you're putting an image on something that's been invisible.
Thank you.
Cognitive decline. This is one of the most misunderstood and scary things. And reality is, dementia is essentially the new cancer. Whether we like it or not, it's kind of been invisible, and that can sound really scary at first until you get into the solution on it. And what you guys have done is you're putting an image to that, and not only that, but you're going to be having, God willing, avatars to help with the application. And I think with that digital help of getting the data and walking people through a cognitive test that is aligned so well with what the medical profession needs, what insurance company needs, you're taking it, you've taken this really terrible test that used to exist and still exists in many general physicians' offices, which is the type of test that my mom, I asked her several months ago because she had taken it, and I said, what were some of the questions on it? And I was disgusted, because if you said yes to any of these questions and essentially were failing it, you should already be dead. There was no gray area of figuring out, so what is that? It's too late by the time, So what you've done,
much more sensitive.
Okay,
Yes.
that is an understatement. And again, it's bringing attention and awareness and making this stuff feel real, which it is.
Yeah.
And so with that digital, it's important to have the care along with it. And this rolls back to the idea of a team or people who are able to interpret the results, who, the scientists and researchers, they need the data you are collecting. And that data needs to be collected carefully. And if you could say for a moment just about the team on your end, the research, who you have involved, it's not like you just got a bunch of bread bakers to make this. Or something. I mean, not that bread baking is...
Bread baking's good. I
It's
do a lot of it.
It's
my therapy.
I
but
need to bake.
I do. You know that. We talked about that over the holidays. We've assembled a team of clinical neuropsychologists, and so this is the field that traditionally does the testing. Usually in inpatient facilities, you'll usually often check in for hours and hours of testing. These are sensitive tests that pick up, percentile-based changes in things like memory, and different kinds of memory: episodic memory, verbal memory, visual spatial memory, impulse control, social cognition, so things like emotion regulation, attention focus. These are the many domains that neuropsychologists test. And we report on them across the bell curve. So the testing is sensitive. It can tell if you're a high performer at the 98th or 80th percentile, or if you're in the average range, which 85% of us are, or if you're in the low average or low range for these kinds of domains. And the kinds of impairment you have point to the kind of dementia that you might be suffering from, because different dementias start in different brain regions. And we know that. You talked about that earlier. And so those early symptoms can actually, while they're not a biomarker, they can give us at least a provisional diagnosis of what's going on in the brain before autopsy, which can be very comforting to folks. So we've productized this, and we've created an avatar-driven, with better avatars coming, virtual neuropsychologist to walk the patient through the testing, administer it, and then score and report it. But unlike the reports I wrote when I was practicing, which were jargon-filled medical documents, our reports are written at about the 5th grade level so that the average person can understand what they're reading and what's happening to them.
I think that's great. And I just a shout out for neuropsychiatry and neuropsychiatrists, because I just think there needs to be more neuro in the game in general now going forward. And what you're doing is providing that care. I know you've talked about there's Survonics Cure and there's Survonics Care.
Yeah.
And it's important, this is to face your own cognitive decline or even want to go there. It's very scary, especially when you have no idea. Does this mean I'm gonna lose my job? Oh no, I don't want my family to know, or maybe, I think about if Robin Tour have had testing done, which he was about to go to inpatient neurocognitive testing, which he did not want to do. And what my Leah's group offers, what your company has created, is something that could be done at home with proper help. And I think what's so important about that, just like we're, some people are wanting to know about, well, what genes do they have? And what should they be looking out for? Well, if you don't have someone, like I haven't done that yet, because I want to be darn sure that I'm talking to someone who can interpret those results for me, so I don't spend the next 10 years freaking out about something or doing something that is not applicable. It has no reference point. So what you guys are doing is beginning a new way of understanding dementia and brain disease, and again, making it visible, and the proper care around that is all important. Like the people who were speaking on the earlier panel, it's not just like the AI, it's just not the data, it's what are we doing with it, and how are we conveying that to the patient and their families. So real important.
Absolutely. Absolutely. Thank you so much. And that's a huge piece of what we do. The testing is the first part, but the follow-up is the care plan, and it's also the information for the patient and their family. And our care plans come in 3 personas: for the specialist, for the general practitioner or nurse, or for the at-home or informal care provider, so for the family, recommendations on how to manage the symptoms at home. And really the goal of that is to improve quality of life and to reduce anxiety around dealing with cognitive decline.
cognitive decline in itself causes anxiety.
Yes.
And as I mentioned, the amygdala area of his brain was so badly affected, and that is the area that acts like our barometer. Imagine you go to a thermostat and you can't turn the thermostat anymore, and it keeps getting hotter, and there's nothing you can do about it. That is like the amygdala being broken, and so anything that can be done to help ameliorate any fears that would come up, not only around testing, just to back up a bit, someone with cognitive decline, they may be purposely holding back some of the data, or they may not be able to convey all the data because they've lost the ability to retrieve it within themselves. And so that's, again, why it's so important that this, being able to collect these things needs to be handled with care. And I think that, your company is really doing that.
Thank you. It's very kind of you to say. So what's next for you with the film? So debuting in May, right? Is that the goal right now?
Yeah, so it was picked up for distribution, which is great. It's kind of, I think I've been in denial that it's actually happening. We've been working on this for like 3 or 4 years, so, but it has been picked up. So in May, it's going to come out. And one of the great things that the director, Tyler Norwood, with Sky Dojo Films, what he did, and this was something I expressed early on when I started working with him, was this needs to be used to go on raising awareness and funds to solve this stuff. This is not going to go down some channel of distribution and disappear into Hollywood. This needs to be something that can be used to help educate and ease the pain, make people less afraid, as Robin said, and get the scientists what they need so we can plow our way through this stuff. And that's exactly what he did, so we're really excited about that. And I'm just wondering if I can say much more about it. I don't know. It's still kind of, it's still kind of stealth. But
you've had a lot. It's been a big journey for you to get it done.
Yeah. It's been a road. But once I finish that, my part in it anyway, I'll help do what I can to help launch. I really don't like to do that stuff. I have a job. I'm a professional artist, and I'm also a mom. And like this advocacy stuff, I don't have time for this, But it's not what I planned. But I gotta say, the people I've met along the way, it's a bonus I didn't expect, really. And I've gotten to. It was fun to see some of the Washington D.C. shots in there. I've gotten to go to Washington several times, work with many different groups, and help to try raise awareness. And, my mind's been pretty blown by all aspects of brain disease. People who have it, I was there with 300 Parkinson's patients in Washington, D.C., and we got snowed out. We didn't get a chance to actually go to the Hill, but we spent 48 hours in a basement in a hotel learning what we were going to do, planning our attack on Washington, D.C. And when the news came down that we were snowed out, we couldn't actually go to the Hill. These are a lot of people who came without their caregivers, who have difficulty. There was one man who got stuck in the snow because one of the things that happens with Parkinson's, and actually Robin had this as well, is you can get stuck in a frozen stance. And he was stuck in a frozen stance outside the hotel, and snow started to accumulate on him. And you know what happened? Several of the other people who were in our group, they knew what was happening to their friend, and they went out to him. And if you stand beside the person who is in that situation and you walk forward just by their side, their brain will kick in and they can get out of it. And that's what they did. And we got to talk about this stuff on snow day. So we got to see that snow day was actually really a blessing. And but then I wasn't satisfied because I was ticked off I didn't get to go to the Hill. So I came back again. And then I got to go actually and then I got to come back again and it's been really mind-blowing to watch. After my mind's been blown by what I've learned about these diseases and how closely linked they really are, and how much amazing work is going on in research facilities across the country, to watch other people's minds be blown when I get to talk to them individually and describe that the relationship between Parkinson's and Lewy body dementia. And you could say the bad news is that, well, there's no cure, and we don't, it can be terrible, and yes, it's really terrible. And the good news is that no case is identical to the next. It's very individualized. So, I just want to underscore, Robin's was one of the worst they'd ever seen. I brought his last 2 years of medical records, coroner's report, and brain scan to 4 professionals in Lewy body dementia across the country and had them interpret everything for me, again, to make sure that I wasn't trying to run my own story around what actually this was, but I got the facts. And that is the good news. Robin's case, I believe, was so extreme because he's just so awesome. And that part of the point of what he needed to do was have us engaged in his last act. And so I just want to do a call out to all of you. If you're not involved already in brain disease in some form or another of making a difference, and if you're looking for something to do, man, dive in. It will blow you away. And dive in where you are with what you have. If it's time, great. If it's money, great. If it's connections, great. Whatever. Everyone's poised to play a role.
I can't add anything to that. I think we should just end with that.
Are we-
Dive in
We're
where you
early.
are.
We have 1 minute and 54 left. We could just.
We're just going to sit here. Dive in where you are
with what
you
you've
have.
got. Yep.
Yeah.
Yeah.
Perfectly
There's no reason
said.
to be bored. That's
And,
all.
and exactly what you did. And exactly what you did.
Yeah.
Well, thank you. Thank you so much for being here with us
Thank you,
today.
Malia.
It's
Thanks for
always a
having me.
pleasure talking with you.
Likewise.
And I appreciate you sharing a very private story in a very public way with all of us. So if you guys all thank Susan for coming and sharing her story with us today.
Thank you. Thanks, Malia.
Yeah.
Done.
Please welcome to the stage Jane Metcalf, CEO, founder, and editor-in-chief of Neolife.
Hi. Hi, good afternoon. So before we bring up our next speaker, we want to just share how his company, New Eyes, is helping to people with visual impairments connect with their loved ones. So we're just going to roll a video.
I felt like I had to go blind to be able to see. Now that I'm blind, I listen to people. I was in the Army for 18 and a half years. I think it's an honor to serve this country. I started losing my vision almost 3 years ago due to the problems I suffered in the Gulf War. Right now, I have very low vision. The thing I miss most is being able to see family. I don't quit. I had to learn how to even be blind. I went to the blind rehab center and I met my wife there. She's another veteran and she's been blind for over 15 years. She teaches me something new every day.
I just love being around him. We really do enjoy our quality time.
We love to watch television together. When I first started going blind, I couldn't really make out anything on TV, and I was thinking, this is how I'm going to have to watch TV for the rest of my life.
Accessibility.
And then Claudia introduced me to Comcast. Movies with video description.
Video description on. A massive dinosaur foot stomps down into the mud.
My name is Frank. I'm here from Comcast. Nice to meet you. We would like to bring you some new technology that will enhance your vision. Do you happen to see anything right now?
Wow.
You can see me?
Yes, I can see her face. That is unbelievable. Oh, you're beautiful.
And it's also going to enhance your video experience.
What do you see?
Well, he's facing off with the raptor. It's my granddaughter. I never thought I'd see her face again. But just being able to see her, that means a lot. Technology really plays a big part in all of our lives. It's amazing. And it helps us to be a whole lot more independent. Oh my God, I don't even know if I can put it into words. That is one of the best gifts I've ever received.
So please welcome to the stage Mark Greggett, who's the CEO and founder of New Eyes Technology. Welcome.
Thank you, Jane.
Well, that was beautiful.
Thank you.
Yeah. You know, I was reading about this new Ernst & Young report, how they're anticipating $300 billion worth of deals in 2020 in the healthcare, health tech space, and I'm wondering how many of those dollars are going to go to really impact patient lives.
Absolutely. Hopefully all of them. No, I'm just kidding.
Right. Yeah, well, hopefully all of them.
Yeah, unfortunately with the eye disease that James has and many people called macular degeneration, glaucoma, diabetic retinopathy, there's no really glasses that help them. There's no surgery that helps them. So using electronic magnification specific to augmented reality, virtual reality, and taking our patented software and our technology really helps them see again. So what they don't mention in the video with James is he's 21,000. So perfect vision for you guys was 20/20, correctable. So 21,000.
Not 2,100, but 21,000.
21,000. So
how high does it go? I mean, can you measure?
That's pretty much it. Yeah. So it's seeing shadows. It's light sensitivities. He can barely see somebody walk by. It's just a shadow. And for him, again, he's from Texas, a good old boy. He couldn't really put it into words to see Claudia's face again, to see the grandkids, to watch TV again on the Xfinity Stream app. I mean, it was incredible.
Well, that's what struck me about the video. Can you imagine marrying someone and then a certain number of years later going, oh, so that's what you look like?
Yeah. Yeah.
Right.
Yeah. I mean, it's the simple things that we take granted for brushing your teeth, walking down the street, seeing a loved one's face again. The most simple tasks. It's in some cases, unfortunately, almost impossible without wearing our glasses.
So the dining in the dark dinners, have you ever been to those?
Oh, of course.
Yeah.
Absolutely.
I don't know, has anybody here ever done dining in the dark? 1, 2, yeah. It's an amazing experience where it's literally pitch black dark and you have to figure out what's on your plate and how to get it into your mouth. And, it has a huge impact on your experience and what you taste and how much you eat and all that.
All your other senses kick in. Your hearing,
Yeah.
your tactile, things like that. It really puts into perspective what we really just take for granted for every single day.
So what's your vision?
So without my contact lens, you go away. So I'm 24.
Oh, that bad?
Yeah, I'm 2,400. With my contact lenses, I'm back to 20, 30, 20, 40-ish. So I understand that. And from a young age, even from kindergarten, I didn't see very well and said, Mom, I need glasses, please, please.
So is this what led you into?
It did. So I was always, obviously, as we had talked about, I'm really into tech and always playing around and taking my parents' computer apart and getting grounded for it. But I was originally a medical device distributor back in 2010, working kind of on these antiquated devices. We're almost kind of the old school microfiche machines, if you will. So a screen in front of you, a little tray table, and you're working with it. And my business case or use model was a little bit different. So I'd actually go out to the patient's house. So most of these people, almost all of them, can't drive. So I would go out to their house in Los Angeles and Orange County, work with them in their house and say, what do you want? What do you like? And they'd try it out and say, this is great, but why can't someone come up with a pair of glasses that does the same thing? I'd love that. And with permission from my wife, spending our life savings, we were one of the really kind of the first use cases in healthcare utilizing augmented reality smart glasses to really change somebody's life in a very, very impactful way, and that was back in 2016.
Wow, using your life savings, but of course you're in the best position to develop the product because you know exactly what a large number of people we're going to need.
Well, it really wasn't about, I think this is a good idea. This was 5,000 patients later, sitting in their house saying, please do this. Right. So for me, working really in augmented reality smart glasses, we're really kind of the beginning stages in 2014, 2013 when I started playing around with this. So taking these kind of crude algorithms, if you will, taking duct tape on 8-megapixel cameras on these glasses and going back out to the patient saying, what do you think? What do you like? Saying, okay, try this, do this. This is what we can do.
Iterative.
And then finally really figuring out that use case to really launch the company and be successful in 2016.
So that's still a big thing that James put on his head. So what does it do? What are all the different, it's not just magnification. So break it down for us.
Yeah, so we have two different products. One is for walking around, mobility. It looks like a pair of kind of oversized Oakley smart glasses.
Oakleys?
So yeah, kind of. So it's a smaller field of view though. So a smaller product, smaller compact, smaller field of view.
So how broad is the field of view?
So it's about 30-degree field of view on the smaller product.
Okay, that's quite narrow.
Yeah, absolutely. But for retinitis pigmentosa, if you will, it's like looking through straws. Really a phenomenal.
So it's just getting that hole in the
You're just getting that hole of vision, which is great. So diabetic retinopathy, kind of a dirty windshield. That it really worked out. Older stage macular degeneration, wet macular degeneration, where like James, for instance, you need that wider field of view. So when we were coming out with the E2 that you saw on the video, that came out late last year, and we were looking at it saying, okay, well, how do we develop something for the new generation? So unfortunately, the World War I, World War II guys are dying off. It's less about, just looking at a book or reading 300 pages. It's about digital content. Telepresence, streaming content, seeing grandkids' faces on Facebook. So with that's the first ever VR, AR pass-through system. So you have that forward-facing camera where you can look at a loved one's face, magnify, things like that. And then with a push of a button, as you saw in the video, it's this complete immersive experience in VR where you can watch. It's almost an IMAX experience where you can watch TV again, as James had said. You can go and look on Facebook. You can do all these different things that really has never been done before.
That's amazing. And you have a patent now on this technology.
Yes, yep. So as anything goes, patents don't take a few minutes. So back in 2015, 2016, a smarter guy than me, Norman, is a great IP attorney, electrical engineer, Navy veteran such as myself. Gave him all my crazy ideas, came up with this, and then now we were granted late last year a utility patent in all of augmented reality smart glasses for magnification, for voice commands, for optical magnification, all centered around visual experiences with these types of glasses. So whether it's visually impaired or surgeons in OR or dentists using electronic loops, all these patents are really encompassing that, even such as recording surgery, taking pictures.
One of the things I was reading about on your website is, your eyes fatigue, of course, even if you do have this assistance. And so if you're reading a book or something, you can just switch it to audio, right? So there's a speech recognition.
Yep, so just with your voice, glasses will start reading. So it'll scan the image in real time, the text in real time, and it'll start reading it back to you. But most importantly is it's reading back to you, and you can also have a visual cue of seeing it, so it underlines it. You can make it bigger, so you actually read it along with it.
Could you highlight notes and?
Oh yeah, absolutely.
Cool.
Yeah. So I was a distributor. I was going out to these very affluent people in Beverly Hills and different things like that, and they're crying, saying, "Mark, I'm so stupid. I can't read. I don't understand." And it's really about neural adaptivity. It's really just about training your brain again because you haven't read in so long. So having that optical character recognition really built into it, not only is it giving them that visual experience, but it's helping them really retrain their brain to read again.
So the key word you just used there that got my attention was affluent. So was this a product just for rich people, and how much did it cost?
Of course not.
Where are you with that process?
Yeah, absolutely. So my business model when I first started, my father's a 30-year ear, nose, and throat doctor, and he said to me, if you're going to go get into this business, there's two things to remember: customer service and patient care.
God bless your father.
Don't follow the money. He said, if you worry about those two things, the most important thing is the money will follow. So for me, my business model when I was a distributor to now owning New Eyes Technologies, whether you have $1 or $1 million to your name, you're all treated the same. So for ourselves, obviously when the first product came out, it was pretty expensive, $6,000, coming down in price to about $3,000 with better and newer technology. But for us, really partnering with healthcare providers, partnering with the Veterans Administration. So if you're a veteran and you're legally blind, you can get the product free of charge. Low-cost financing programs. We just announced last week, United Healthcare and AT&T added us to the Care Plus package. So why is that different than Blue Cross Blue Shield and everybody else? Is now they're doing 100% reimbursement. And instead of, obviously, as we all know, health insurance and reimbursement takes more than a day or two. Mm-hmm. In some cases, it takes 3, 4, 5, 6 months. Now with that, it takes if you're really, really good at it and you follow through, a couple days actually.
Wow, that's remarkable.
It's huge.
I mean, getting a diagnosis of macular degeneration is just, being condemned to blindness, as you age. And I bet, how many people here have macular degeneration in their family? Yeah, I mean, I think we're all looking at that, and this is like the first solution, right?
Yep, whether you can afford it or not, we're going to find a solution for you. For us, it's really about the assisted sales. So instead of putting it up on Amazon.com, instead of putting it up and saying, okay, let me know what you think. Well, they can't see the website. So for distribution, we actually have people go out to their house free of charge, distributors all across the US, in all the world, coming out to your parents' house and letting them try it on and get that experience and say, you've really changed my life. And it's really this no pressure situation.
So you're building out that distribution network yourself?
We are. And now currently after 4 years, we're looking at bigger partners to build that out for us to where we have 50 distributors. Now we have some kind of major players saying, okay, well, we have 1,000 people that it can go out. So we're looking at different distribution partners to take that on and really scale it as it should be.
So how long have you, so a couple of questions there. So how long is somebody normally sightless before they get your glasses?
Yeah, so the average study, which I looked at probably 2 or 3 years ago, probably needs to be updated. Usually there's a year or two of depression saying, Jane, I don't want anything. This is not for me. I'm going to go crawl in a hole. So for us, it's really about reaching out to the family members and saying, there is something. And usually once they say, okay, I want an assistive technology device, then it's easy. Say, okay, my sight is going back.
Well, and depression impacts your eyesight.
Oh, absolutely. Well,
let's talk about that.
The biggest thing is especially with age-related macular degeneration, for instance, one of the most prevalent eye diseases here, unfortunately, in the U.S. and in the world. So, if you're sitting there and you're depressed, you're tired, hungry, stressed, all these things affect your vision. So you can go from sad and it's 2,400 to 2,300 to 2,200, just depending on how upset you are, if you slept a good night's sleep. I mean, all these things that we don't think about affects your vision on a daily basis. That's why for us, really with our technology, it's variable magnification. So we want to be as neutral as possible. Variable magnification, whether it's a surgeon in the OR or for the visually impaired, making it bigger and smaller so you can adjust it on your own. So it's really, in most cases, a one-size-fits-all. So once you get it, you don't have to call us back in a year or two, which they usually do, saying, what do you have new? But you really can spend the rest of your life with it.
And then as their vision deteriorates, how hard is it for them to get the adjustments they need to keep seeing well?
One button. Yeah, so for us, we again, knowing this use case, spending all the time, doing the research and development for years and thousands of patients, we became experts in UI and UX. So it has to be as simple as possible. If you're pushing 22 different buttons, it's not going to work. So literally 1 or 2 buttons, turn it on, make it bigger, make it smaller, change color, and that's really it. So we really want to be an additive to their life.
Right. And so how many people have you gifted vision back to?
Sure. Yeah, we're surpassing 2,000 people with the new United Healthcare, AT&T. That has jumped off very quickly. One thing that I always saw when I was a distributor was low cost financing. Mm-hmm. If you can afford, a lot of people are obviously holed up, they don't have jobs. So if you can afford $50 a month, $90 a month, you can get the product. In most cases, obviously with the VA, it's free of charge.
Right. So what are your goals for number of people?
For us, we are looking to at least quadruple what we did in the past few years. And it looks to be, going that direction, of course, with the help of way smarter people than me. So Regina is our head of sales and marketing and has some great distributors, people that really care. So a lot of our distributors are patient advocates. So they have family members that have macular degeneration. So just the hands in the room, for instance, how many people it affects, people are reaching out saying, this affects me, I want to make a difference in the world. And it's an amazing ride.
Oh, that's a beautiful thing, Mark. Thank you so much.
Absolutely. Thank you.
Take care. This is what we want to be spending our money on. Okay, I am going to step down here now because the next company coming up is Cala Health, and we have the CEO, Renee, is here with one of their users. It's Renee Ryan, CEO, with one of her patient customers, Sylvia Hooks. Hi, Renee. Nice to see you. Hi, Sylvia. Have a seat. Okay, so switching gears from eyes, although it's still brain related, but down to the hands a little bit. So Renee and Sylvia, actually I don't see Sylvia's, but Renee, I see you wearing a device.
I am.
Can you tell us about that?
Sure. Cala has developed a wearable neuromodulation technology for the treatment of essential tremor. We spun out of Stanford in 2015, have raised venture capital to fuel our development, and then in September of last year, we launched our first product, and Sylvia was one of our earliest customers and users.
So bioelectrical medicine, I love this idea. I think it's just really exciting. So how do you use it? What's the protocol?
Sure. In our clinical study, we had patients use the device for 2 therapy sessions per day. It's already pre-programmed for a 40-minute stimulation session. So the patient will put the device on. It's a nice, for patients who have tremor especially, we have a Velcro clasp, so it's easy for them to put on. They press the button, and this is a demo device, so it's not live today, and then can use the side buttons to increase or decrease the stimulation settings. In the band itself, which is the more replenishable part of the device that is replenished every 3 months, there are dry electrodes that are placed across 2 nerves, the median and radial nerves.
Okay, and so the patient herself knows how much stimulation to give. I guess this is something you learn over time.
Sylvia?
Yes, you just go ahead and push it until you feel the stimulation down 2 fingers and half of the ring finger and your thumb. And what it does for you is it stimulates it for like 40 minutes, and then it asks you to evaluate it, whether it was change, no change, or better, and you just determine what it worked for you, and you go ahead with that.
Interesting. Okay. So there's a lot of opportunity here, right? I mean, you're focused now on essential tremors, but I know that there is chronic pain, there's hypertension, stroke prevention. So those are all possible indications. And obviously, you've chosen essential tremor as the one to go after first. But I'm curious about depression. So it's sort of, which one of these is not like the others, right? I mean, these are all sort of measurable things. And then depression jumps out as being something quite different and harder to measure. So how does this electrical stimulation address both, tremors, something as physical as tremors and something as ephemeral as depression?
Yeah, let me stop first and let me separate the two. Sylvia, do you want to comment on your experience with anxiety and depression with essential tremor, and then I'll comment on our work in depression separately.
Well, your hands shake, and it's embarrassing, number one. It keeps you from doing a number of things. Eating, brushing your teeth. You brush your cheek more than you brush your teeth. And the water pick, it gives new meaning to water picking your teeth because you water pick the whole bathroom. Just a number of things. I play a lot of golf, trying to put the ball on the tee. Hey, it keeps falling off. And then what happens is you're down there so long, when you get up, you're dizzy. And it's like, okay, what's going to happen now? There's so many things. You try to walk across the room with a glass of water. By the time you get to the table, it's on the floor. Try to fill a pot. And it's very embarrassing to begin with. Yeah. And then when you get over being embarrassed and you try to deal with it, then you try to find other things. So I first went to medication, which is what was recommended. I am no longer taking any medication. I just use Calatriol.
Yeah. Awesome.
That's great.
It's just a game changer. Is it an end all? No. But it makes you so much more comfortable when you go out to eat, when you play golf, when you do anything.
Yeah.
I mean, you still have the tremors. Like it said, it lasts about an hour and a half or something like that. And mine lasts longer, thank goodness. It's just a game changer because people, if you have never had tremors, you don't know how embarrassing, how devastating. You can choose to be depressed if you'd like, and some of us choose not to. Or you can get other methods where they put a hole in your head and all that kind of stuff. Oh, I was so desperate, I went to try that. And fortunately, my friends would tell you that I need to go back and take the test. My head wasn't thick enough. And they said, yeah, right, you need to go back.
Your family disagreed, right? Well, so let's talk about that, Sylvia. How did you, I mean, so you may not know this, but Sylvia used to be a professional tennis player. So having a tremor would be kind of a career-ending problem, yeah. So when did you first notice the tremor, and what impact did it have on your life?
Well, I've had tremors for over 30 years, and I've tried everything. I've been taking a particular medication. I won't mention any of them. Some were very devastating, made me feel like a zombie most of the time, and you try to cover it up. You spend most of your time covering this. It's a devastating disease. And one thing you do avoid doing is going to the restaurant with a child. Because when you start shaking, they're going to let everybody in the restaurant know you're shaking.
Oh, no.
You know, so you don't do that. But I mean, I can't tell you how, I mean, I never really speak about it. You know, because it is embarrassing, but everybody's used to me now. My friends will cut my meat up and bring it to the table because you go to cut it up and you're shaking the whole table. People are trying to, if you haven't had it, you know, I could talk all day about it. You just don't know, and we're embarrassed by it, so we don't talk about it.
Well, thank you for sharing that. I mean, it's not easy to get up and talk about something like this, but what's the scale of the problem? What's the magnitude of the problem?
Sure,
How many people have essential tremors?
There are 8 million people in the U.S. that have hand tremors. And by our research, only 1 million of those are Parkinsonian tremor patients, and 7 million of those at least are essential tremor patients. So it's a much larger condition. It's why we started there. And the current solutions are very unsavory in terms of, Sylvia talked about the drugs on one end that have horrible side effect profiles, and then the other end is surgery. And so we come in with a very elegant, wearable, non-invasive, non-surgical solution.
Surgery meaning implants?
Implants, correct.
Right. Yeah, no, it's very exciting to see how implant technology is evolving quite rapidly right now. But there are people who can't wait for it to evolve.
Well, we want it to evolve. We want it to be successful because we're mimicking. Our electricity as a medicine is exactly what deep brain stimulation and neuromodulation is doing. We're just able to do it in a different form factor through a wearable, non-surgical path.
And could you eventually embed it in the wrist itself?
That was actually where we thought we would start the technology, and what we were so excited to figure out is that we could actually create the right connections to the brain by just having a wearable device. But the original concept when it came out of Stanford was an implant.
Well, the good thing about this is you can do it when you want to.
Right.
It's not like you have to do it at a certain time or whatever. If you're going to eat with somebody, go to an important dinner, hour before, just do your treatment and you're good to go.
So did you do it before this panel?
No, because I wanted you to see my hands shaking.
Oh, interesting. Well, thank you. I appreciate that. But on a normal day, how often do you use it?
Twice a day.
Twice a day, 40
sometimes 3 times, but basically twice a day. And especially if I have to go beat one of my friends in golf, I got to make sure I can putt. Because anything down here, your hands are gone.
How can you putt?
You just do it. You take a treatment,
remarkable.
And you do it. You know, the amount of time you spent being embarrassed, you figure out a way to do it. And when Calatrio came along, I was like, you got to be kidding me. This is great. This is really great because I can play golf pretty decently, but I was going to quit because I couldn't putt.
Yeah.
And now, bring it on.
Yeah, you're betting on your golf games, right? I love that. So Renee, you know, there's a lot of experimentation, shall we say, in the marketplace when it comes to neuromodulation.
Yes.
There's all sorts of people doing all sorts of crazy things to themselves and sometimes other people, sometimes not so grounded in science. I understand you have evidence. This prospect study is pretty exciting, and I'm just curious. Tell us about the study and how did the results meet your expectations?
Absolutely, absolutely. Yeah, we were thrilled. We launched the largest ever therapy study for essential tremor in 26 sites around the United States. We had 263 patients, and it's a connected medical device, so we actually tracked over 21,000 data points from those patients. The study results were published, or were announced actually back in September at the Movement Disorder Society. It hit all of its endpoints. The 2 co-primary endpoints were a physician rating of tremor, and they use a tetra scale, which often includes some handwriting and some drawing of spirals. And then we also used a patient-rated evaluation of their own activities of daily living, which include things like putting a key in a lock, picking up change, pouring from a mug, all these things that Sylvia knows and has struggled with for years. So we met statistical significance on both of those endpoints. Then the more exciting analysis that we did is that because we have onboard sensors and accelerometers, we were able to take those 21,000 data points and measure tremor from an independent rating. And what we saw is that 92% of our patients had some level of tremor relief. As Sylvia spoke of, we very rarely will see a full resolution of tremor, so there is some residual tremor that happens. But in about half of those patients, they had a 2-log improvement in their tremor, which is very meaningful if you're trying to drink water, pour coffee, et cetera. And so we feel very confident about the largest study ever done and the benefits to patients.
Is there some inevitability as we get older that we become more tremulous in general?
There probably is. Essential tremor is a really unique condition in that we see it very much tied to familial history. Sylvia will speak that her sister has tremor as well, mainly only in the head. But what we do find is that about 75% of the patients will notice it that as they age, and if their parent has it or their older siblings have it, they're much more likely to get it as well.
Mm-hmm. There's a story about Downton Abbey.
The producer of Downton Abbey actually has essential tremor, the creator of Downton Abbey. And in the last season of Downton Abbey, he wrote in the condition to one of the characters. So the butler himself, who has to carry the tray and serve the household, actually has tremor.
Yeah. So they didn't have this back in 1922 or whatever.
No, thank goodness we have it today.
And so, Sylvia, is your condition improving over time, or is it each day you reset at 0 and you have to?
No, it doesn't. They tell you that it's going to last an hour and a half, but I used to, do it, and then you sleep all night. And I'd wake up in the morning, and I thought, oh my God, I don't have to hold 2 hands to brush my teeth or water pick or anything, because it will last. Everybody's different. So I don't do it in excess, but it's just nice to be able to brush your teeth and not, even women would relate to this, shave your legs and it's all wavy instead of straight up, and cut yourself. There are just things we take for granted. And drink water with 2 hands. And now I was telling him a story once. A friend gave me a bottle of water. And I picked it up, and I drank it, and I looked at it, and, what's wrong? Is something wrong with the water? I said, no, I just drank that with 1 hand instead of 2 hands and hope I hit my mouth.
Right.
So it's, I can't say enough, because I was desperate enough to have them put the holes in my head, and, and you got to have another surgery and all this stuff you have to do. I went to Stanford to try to have that done, and I was so happy when they came along with this. To help me out. It just helps me out. It doesn't cure everything, but I feel a lot better.
So Renee, how can people get this? Is this something that they can go to their doctor and have prescribed?
Yeah.
And how many people have it so far, and what are your goals?
We're early in the commercial launch, so only a few hundred folks actually have the device today. We do require that you get a prescription. So there is a physician who does diagnose essential tremor, writes you a prescription, and we have a right-hand version, a left-hand version. And we have 3 different sizes of bands, a small, medium, and large. And we have a measurement tool for the physician to measure the size of the wrist. So when he or she fills out the prescription and sends it to us, we then take over the fulfillment. So we chose very specifically. It was interesting to hear the last speaker talk about his distribution model. We're very strategic that we chose to be both the manufacturer and the distributor for the Calitrio, so that we always had that touch point with the patients. So we really do put the patient at the center of our delivery model, and surround them with the right kind of care and the right kind of training. So we onboard the patient with their technology, and then we fulfill the bands every 3 months.
And how much is the band? How much does the whole thing cost? What's a year-long subscription?
Sure. We're applying for reimbursement as well. So our suggested retail price is about $3,200. Today we're in a cash pay mode, so we're charging patients less than that, and we're able to do that by Medicare standards. And then the band fulfillment is several $100s a quarter as well.
So you just did a big round of financing.
We did.
$50 million, yes. Excellent investors, Novartis, and Baird and LifeSci Partners and all those guys. And J&J re-upped.
Yes, they did.
Congratulations. And so I'm curious, what are you going to do with the war chest?
Commercialize. Yeah, the big push for us right now is to move into a national launch, probably starting in early 2021. We did submit for our Medicare reimbursement in end of last year, so we are hopeful to find out good news by middle of this year, and then would move into a national phase. So you will continue to see us, from a commercial standpoint, grow our footprint and grow our team.
Right. And how much of that money will you put to R&D for additional applications?
Yeah, we have actually, it's interesting. So electricity as a medicine may not be new, but accessing it through body-worn electronics is. And so we've in-licensed work out of MGH earlier last year for an ear-based stimulation platform. We're working on a few more indications to enhance our wrist platform as well. So we actually do think, you asked early on about the depression work that we're doing, and that's through the work we're doing at the ear, through an ear-based stimulation technology, based on the same methodology and thought process we have in the wrist device.
Super exciting.
It is exciting.
Well, that's wonderful. Well,
Thank
Sylvia,
you.
I'm really happy that you found Cala Health.
Me too.
Yeah. And I hope your golf game just gets really, really, really good.
Really good.
She offered to play with me, and I said, oh, no.
Oh, and one last thing that's really cool about this company, it's one of the few companies in med tech and healthcare where both the CEO and the chief science officer are women.
Yes.
Yeah, we love that.
We like that.
Yes. Yes. Anyway, thank you so much for sharing your stories with us.
Thanks, Jane.
Please welcome back to the stage Peter Layden, and joining him is Michael Acton-Smith, co-CEO and co-founder of Calm.
Oh, there we go.
Nothing spilled. That's all
Nothing spilled.
Not yet.
I'm back here on the stage again, just to kind of, for folks who weren't here in the morning, one of the things I think Unity is bringing me into this conversation is I've been in the Bay Area from the early Wired magazine, seen the whole tech disruption, kind of digital transformation, and I also run a media company that has a series of events called What's Not San Francisco, where we watch the innovation happening in many different fields simultaneously and see the cross connections and the parallels. And so now we're looking with the lens here in the healthcare space, which is a little late to the digital transformation project, but it's basically now in full gear. And also a lot of the innovation happening, there's a lot of parallels in other kind of fields. And I think there's something really interesting about that. One of them is the whole app phenom that's kind of taken over all kinds of different fields and played out in many different industries. You were one of the pioneers in kind of this health and certainly the mental health space around apps. So take us back to, it was 7 years ago, I guess, right? And tell us kind of what was the situation with you trying to launch your ambitions in an environment 7 years ago here?
Yeah, it was very different to the environment now. And great to be here, by the way. Hey, everybody. So Alex Chu, my co-founder, and myself used to live in London and in Soho. And we'd always be cooking up harebrained business ideas. And it didn't actually start with an app. It started with a domain name. And Alex mentioned this really cool domain name he'd come across that was potentially for sale called calm.com. And I was like, wow, that's a cool domain. How much is it? And he said, oh, about $1 million. So that was a little out of our budget. But it just got the cogs turning in our heads. And we just thought there was something tremendous that could be built there. You know, we'd seen the early signals of how the world was just speeding up and everyone was always on, and stress was growing and anxiety was starting to grow, and we thought, what an incredible opportunity to build a brand around helping the world slow down a little bit and become more calm. So that was the initial seed of the idea, and then it started, the first thing we did actually manage to buy the domain for a lot less than $1 million.
Fair enough.
We actually offered the guy that owned it 5% of the future business. But he laughed at us and said, no, thank you. But that'll be worth about $50 million. So I think he's a little upset about that one. But yeah, we launched an app, and it all started with meditation and grew from there.
So talk us a little bit about how the world has maybe changed. I mean, how it started, but now, you know, over the last 7 years, we've watched a lot of things. Techlash, a kind of a social media kind of craziness, a lot more attention to mental health, would you say? How describe what you see happening in the world that's affected your business?
Yeah, so we've had a sort of front row seat to this and seen an incredible shift over the last few years. When we were starting out, meditation and mindfulness was seen as a little bit weird and woo-woo. People would roll their eyes at us. We found it very difficult to get anyone to invest in the business. We found it very hard to hire people to the company. And Alex and I both decided that California would be the best place to build a business like this.
Of course.
Folks out here are a little more embracing of the unusual, which we love. And also Silicon Valley, the center of capital and entrepreneurship. So this felt like the best place, but it was still very, very tough going. It took many, many years. But as entrepreneurs, you look for these opportunities, these inflection points where society changes its perception on something. And if you're running a business, if you're surfing a wave when that shift happens, it's extraordinary. You have the wind in your sails blowing you along. And we're seeing this in a few different industries, everything from the shift to plant-based foods, which again was weird a few years ago, to psychedelics as a positive intervention for mental health. And so we were there in the early days of this shift around mindfulness. And now when we tell people, we teach and create a product helping people live more mindful lives, people love it. And it's something people show off and talk about on social media. But it's very recent that turning point has happened.
Did you, as it was evolving in those last 7 years, did you ever have any kind of big strategy shifts? I mean, that you kind of see as not just the context was changing and you were surfing a wave that, you were early to, but was there something that you realized that's kind of able to get you to scale to what, by the way, I think that you're the first unicorn in the mental health space for an app, and valued at $1 billion or over $1 billion. So, but anyhow, what anything big shift there? Was it?
Yeah, there were a few kind of tipping points along the way. Probably the first was when we launched something called the Daily Calm. So we have this incredible teacher called Tamara Levitt who writes and narrates all our meditation content. And a lot of pushback we got from investors and other folks was that, well, meditation is available anywhere. You can go on YouTube and get thousands of hours of free content. But Tamara had a very unique way of teaching, and it really resonated with people. And meditation isn't easy to do, to sit down and still your mind and focus. And so what we did was create a unique meditation every single day and called it the Daily Calm. And that helped people come back and build it into a habit. So that was the first big turning point. And then the second shift on our journey was when we realized that there was a bigger opportunity than just mindfulness and meditation. That's incredibly valuable and life-changing, a foundational skill. It's one of the most valuable things I've ever learned in my life. But we recognized that sleep was a pretty big market as well. So just curious to know how many people in the audience meditate. Cool.
Wow.
I'm preaching to the converted here. A lot of people that get it. And if I asked how many people sleep, I think hopefully every hand would go up. That's a great market to go after. 7.5.
Or you have trouble. It's trouble sleeping. That's really what you're going after, right?
Well, many people do struggle with sleeping, but everyone has to sleep every night, pretty much. 7.5 billion people every single night of their life. And we noticed this really interesting thing in the data a few years ago, where at about 11 p.m. at night, all around the world, we saw this big spike of usage of the meditations. And people were listening to Tamara's voice to help still their racing mind and help them drift off to sleep. And we thought, what if we could create mindful stories? What if we could reimagine the bedtime tale? And we created this concept called the sleep story, which mixes music and sound effects. And we have incredible voices like Matthew McConaughey and Stephen Fry. And they help you drift off to sleep. And they've been a huge hit.
Well, you mentioned Matthew. Another big thing we're seeing in all over different industries is the use of influencers and people who people really admire and kind of follow. How did you get involved with these kind of celebrity types? And was that a strategy, or you just found out, wow, they're using the app and you leveraged it? Talk a little bit about that use of influencers.
Yes.
Or what do you call, I guess, ambassadors or something?
Ambassadors and celebrities, anyone with a big platform and a lot of kind of sway. So we're very inspired by Nike. We think that's an incredible business. Love the book, Shoe Dog. And when Nike was getting going, 50 odd years ago, running wasn't really a thing. People didn't really do physical exercise, and now Nike's a $120 billion business. There's a gym on every corner. We get it. And we think we're right at the start of a wave around mental fitness and people treating their minds with the same care and respect they do their bodies. But one of the ways we're going to normalize that and reach hundreds of millions of people is through celebrities and folks that have massive audience and fan bases, and Nike did it back in the day. And so that's why we're now working with everyone from Matthew McConaughey to LeBron James. We did a partnership with recently, and he uses Calm every day to help him sleep. And he talks about the importance of the inner game, the mental game, as well as the physical game, and how the mind is a muscle and we need to train it. So it definitely has helped accelerate our growth dramatically. And so we're chatting to a lot of other folks with big influence from the world of music and actors and sports and on and on.
So it's been a strategy, but did you literally just come across that? Like, oh my God, we got LeBron James on it, and we might as well go talk to him. Or were you literally aggressively kind of looking for that as a growth fuel for what you're doing?
We were very much looking for it, but I think the challenge, to my point earlier, was it was very hard to get anyone to pay attention. You know, when we were small, and again, I think a lot of celebrities a few years ago didn't really want to risk associating with something like this, again, because there was so much baggage around it. It was seen as weird. Was it religious? But now, because that has tipped, I think celebrities, not many of them meditate themselves, and many of them want to be associated with something positive like this that can be very helpful for their audiences as well. So yeah, we knocked on a lot of doors, and then slowly but surely they've started to open.
So we're here in a health conference, I mean, looking at healthcare, and you, I guess, see yourself through that prism, but you also could be seen as kind of a lifestyle app. You also could be kind of a media play at some level. I mean, how do you think of yourself? Do you think of yourself as some blended hybrid kind of situation, or?
Yeah, it kind of depends who we're talking to. So if we're talking to investors, we're a tech company, and like those multiples. But I think one of the things that I think is very important when building something in a new field like this is brand. And it's often overlooked in tech companies. And if you can mix the tech and brand and create something that people really want to associate with and shout about and share, I think that can be powerful. So Calm is a great word. It's a great brand name. It's a very simple brand that we built, but it seems to really resonate with people, and we think that's important. There are a lot of other mindfulness and meditation products out there, hundreds and hundreds in the App Store, but I think some of the branding is not at a level that people maybe want to be proud to associate with.
Well, particularly with these relationships with these celebrities, the theme of the conference here is collaboration. And when you think of collaboration, you know, how central is it to what you're trying to do? How much do you see your success in your relationships? I mean, talk a little bit about your attitude towards collaboration.
Yeah, we're huge fans of collaboration and partnership. It's been a big driver of the business. So we talked about from the celebrity side of things, but also working with other businesses. And we have some great partnerships with everyone from Express Spa. I don't know if you've seen those in the airports. 100 million people walk past their outlets in the US every year. We put Calm content on American Airlines. You're able to meditate in the back of an Uber through a partnership we did there. So we're always looking for these connections with other brands, and they're great for our partner, they're great for us, and hopefully great for the users as well.
How about what do you have something for if you're in a frenetic conference where there's like, I think 2,200 meetings going on up here, if you've been up and through. I mean, is there a way to get space in that kind of environment, you think, to clear your head and be kind of calmed?
Well, we've got 10 minutes left. We could do a meditation for the last 10 minutes and all sit in silence. Maybe not the best use of everybody's time.
Maybe you'll not do that, but you do have that kind of, that's the kind of idea. You can be in the back of a taxi, you can be any place.
Exactly. This is the whole idea of helping people wherever they are to find a little bit of peace and silence. And one of the misconceptions on meditation is that people think it's about clearing the mind, and everyone is like, I can't do that, that's too difficult. What it actually is about focusing on a constant. And when you close your eyes, we teach a practice that involves focusing on the breath, something we all do hundreds of millions of times in our life. And when you focus on your breath and you close your eyes, your mind will wander, and then you bring it back, and it will wander again, and you bring it back. And it's that practice, that act of noticing, that is effectively strength training for your mind, and having a stronger attention in everyday life is incredibly valuable. So.
Now, a lot of entrepreneurs in the audience here. In my series that I do, again, we're talking to all kinds of people. We had a great session in the end of last year with Tristan Harris, who's got the Center of Humane Technology. He's been talking about how so much of social media and a lot of our apps are essentially making us human downgrading, making us more frenetic and anxious and all kinds of things. And he's calling for kind of a human betterment at some level. Clearly, you with your calm frame, he's actually calling for a different design principles, a different way to kind of think about our products and how we interact with the person to kind of lower the anxiety and do that. Any thoughts on how you guys have thought about the design of your product and how to really kind of bring everybody's anxiety down, their kind of frenetic kind of side down?
Yeah, it's a good question. So we spend a lot of time thinking carefully about the product itself at Calm. We use a lot of nature themes, which calms people down. We try and reduce overload and clutter as much as possible and keep it simple. But I think this is a really good point, and we've had a lot of folks that have asked us and questioned the fact that, you know, phones and technology are making us more stressed. We're surrounded by these screens, and yet here we are saying, no, it's okay, use the phone, use our app to calm down. And I think the way we respond to that is that, you know, technology is not the problem. There's a big tech lash going on, as you say at the moment, but it's a tool. These mobile phones are incredibly powerful. It's how we use them that matters, and we can use them in many, many positive ways to enrich our lives and connect us with other people. But when we do it in a mindless way, that is when it can lead to problems and stress and anxiety and information overload and interfering with our sleep and on and on. So it's about changing our relationship with our devices so we use them for us instead of against us.
And the user interface and the engineering and everything through it is there a kind of redesigning for Calm or something that you've kind of been trying to master?
Yes, just as I say, very thoughtful approach to making sure it is as simple and light an experience as possible. So when you finish with Calm, you feel better and lighter and calmer and happier, rather than many apps, you know, a game or if you're on a social media app for a while, that can often feel us leaving more frazzled and stressed when we put the phone down, if we ever manage to put the phone down.
So I mentioned you're the first of the unicorns in this space, hopefully many more, and again, a lot of folks here might want to aspire to that. Clearly you're looking to scale, and you are scaling. Can you talk about how many people use it now, and what kind of, when you look ahead in the next 5 years, what is the kind of reach that you're trying to do, and how globally are you thinking about your product?
Yeah, so it's a subscription product, and we have about 2 million, well over 2 million people now that pay and subscribe and are members, about 70 million total downloads. We're just starting now to launch it around the world in different countries, and we would love this to be as widespread as a consumer subscription product like a Netflix or a Spotify. You know, could we see a world where people value looking after their mind and understanding their mind that greatly? So we still think we've got a long, long way to go, and one of the ways we're accelerating the growth is through B2B, bringing Calm into helping workplaces become more emotionally intelligent, helping employees cope with stress and resilience, to reduce sick days, to increase collaboration, improve creativity, and on and on. And the inbound interest we've had from companies has been amazing. Again, just a few years ago, this would have been seen as a little bit weird, but now companies recognize the value of looking after the mental health of their employees. So that's a big area. And then connected to that is working with the big insurance companies to help them cover lives and stave off downstream problems where, you know, people need to see therapists and psychologists. But hopefully using a product like Calm is almost like the equivalent of using the gym to keep a body healthy before needing sort of major health.
Have you made inroads with the insurance, or that's
yes, yeah. We're learning that it takes a little bit of time. There's a lot of boxes to tick and admin to wade through, as there should be, because these are very, very important matters. But yeah, we have some big announcements coming up very soon, and so this is definitely the fastest growing part of the business and a very important one.
The global side, do deal with multiple languages yet, or are you in English? And
So English is the dominant. The US is about 50% of our total downloads, but we're in Korean, French, German, and Spanish, and I think Portuguese as well. Those are the current markets.
So again, a lot of entrepreneurs in the audience here. So when you think about your success, getting to where you are, and even in your ambition about where you want to get to, are there any kind of, when you start thinking of advice, of like, what were things that you kind of came across, you say, wow, if I were giving advice to someone, I'd say, focus on this, focus on that, or any thoughts on that?
Yeah, so again, as I mentioned, there are hundreds of apps for mindfulness and meditation and sleep in the App Store, and Calm has risen to the top, and we're often asked, what is it? What is the secret? And I wish there was kind of one silver bullet. But to answer the question, I'd say maybe four broad areas we've thought carefully about, and we touched on them during the talk. One is content. It's easy to make content. It's very hard to make extraordinary content that really changes people's
Absolutely.
lives. Number two is user acquisition and growth. That's a science, really understanding that, and Calm has some extraordinary people that know that world and that space very, very well. Number three, I'd say, is the experience, making it wow when someone comes to the app, that they want to share about it and talk about it with other people, and they have an incredible time there. And then the fourth one, as we talked on earlier, is brand. Making sure you wrap it in something that can scale and is defensible as the business grows. So those are probably the four most important things, I think, to get right for a company in this space.
Four good ones. The Nike of the mind. So looking ahead here for your own company, what does that mean to you, and what do you see on the horizon here potentially, without giving away any secrets here? But what does that mean to you? What other things could you get into? What are you trying to aspire towards?
Yeah, we mull on this a lot. So we have a very big mission, which is to make the world happier and healthier. So a lot of things can sit under that. We started, as I said, with meditation. We moved into sleep. But we'd love to create other audio content that changes people's lives. There are so many other occasions in someone's life where that could be valuable, from coping with a fear of flying, or giving up smoking, or battling an addiction, or becoming a parent for the first time, on and on and on. And we'd love to create this very deep library, potentially the world's largest audio library, that helps people better understand their own mind, because it's pretty complex up there. There's a lot going on, and it doesn't come with an instruction manual. So we would love to kind of help go some way to creating that. And then in terms of how we become Nike for the mind, we've grown to be $1 billion business, but we think, and it sounds a little crazy, but we think we could 10x from here, maybe even 100x. And I would love for us to build one of the most, not just valuable, but meaningful companies in the world. Some of the biggest companies now are tech companies, but why not over the next few years, given health and wellness is a $4 trillion global industry, why won't some of the biggest new companies be folks sitting in this room, companies focused on wellness, people taking a proactive approach to their health? I think we're going to see some enormous businesses built, and we'd love Calm to be one of them.
Well, actually, even $4 trillion just in the United States, actually. I mean, the market is insanely big. And as we're kind of coming to the end here, I mean, one of the things that we're at the beginning of a decade, right? Mm-hmm. And we kind of watched the last decade. There's been a kind of a struggle in this industry to kind of digitize and get to where we are here. But looking ahead, you sound like you're certainly excited about the future of Calm, but how excited are you for this whole industry? And do you see really that we're entering a much more rapid period of change? Are you seeing some really transformative potential changes over the decade? What any final thoughts here? We just have a few
Definitely. So many positive things going on. I mentioned psychedelics earlier. I think that's fascinating. These compounds that have been vilified for decades could be the solution to some of the most debilitating diseases in the world, such as depression. I think that's incredibly exciting. And mental health just generally, I think, as the stigma fades away, as it steps out of the shadows, I think it's just an extraordinarily exciting time. And healthcare in the US, health and wellness is $4 trillion. Healthcare, I think about $3 trillion is spent a year, most of it on physical health. So as we start, why do we not treat our minds with the same respect and care we do our bodies? And I think we will. So many, many opportunities there over the next few years for people to build great new businesses that improve the quality of people's lives.
Unfortunately, we're out of time, but it's been a fantastic conversation. Everyone seems to be listening closely here, and let's hope that you are the first of many that's going to come down that path. And great conversation. Thank you.
Thanks, everybody. Cheers.
Please welcome to the stage Allison Harmelin, co-founder of Zeal, and Michelle Wee West, LPGA professional golfer.
Hi.
Hi.
All right. Welcome, everyone. Thank you for being here with us. I'm going to give you a little bit more information about Michelle. For those of you who don't follow golf as closely as my 12-year-old does, you've been playing since you were 10. You hold the record for being the youngest player to ever qualify for an LPGA Tour event. You went pro at 16. You never even played on the Stanford team because you were already pro. We'll get to Stanford in a second. Born in Hawaii. Your dad was a university professor, not at Stanford, but in Korea. Your mother was an amateur golfer, so there's a little bit of that in your genes. You followed in the footsteps of some family members and wound up at that little school down south called Stanford. And at one point, you were number 2 in the world in women's golf. Woo! So thank you for joining us today. It's
Thanks for having
an
me.
honor to meet you and to have you here with us. So you've been playing since you were 10. Give me a day in the life of Michelle Wee, age 10.
Age 10, I was a pretty big girl. I was 5'7".
I feel like I was too.
I was a lot taller than everyone else, and I remember just being so much more physically advanced than any other person, I guess, and qualified for a national tournament, broke the record there, and I just didn't really think about it. Everything just kind of happened. I just wanted to do better, improve myself. There was a lot of people saying that I couldn't do it, I shouldn't do it, there's no way a 10-year-old can do that, and I have like a problem with authority slightly, and anytime someone when someone tells you you can't do it, it makes me just want it
all
more.
over.
Exactly. So I just wanted to prove to everyone that I could do it, and I just had fun. I didn't really think about it too much.
Interesting. Well, you did it. Okay. So on behalf of everyone in this room, some of you may know, some of you may not know, you just announced that you are pregnant with your first child. Congratulations. This is actually, if you're a Golf Channel watcher, this was like nonstop news 48 hours ago. So I remember the first time I found out I was pregnant, and that was a while back. But it's this seismic shift in how you think and feel about the world, about your career, about your health, about the future of the world. And you're probably already starting to have some of those thoughts. Can you share that with us?
Oh, it's crazy. I remember when my husband and I first found out, the world looks different to you.
Minute of.
It's scary. It's all of a sudden a very scary world, and you're thinking about everything that you're eating, drinking. Before, as an athlete, I did, but you're thinking about yourself. You're thinking about, okay, if I get 8 hours of sleep, I can play better. If I eat better, I can play better. And everything is about me, me, me. Now it's like nothing is about me. Everything is about, this child. And it's a constant state of fear slightly, but it's like excitement and fear. And, a lot of people were asking me, am I going to retire? And, if you asked that question to me a couple years ago, I'd have been, yeah, I don't ever see myself playing and having children. And all of a sudden, when we found out it was a girl, that completely changed. And now I really want to go back and play and, really have my kid be in the crowd watching me, especially because, she's going to be a girl, and I want to be a really good influence, a good role model for my girl, and to show her what a strong woman is, not just by saying it, but by doing it. And it's crazy how things completely change.
I completely relate to that. I have a daughter as well, and after having had 2 sons, I really think about when she watches me, what she sees, because she will completely pattern after you. And at some point, What you don't want a girl to think is it's time to close up shop simply because I'm a mother or I'm a wife.
Exactly.
Nobody's asking that of men.
No, and I think, I don't know why I was thinking that of myself. Like, before I was like, okay, I should probably, you know, when I have kids, I should just stop everything and just focus on my kid.
Commit completely to them.
Exactly, and I kind of want to do the opposite now. I mean, obviously, care for my kid, but also set an example of someone that can do everything. And I see my friends who are working mothers. I see my friends who stay at home as well too, and that's the toughest job of it all.
That's absolutely tougher.
You know, but I see, you know, my athletes friends that come back after giving birth, and I'm just so inspired by them. That no matter what route you choose, I mean, it's tough. It's not easy.
I have, my grandmother used to say, don't tell them, show them.
Yeah, for sure.
You can tell your daughter a million points of wisdom. Show her what you want her to be, and you're definitely going to do that. So we can go into when you were very young, you landed at Stanford University. My husband went there. He's the co-founder of the company. It changed the course of his life. I think everyone who's ever been at Stanford feels that way. How did those years in Silicon Valley affect the way you think about tech, big and small?
I really think my years at Stanford, those years were really formative in my life, and I feel like in the tech industry as well. I graduated in 2011, and that's when really things started to really ramp up in Silicon Valley. It seemed like professors were grooming kids to think outside the box. It seemed like when they were recruiting people to come to Stanford,
they were looking for that mindset.
Exactly. You know, I know people that had a 4.0 GPA, aced their SATs, didn't get in. I did not ace my SAT.
I have a lot of alumni friends who aren't happy. You got to really bring it.
Yeah, and I really appreciate that. I think Stanford really made me look at the world differently. I think I see some of my classmates, you know, obviously there's, you know, founder of Snapchat. I remember him, you know, pitching the idea, and there's so many other classmates in my class that have done the same amazing thing, and it's a different mentality. It's the same thing for, you know, Evan as well. Like, people told him he can't do it. There were professors that tell him he can't do it, and, you know, to show that you can do it. If you believe in something so much, to go out and prove to everyone else that, you know, you can do it. And I think Stanford really brought that out of me.
I was at the Starbucks this morning at Stanford watching all these young people chatting, and I was thinking, this has to be the smartest Starbucks in America. It's really amazing to watch their brains percolating, and you see a lot going on. It's an exciting place
definitely one of those really smart-ass kids in high school that would talk back to the teacher thinking I was the smartest kid in school. And then I took my first math class at Stanford, and I was like, wow, I should just stay quiet.
Right. They're not playing down there at all. Okay, so as a female co-founder, you know, there aren't as many of us floating around events like this. And overall, the number of women in venture capital, let's say, is growing, but still challenging. So do you see this paradigm shifting, certainly with your generation? You're sort of smack dab in the middle of the millennials, but let's talk about for our children, there'll be Gen Z. Do you see that shifting? Are you watching it shift? Are you worried it's not shifting fast enough? Do you think it's not shifting at all?
No, I think it's shifting. I think it's everything's shifting in the right direction. I think, you know, both boys and girls, I think they're given more opportunities to be creative. There's not so much, oh, you have to be not a doctor or a lawyer now to be successful. You can really create your own path. And I think for women as well, too, it's not just, like we said before, have kids and that's, you know, your success. You know, there's a lot of more paths that people can take. I think being female athletes, you know, the LPGA, I've seen it grow over the past couple of years, and seeing girls come to the tournament, seeing girls be more confident in being female athletes, I think everything's changing. I think everything's changing for the better, and I hope to keep seeing it changing. I love seeing girl coders. I love seeing, you know, women CEOs. And it's just, I love seeing strong women being confident in being strong. I think I see a lot of really capable, strong women, but they feel shy, they feel kind of embarrassed. And, you know, I think I'm seeing a change in these women, that they're being confident, that they're not scared to be, you know, aggressive and confident in what they're capable of doing. So I hope that keeps changing, and hope for Gen Z that can keep growing.
They'll have a different experience. Okay, so as tech wellness companies go, and I think the Calm founder said it's like a $4 trillion industry. I think I heard that number. I'm honored that you're a fan of Zeal. That's very exciting. And now your massages will be prenatal massages. That is something we offer. What other wellness tech companies? I know one of them is Tonal. Do you follow? And if you were going to become an investor, what kind of companies would you be drawn to?
I mean, I love Zeal. I started using Zeal a couple months ago.
Oh, you don't have to say that just 'cause
It's true, though. I mean, I think my parents visit me here in San Francisco just so I can order them Zeal massages.
You can order them Zeal massages in 90 cities around the country.
They're not very
Let me know where they are.
tech-savvy.
I'll find them.
Exactly. They live in Hawaii. Do they?
We are in Hawaii.
Oh, perfect. They don't know how
Not
to
our
use the phone that
not
well.
our easiest rollout, but it's done. We're there.
But I just love the fact that they come to your house. You know, I moved to San Fran from Florida, and coming to a new city, I needed someone who could work on my body, someone who could, you know, massage and do all of that. And I just didn't know where to begin. And I just love that technology makes that so much easier.
Wild, right? Who would
Yeah.
have thought? I remember when we first described the idea to my father, and he literally looked at my husband and said, her future is an app with massage to the home. He did not look happy at all. He, frankly, hadn't at that point even heard of Uber entirely. This was early days with apps. And I think our lives are changing because I can get anything done more efficiently as
Exactly.
a result of it. You'll see as a mom, when you go to bed at 9 o'clock, when your baby goes to bed at 7 and someone can be at your house by 8:30 or 9,
it's amazing.
that's found time.
Oh yeah, I mean we have a dog at home, and we don't like leaving him. I think I have separation anxiety from my dog. So the fact that a massage therapist can come to my house, also moving here from Florida, I had to leave my trainer. I had to find a whole new gym, and you know stuff like Tonal, stuff like Peloton. It's amazing. Things are at your fingertips right now, and it's incredible. You don't have to go the old route of joining a new gym. Oh, I don't like this one. This one's icky. I'm going to try a new one. You can just try things instantaneously, and you can do yes, no, move to the next one. And if you do end up liking one, you can see how it grows with you, and I think that's really exciting.
Okay, so here, Tonal is an interesting one. So we have a Peloton, and some folks feel like after the 6-month mark or the year mark or that you're no longer enjoying as much. Have you been doing Tonal for a while? Are you getting any of that sort of highway hypnosis on it?
Yeah, I definitely do get tired of workouts. I think I'm like
We all
ADD
do.
with stuff. You know, I like to try this out, try that out. But I know that I struggle with injuries. So I know if I stick with one and it works and I don't get injured, I definitely stick with that one. I think Tonal's great. We've installed it in our house. It's just a well-rounded system. You could do everything with it. I do enjoy going to Barry's and going to the physical classes with other people
Those
as
are
well. But also just there are days I don't want to leave my house, and it's rainy and cold here in SF. You can't find
and
parking.
traffic is terrible, and there's nowhere to park, and it's not relaxing. And
so all I have to do is go downstairs and set up a machine.
Very much the
turn
same
on the
idea
app.
behind Zeal.
Exactly.
We're getting folks saying, you know what? After I've come back in the taxi and sat in traffic, I'm not relaxed anymore, and I've just spent
No.
$200 at a spa.
Exactly.
Okay, so let's move to Instagram for a second. We're all social media hungry, and my 7-year-old can use Photoshop and filtering. But I think that Instagram wellness and fitness and influencers like yourself, there's a downside to it, right? Everyone's feeling badly about themselves. How do you try to combat that negativity as a fitness icon?
It's hard, the Photoshop and the filtering. You see everyone do it. You look at a photo and you're like, oh, I don't like that photo. It's hard, but I think how I combat it, I've always been very open with my struggles, and when I go through hard times, just to be open about it. I mean, I think life on Instagram, you have a sense of FOMO, like where you feel like you're missing out on everything. Oh, their life seems so great. Why is my life? And then it's the same
But even
person.
you feel like that?
Yeah, and people
You feel like that?
Yeah, obviously every day sometimes, and then you have to put things in perspective. But I also think that, Instagram fitness influencers, like my friend Anna Victoria, she started a fitness app, and she really created this whole community of people that work out together, that can message each other through this community.
To support one another.
Exactly, and I think the internet is an amazing place. It can also be a very scary place, but at the same time, it could be a very, very amazing place where it connects
Sure, it
people.
could be harnessed for good.
Yeah.
I think we forget that sometimes. There's a little bit, they're calling it tech lash, which worries me a little bit.
Yeah.
Okay, so finally, because I know you are on a tight schedule today, you've just turned 30.
Mm-hmm.
You just got married, you're having your first child, but you have many, many years of golfing ahead of you. What would you tell your 10-year-old self if you could talk to her now with everything that you have experienced and everything you've got coming up the next year?
I mean, I say this every time and people laugh, but this is like truly something that I regret is I would tell my 10-year-old self to wear my retainer.
Oh,
to be honest. I know, I get the same reaction, and I'm not saying it as a joke, because I might need to get braces again.
No,
and
I took mine off before prom with a pliers.
Yeah.
I really feel like I should also have worn my retainer.
Exactly, and they always tell you, wear your retainer, and then I didn't. And, there should be an app for that.
There is. It's called Smile to Your House. Oh, yeah. Every once in a while, late at night, I'm watching TV, and all these happy, smiling people. We need to get on that.
We need to get on that. Yeah, my teeth are definitely crooked again. But no, I mean, I know I've made a lot of mistakes in my career, but I think that those mistakes are what make you. I think you have to go down the wrong path for a little bit to realize that you're on the wrong path and to correct yourself. If, I don't think a perfect life is a perfect life. I think the imperfect is what makes it perfect.
I love that. I'm going to end with that. Thank you so much.
Thank you.
We meet in an hour of change and challenge, in a decade of hope and fear, in an age of both knowledge and ignorance. The greater our knowledge increases, the greater our ignorance unfolds. Despite the striking fact that most of the scientists that the world has ever known are alive and working today, the vast stretches of the unknown and the unanswered and the unfinished still far outstrip our collective comprehension.
I used to characterize my business interests in media, film, television, as a storytelling business. Everything is a narrative. It's the oldest form of communication.
Condense, if you will, the 50,000 years of man's recorded history. 10 years ago, man emerged from his caves.
What appealed to me conceptually was the stories of people's lives on a universal basis.
Only 5 years ago, man learned to write. The printing press came this year.
People want to get a sense of who you are.
Last month, electric lights and telephones and automobiles.
Traditional business and venture capital investments don't dig that deep.
Some would have us stay where we are a little longer.
What's your value system? And why are you doing this?
We set sail on this new sea because there is new knowledge to be gained and new rights to be won. And they must be won and used for the progress of all people.
The moonshot is all of us who understand the urgency and the need to reimagine the fight for the 21st century. How can innovation in science, medicine, and technology transform the healthcare system to deliver better care and to save lives?
The lack of people who have no access to what I have. I'm a former CEO. I happen to have Parkinson's. Look at me now. So, how can anybody argue that a poor child born in Iraq, drinking dirty water with no access to medical care, why is that a good thing? If we don't solve that, then all the political systems, the right, the left, are meaningless.
Right now, we are at an epic moment in time. At StartUp Health, we are in full support of not only the cancer moonshot, but we've created additional moonshots that are going to affect the health and well-being of everybody on this planet.
Health moonshots, not just digital health and wellness companies. We're organizing and supporting a global army of entrepreneurs in StartUp Health.
Healthcare has been incredibly siloed. Everyone is trying to protect their own ideas.
Information is not available because it's contradictory, it's inaccurate, it's all over the place, you don't know where to find it, when you need it, you don't have it.
At the same time, there's this digital revolution taking place. There's this pressing, urgent demand for new solutions.
Mindset matters most. The most successful entrepreneurs and companies have what we call the health transformer mindset.
The transformation of healthcare can only be done together, in unity and in collaboration.
Why some say the moon?
We can bring access to care to everyone in the world, no matter how much money they make, no matter where they live.
Why climb the highest mountain?
We want to invest in and support in every health transformer, every entrepreneur of consequence for the next 20 years.
It's about the everyday person who is going to have some innovation or invention that changes the world in terms of health and wellness.
It's about to dream a dream that's impossible.
Millions of people are praying that we succeed. Every damn moment counts.
Okay, yeah, we can see you coming down the ladder now. Roger. Clear.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard.
Please welcome to the stage StartUp Health's Portfolio Director, Paulina Hannon.
Hi, everyone. Every time I watch that video, I tend to get something new out of it and an inspiration to just continue the fight that all of us are here for. I'm really excited for this next panel for a couple of reasons, because I think it's about two topics that very rarely get talked about. And this is no pun intended on it. The first topic is rare diseases. And the second is how those rare diseases affect children's health. So last year, there was $13.7 billion that was invested in health innovation. How much of that do you think went directly towards children's health? Someone shout out an answer. Audience participation here. How much? 118 million. Out of $13.7 billion. We have to do better than that. So this is why I'm particularly excited to be able to welcome these next panelists. Yishai Noble's company HelpAround is untangling access to specialty pharmaceuticals. Linda Brown-Ganser is ensuring that no patient is left alone. And Jason Lembeck is on a mission to support families who are raising kids with disabilities. And moderating this discussion is Saren Rothberg, CEO and founder of Comedy Cures Foundation. Please welcome them to the stage.
All right, we're gonna do exercise.
You can sit.
I'm nervous.
So just to give you a little background, I'm a stage 4 cancer survivor with no visible disease. And I started Comedy Cures from my chemo chair, April 30th, 1999, to bring joy, laughter, and humor to my fellow patients and their caregivers. And at this point, we've helped over 1 million people worldwide find their funny bone and laugh. And at about 4 o'clock, after we've been sitting here all day, you're all in a food coma, and you've heard so much. So I'm going to give you a little exercise, which is very fitting for this panel, which is putting kids first. And we all have a child in us. So I want to do one laugh for you. I want you to stand up. Put your arms in the air. Wave them like you just don't care. Okay? Good. Now we're getting all that circulation going. This is a conference about health and wellness. If you're feeling a little dizzy, you can either sit down or put your hand on the chair in front of you. Do not hit your head. We're going to do one of my favorite laughs. It's called a roller coaster laugh. We're going to do it 2 times. If your own laugh takes over, let's go with it. Ready? Ha 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 ha. One more. Ha 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 ha. Woo! Give yourselves a round of applause. You can sit down. If you like comedy, you can call my laugh line. It's 1-888 ha 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 ha. We're gonna say that. Ready? 1-888 ha 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 ha. Now we're gonna laugh it. 1-888 ha 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 ha. Very good. If you press 1, there's a professional comedian. If you press 2, it's an amateur, any one of us. And if you press 3, you can tell me a joke 24 hours a day. So I expect everyone here to tell me a joke. Now to our panel. You guys, I have a personal connection to each and every one of you and what you're trying to do in healthcare. And so I applaud you as a consumer of what you're doing. So let's start with Yashai. Help around. Why? How?
So I'll start with a quick story about myself. I was fortunate to grow up healthy and without any serious disease in my family, but I did have one burden. Is there anyone here who sometimes loses their stuff? Okay. I was a mess. I think I should have been put up for adoption by my parents because I just couldn't get a hold of my things. What do I do? When do I do? So when this thing came out, some people started sending photos of their cats. For me, this was a lifesaver. I have tiles connected everywhere. I have ringers. I ask Alexa, where are my keys? Live example. Live example. My mom should be watching this. So then when I came into the world of healthcare, which was 10 years ago in type 1 diabetes company, we invented the first connected glucose monitor. And I was acquainted to the burden, the logistical burden that families with a difficult, life-changing disease need to deal with. And I realized that what we have to manage, they have to manage 10x of that. So someone with type 1 diabetes, they have sensors, they need to inject insulin, they have to monitor when they travel, the blood sugar go crazy, when they don't sleep at night, it goes crazy, when they eat something, and you know what's that constant sense? Failure. You fail, and you fail, and you fail, and you fail. So as time went by, so this is why we started Help Around. We started Help Around because we wanted to find help around each one of us. Using technology, using the phone, we will find help wherever you are, and today we help connect that to what's called a patient journey. Patient journey is what drug manufacturers call the maze that a patient has to go through when to get on the drug that they need. So getting on therapy, getting on a drug after you got a prescription, in this world, which is called specialty, rare disease and orphan drugs are a big part of it, is a maze. There are between 20, 30, 50% of patients who never get the drug they need, even though they have their prescription. So for us, our mission is to get patients to the therapy that they were prescribed and make life easier on the way so they don't have to just bury in faxes and letters and phone calls, which is the current status quo in the American healthcare system.
So this is a godsend for parents of children with rare disease because you're juggling family, you're juggling the children, you're juggling all the medical care, and you guys short circuit all of that and help the families get the children to the right disease, to the right drugs.
Therapy. So they typically actually so there's the specialty world where getting to get the drug is a huge achievement. In the world of rare diseases, getting to the right doctor that has ever seen this kind of, these kind of symptoms and can connect the dots is a huge achievement in and of its own. So I think we have an even more complicated situation here when getting to the diagnosis is a huge undertaking, and after that, getting on the therapy and actually staying on it and seeing whether it actually works for you. And one more comment. I think today, with precision medicine, in the future, all diseases will be rare diseases. And the reason is that today there's no one breast cancer. There are 20, 30, 40 mutations of breast cancer. Each one of them is a patient pool that is tiny. So the industry and the drug industry, the healthcare industry needs to prepare for a day where every disease is rare disease.
It's interesting because I did 7 different chemo drugs and I was completely chemo resistant. And when I was diagnosed, my particular cancer wasn't even named. It was just that terrible cancer that young women get. So I would have been a candidate for exactly what you're offering. Hi, Linda.
Hi, how are you?
You're already rocking and rolling. You're in 85 countries?
Yeah.
That's amazing. In 4 languages.
5.
5 languages now. So tell us about Curatio.
Curatio is what we call a social health prescription. And what that means is we match patients to other patients and families to other families that are going through the same thing. The easiest way to think of it is a completely private and secure social network like Facebook with a little bit of matchmaking and Tinder thrown in, and a whole suite of daily disease management tools that just make living with a rare, chronic, or any health condition a bit easier.
And again, this all relates so personally. My daughter was born with her organs reversed. And it was very isolating, and there was no one to talk to us about it. And the only information was at a medical library uptown in New York City. And there were so few people even documented in medical journals. And this would have provided for our family a way to connect with other people, healthcare professionals, and to find out that we weren't the only family living with reversal of organs.
Exactly. And our mission statement is no patient alone, because that's exactly what we want to do, is connect people. In one of our very early deployments, it was a small group, young adult survivors of cancer. There were about 300 people in that group. And we had one young fellow in Vancouver who had a rare type of cancer, had never met anyone else. He was about 17. And lo and behold, even in a small group of 300, we found another match for him, another young fellow. He's about 20 in the Midwest, had the same form of cancer. And they eventually got together that summer and learned a lot from each other. So there's the connection piece in addressing some of the stigma, the isolation, the unknown. But on the flip side, there's the wisdom of the crowd. And even though these are small crowds when we're talking about rare diseases, the wisdom of that small crowd is immense in terms of not only treatment protocol, but R&D.
You just think about the loneliness and the struggle, and now with your app, families have resources at their fingertips around the clock. And the amount of time that families spent before your app just trying to navigate the very basics of any illness.
Yeah, exactly.
Thank you. And lastly, but not least, we have Jason. And you're near and dear to my heart because I was a special ed teacher.
Yes.
Decades ago. And I know firsthand the struggles of what it takes for families to navigate with disabilities. And here you come along with Special X, which is a working title.
Yes.
I was going to buy him the website because I went to look him up online and it said it was for sale. And I thought, what a nice moderator gift if on stage I give him the website, specialx.com. But we know it's a working title.
That's right.
Tell us where you are in this
Yeah,
process.
we're just at the beginning, but our mission, inspired by my own journey and my son's journey, Noah, is to help every family raising a child with disabilities get the best care possible so their child can live their best life. And My son, I have 3 boys. My eldest son, Noah, who's almost 12 years old, was born with, at the time, what was called cerebral palsy. We went on a 4-year diagnostic journey and got a diagnosis with a rare genetic condition called FOXG1. And then the journey kept going through this maze that was described earlier. And my wife would like everybody to know she has the PhD. I only have a BS in engineering. But for 2 college-educated parents going through this maze and struggling with the grief of a child that's not what you expected, beautiful boy, amazing spirit, but different, then you turn around and you deal with, that's a cycle of grief. And I describe what we're dealing with for our families, the cycle of WTF. Like, how do I deal with insurance? What is this school process that's just totally different and nobody knows about it? You got to talk to people in the waiting room to learn about it. How to deal with finding therapies. And that struggle that we had in trying to help Noah live his best life was isolating. And then you realized, as we started talking to other families, that everybody was dealing with this same cycle of WTF and grief. And so we set out to build a platform that combines technology with the power of people. We bring in expert guides. So 40% of families who have a child with disabilities has a parent leave the workforce. Those parents go out and build up these set of skills that they can navigate this world. So we're hiring the best and brightest from that group of parents to serve our customers.
You call them care navigators,
right?
Amazing.
And then as they serve those families, we build up this shared knowledge. And the ultimate goal is there are 100 million families in the world raising kids with disabilities. Why aren't we all working together collectively to get the best care possible for every child?
So just the financial burden of a family living with a family member or child with illness, particularly rare disease, and the insurance, the amount of energy that you need to put just towards getting insurance qualifications and reimbursements. How are your different platforms helping with the financial aspect of rare disease or disability?
We have, on our team, we have insurance advocates who know how to work the systems, whatever the care plan is, to make sure parents understand how to maximize their benefits, how to find therapists that are within coverage, or if it's out of coverage, how to get out-of-network reimbursement. And it's a maze in and of itself. And ultimately, if you're dealing with trying to help your child, you don't want to get lost in that maze of becoming an insurance expert. You want to give them the best that you can, and so that's how we're supporting.
Well, it's a time thing. I mean, just having a child whose organs are reversed, you have to work.
Right.
And you have a whole full-time job at navigating the healthcare system.
Yep.
So everything that you're doing is so powerful in transforming, particularly the parent experience. So many families with children in particular living with a disability or a disease, the family ends in divorce. There is a divorce. I'm one of the casualties. So it's really incredible how you're supporting the family unit. Can you talk about some of that?
Yeah, it's a really interesting point because we started out looking at patient-to-patient support, and then we quickly realized that caregivers, families, spouses, parents needed their own pathway as well. So now we match on multiple roles. So we can match patient-to-patient, caregiver, parent-to-parent. Because the health and well-being of that caregiver or parent is equally important. And lots of research around, the overall health of the family and the outcomes related to the child or the person.
Yeah, there's a statistic, and some deep research around this. A parent with a child with autism, a mother in particular, when they do the analysis of cortisol levels, they have similar levels to a soldier coming back from war. PTSD.
Which they say it can be a predictor of cancer.
Really?
That high cortisol levels can be something to really look at and signal that you're on a watch for cancer.
And back to your point about about financial options. I think when we looked at the ecosystem, designed to support that the patient's family. This is a for-profit environment. So when you look at who's aligned, you realize something really interesting. There is a very big force whose interest is for you or for the family to get on that therapy and succeed, and that's a drug manufacturer. So when you think about affordability, financial options, actually there's someone out there that has the same interest as a patient. And you know something, what we discovered? We discovered that drug manufacturers actually put out there an entire ecosystem of vendors, including copay providers and hub services and reimbursement consultants and patient assistance programs, except they do it in a way that is not very user-friendly. But it's there.
It's a communication issue.
It's a
for sure.
communication, and we are now at the point where, while we talked, probably 5 people in the audience ordered something on Amazon, on mobile. But this ecosystem, healthcare and drug manufacturers are not Amazon, and they don't think they're Amazon. So they haven't found a way to make it so accessible and so easy to use, but now they start to come to us and understand and ask for help. And it's happening. It's working. We are seeing a lot of success with 27% longer time on therapy. Patients stay on the therapy that we're prescribed, and a lot of that is through affordability. So I think that's a huge piece, and you got to understand who your ally here is, and the patient's ally, maybe surprisingly, is a drug company.
You bring up a good point, and that's I've seen from helping so many families through Comedy Cures. You could have a CEO, you could have a diplomat, highly educated people, and when it comes to their own children and their health care, it's as if all the degrees and the logic and strategy goes out the window because you're operating from panic and emotion and fear. So it takes a while for that, killer instinct. I'm not going to stop at, anything because you're just going through all the 5 stages, denial, depression, everything that you're going through, anger. And so to have resources that can hold hands, and I get calls all the time for people asking, are there any drugs? Can you get me to pharma companies? Do you know how I could possibly get that drug? Or it's too expensive. We can't afford that drug.
Yeah, I think it's interesting. As a parent myself, I think about that emotion, going through this cycle of grief and trying to be, the best caregiver I can for my son Noah, and it gets cloudy fast because of that emotion. And we have navigators who have their own kids with disabilities, and we have these staff meetings where they'll talk about this exact point. They can help somebody else. They can help them be that killer for their child, but then when they're talking about their own, all the confidence goes away, and they're dealing with those challenges of how do I do this for my own child.
So let's take it one step, right? Educated, degrees, intelligence. I sit there and I say, what happens when English is your second language? Now, you've addressed some of that by having your platform in 5 different languages. But now you're trying to do everything under all that stress with the time limitations, and you're lower socioeconomic, you're working 2 jobs, and English is your second language. How are we using technology to help those families with rare disease or
So I think so first of all, I think the availability of, remote translation services is really critical, but I want to go back to the extreme shopping Amazon example, because it's the most familiar, and it's also where most of the technology has gone there to get you to buy something. There's good news. That technology is now being funneled or channeled towards healthcare. Where in the past you would want to buy something from the US or from China or from wherever, and you just wanted to get there, people had interest to get you that service in the language that you need. And you don't need to be, you don't have to have high literacy for that. So when we are managing, when the family is managing that situation, we should all assume that we're dropping off 50 points of IQ because we're terrified. Fight or flight, freeze. We can't function at a high cognitive level. So for us, the task on us is to take that technology that until now has only been in retail and shopping and ads, etc., and bring it to patients who really need it at that moment, and selfishly do a sneak peek of something we're announcing tomorrow, which is we actually partnered with two great companies, Braze and Neura, to basically figure out when is the best time to engage a patient without them telling us anything. So when I wake up in the morning, I get the message. When I woke up in the morning, that's when I want to get it. Or don't give it to me while I'm driving, because that drives me nuts. And we were able to show 60% increase in people actually responding to these messages. So I think it's a good time to be in technology and bringing technologies from other fields to healthcare and do good in addition to doing well, which is also important.
Linda, how are you reaching people? You're already in 85 countries. What are you doing to reach all socioeconomic groups?
One of the things that just gives me goosebumps is when I see people reaching across, countries and continents and sharing information about what the protocol might be there and what it is in their country, and so much learning that's happening there. So, we're also narrowing that knowledge and economic divide in many ways because we're getting knowledge and information into the hands of everyone. So that's been really powerful to see. It's a very grassroots kind of approach, and certainly we have the checks in place to make sure there's not erroneous information or information that would be harmful, and we're not a medical, advice platform. So we put all those checks and balances in place, but nonetheless, to see someone and a family that's struggling with thalassemia in India, and to find out what best practice care is in Greece is quite phenomenal.
I would love to do a television show where I unite your families. It would be so awesome.
Yeah, that would be.
We should talk about that.
That would be so great.
No, really, let's bring them together. But do it for the first time on video.
Yeah, I'd love that.
We're making deals here. And how are you?
Yeah, I would just add that I think one thing when you think about rare diseases, that they typically mean multiple specialists, and in the case of kids, they also mean not just healthcare maze, but education maze. So the complexity of that, then you add in language, socioeconomics, and it's a really difficult problem to solve with only technology. And the community, and in our case, we're hiring navigators from the community who understand the particular challenges that community faces in navigating systems that they're not used to working for them, or even have understandable concerns and fears about those systems and what they might do with their information. And so that's a critical piece of the puzzle, is that human element to really meet the families where they're at and really support them in the way that is most appropriate to them.
But just using your care navigators to keep the child on track educationally, because they're missing so much school because of appointments or pain or treatments, and to have you guys to help navigate the school system so that child doesn't fall further behind. It's really powerful. So we are completely out of time. You guys are just delightful. I applaud each and every one of you. Can I get a round of applause? You should know success, all of you.
Thank you.
Thank you, guys.
Please welcome back to the stage StartUp Health's Paulina Hannon.
Feeling good as hell. Anybody else feeling good as hell? Oh, come on. That is pathetic. That sounds like you're actually feeling as hell. Come on, how are we all doing? Yes? All right. I think I made this analogy before that if I don't get applause or just any kind of affirmation, I'm like Tinkerbell. I just tend to wither. So I've been really excited over the last couple of hours, but I feel very privileged for this one to be able to have 3 separate discussions with a number of different founders, all of whom are deploying different types of collaborations. So for the next 45 minutes, what we'll go through is 3 different sessions about different types of partnerships. Different types of partnerships between founders, another type of collaboration that emerged into a joint venture, and then we'll wrap it up with a partnership between an end user that actually wound up turning it into a pretty cool endeavor. So up first, I'd like to welcome Ken Mayer, CEO and co-founder of Safe Health Systems, and Lauren Weiniger, president and co-founder of Safe App. Please welcome them to the stage. Yeah. Sorry, I can't help it.
Never apologize for Lizzo.
Yeah, Lizzo is a mood to a certain extent. So what I wanted to discuss today is the different types of partnerships and collaborations that all of us have really come to the festival for. There's over 2,000 meetings being held upstairs. There's different types of collaborations that are being discussed here. And what I'm curious about is this unique take on a collaboration between the Safe App and Safe Health Systems. So this partnership actually started as one singular company, Safe App. And Lauren, I'd love to start with you first. If you could tell us about how Safe App got started.
Yeah, absolutely. So first off, Safe App, it lets people show their verified STD status privately on their phone. It's also the easiest and least expensive way to get tested and soon also treated, so prescriptions. But it came about actually from Burning Man. Okay. So Ken and I have been friends for about 7 years. At that time, it was about 4 years ago. We were camping together for our first time with another friend of ours whom Ken had just recently started dating. And she, like many, many people, and particularly many women, will only have sex with you if you have been tested, and you can prove it. At the time, STD rates had reached an all-time high for the first year. It's now the 5th year in a row. And there's never been an easy, less awkward way to show your status and confirm your partner's status.
Yep.
So long story short, Ken was supposed to have gotten tested. He made an appointment at his doctor, had to cancel it. It was going to be another 2 weeks, and he didn't. And she was pissed. But it got us all thinking and talking.
Is that true? Okay.
But yeah, it really sparked this conversation of why is it this difficult to get tested, and why has there not been this way that's less awkward, that's fully verified to have this conversation with your partner in a way that's unstigmatized and can be trusted. So we decided to create it. It started out as a side project of sorts, and then we realized that not only had STD rates reached this new all-time high, it was a huge problem, but also the industry was something that could be incredibly profitable, and so we could have a lot of impact and make a lot of money at the same time. And going to the partnerships conversation, we started having these conversations with the CDC, got the number 2 guy at the CDC on the board of directors. Ken made inroads with Quest, which became our first large partner, and the rest is history.
There you go. So what I really took from that is that it started out as a small idea, right? And then it grew into a much bigger platform that was focused on STD testing. But it seems now that Safe Health Systems is expanding even more. So going beyond the STD testing and making sure that we are all practicing safe sex, but it's going beyond that into other chronic diseases. Ken, can you share a little bit about what Health Systems is all about?
Yeah, so as Lauren mentioned, we started with this very simple premise. We were going to create an app that let people show their verified STD status, provide an easy and expensive way to get tested and treated. As we started peeling back the layers of the onion of what it was going to take to accomplish that deceptively simple concept, we inadvertently built an integrated digital healthcare platform. And it was really done by just kicking down obstacles and going around as we hit walls, we figured out ways to go around them. So we now have a national healthcare practice with physicians that are licensed across all 50 states. They connect into a proprietary EHR and telehealth platform that we built. We have partnerships with Quest and LabCorp and data integrations into their back-end systems for order results and scheduling. And users can book testing at over 6,000 locations across the country and then pay for it with their insurance. So the way we accomplished that was we built this engine that we call assisted care automation. And what it does, it enables us to basically codify the protocols for in-person doctor visits around low complexity use cases. The one we have live now, that we've actually had about 3,000 people get tested and then have that testing covered by either CMS or a commercial payer for STD testing. So it mimics the same questions that a doctor would ask if you went in and asked for an STD test. It's all based on CDC guidelines. There's technically a provider that's licensed in the state where the user is behind the questionnaire so that we can prescribe the testing as medically necessary and bill it to CMS or a commercial payer.
So it doesn't sound like the patient or the end user's experience is changing very much. It seems to go directly into the workflow. As you guys are developing both of these systems, how important is that to make sure that the workflow for the consumer or the patient doesn't change?
Well, we wanted to make it as easy as possible for them. So rather than having to take off work and go into an office visit, sit in a germ-infested waiting room, potentially getting sick while you're there looking to just get an STD test, and then have CMS or the commercial payers cover $80 to $180 for that office visit.
Yep.
You can do it while you're watching the news in your living room in 5 minutes, and we bill an asynchronous telemedicine billing code for $46. So there's a lot of cost savings plus an ease of use or cutting out hassle for the patient.
And Lauren, you mentioned the fact that you guys had a partnership that kind of started SafeApp with LabCorp and with Quest, and it doesn't sound like that changes the workflow either. Can you share a bit about those partnerships and how important it was to get some of those larger organizations involved?
It was critical. The entire company is really built on a collaboration model. The fact is that right now all these systems are quite disparate, but what was happening before is people had to go into their doctor first and then and many times have to separately go to a lab. That first piece is really unnecessary. So in order by partnering with the labs directly and cutting that out of the workflow, it means the patient can just go direct, and but because it's staying the same, we can still have it covered by insurance.
And so as you guys do build up these companies, is there a difference between the way in which you have to engage a consumer or a person that you consider a consumer, like on the STD side, or the way in which you have to engage a patient, a person who is coming through a health system?
Right now, we are doing it all from the consumer angle. Patients are people.
Yeah.
And so we really have built it, as far as the brand go, it's really a lifestyle business. We're not treating them like stodgy patients. We're communicating with them through their favorite influencer or through content and other medium that they really identify with.
Is that something that you wanted to bring into the health system side as well, to treat patients as consumers?
Well, the reason we spun out the health system is it's a platform that enables these custom specialized population health management applications around different use cases or to service different populations. So SAFE, which we're in the process of rebranding to Safely, really exemplifies that, targeting the sexual health vertical or servicing people that are looking for sexual health services. We're working with another one that we're doing actually with Mayo Clinic around vaccination management that's called Vaxi. So the idea is we can quickly spin up these white-labeled custom apps that are designed or configured specifically to service different populations.
Now, the way that we talk to the healthcare organizations versus the consumers is very different. I always say we're a healthcare company, we're a technology company, we're just as much a marketing company. And there's different language, there's different hats that we wear in order to do all of these things extremely well.
Well, that's one of the things that has always fascinated me about how you guys work together, because even when you shared the initial story, it's not like you had a traditional healthcare background. You're coming at it from a marketing and an advertising perspective that is really focusing on that engagement. What do you think you brought from your previous lives into this health side that we as healthcare industry can really learn from?
I think it's been one of the challenges of healthcare going to the consumer that they weren't speaking from that consumer-focused young lifestyle angle. Kind Ken and I's background varies. Ken spent you want to go into it, but most of your background in marketing. I actually came more from the finance side, but coming from a person that is a user of this app. I created it partly because I wanted it to exist and be able to put myself in those shoes and speak to people how I want to be spoken to and how I wanted to be spoken to when I was younger as well. Has been really the key for it growing the way that it has.
Yeah. How important is it for you both to have utilized this application and maybe even be users of the future of safe health systems? How important is it to have your own DNA, if you will, in the development of this product? Or are you really looking forward to working with providers and other stakeholders in order to understand how they're utilizing it?
I mean, for the Safe app, we target mostly women, and the message is one of empowerment. And we're empowering women, or young women in particular, to respect themselves, protect themselves, and take control of their sexual health. And as a woman who was single until recently, that was me. And anyone I dated would have to use it. And being able to build a product that I was a user for myself, that my friends are users of themselves, has been incredibly important for understanding how we're able to do that and getting their feedback in as well as we continue to iterate and improve.
I mean, I enjoyed building safely specifically for this vertical, but I also kind of get off on the idea of creating different ones. Like I really enjoy working with different really smart people, whether it's at companies or other entrepreneurs that want to create their own specific vision, and providing this set of tools to sort of facilitate that in a way that doesn't take 2 years and $3 million to do.
Right, and that was actually going to be my next question to you is, okay, so you have the entire health systems platform, you have this effectively connected diagnostics, I think you called it, system that started out on the STD side, you're going into the vaccination front. What's next?
I mean, I think, any of the different verticals that can reduce the sort of friction or increase accessibility and reduce cost. I mean, the thesis is there's about $500 billion of wasteful spending at the very low end of healthcare. And there's 20 conditions, ultra-common conditions like strep throat, UTIs, which are the most common office visit, ear infections, the STDs, that represent $1.4 trillion a year in cost. And all of those 20 things are priced at 3 to 7x what they should be if market forces took effect and drove them down to their natural lows. So we're inspired by, providing technology and techniques that can leverage, the same type of methodologies that transform other industries and apply that to healthcare.
So if you had to have one call of action for the audience members here, for those who may be listening on the live stream and those who will be listening as the recording of all of this comes out, what is the call to action as it relates to engaging with both of you going forward?
Well, download the Safe app, first of all. You can find it at safeapp.me, that's M-E, available on Android and iPhone.
And I'd say if you're looking to build a population health management app like NERC's, Romans, or HIMSS, instead of building it from scratch and spending a ton of money and time, come to us and we'll get it out very quickly.
Awesome. Well, Ken and Lauren, I want to thank you both so much for spending the time with us and really excited about what you're building. Thank you very much.
Thank
Give
you.
a round of applause. Okay, so next up, I have actually had the unique pleasure of working with this next CEO for the last 5 years, and it has been a lot of fun working with him. He's a person who was initially shy to state a really big vision, but in the last 24 months, I counted, he has released 24 separate press releases, announcements of really huge endeavors that his company is taking on. So with that, I would like to welcome Nahi Kurji to the stage, please. Hi. I was actually going to comment on your socks, that it has, in the last 24 months, the thing that has changed is your hair. You have cooler socks, but now you're rocking it sockless. So it threw me off my game here.
From Toronto to California, I got to change it up. And the haircut is all an optical illusion.
There you go.
I'm losing it from the top, so I just said, let's trim it and let's trick people.
It's innovative, right?
That's right.
There you go. There you go. Well, I was, when I was initially preparing for our conversation, which I'm so excited about, I went through all of your press releases and just the sheer amount of things that you guys have launched has been absolutely incredible. And I got curious as to what was the initial catalyst. And what I saw was that 24 months ago, you guys launched the Ligand Express.
Right.
Almost, I think maybe even like 26 months ago. And it's a cloud-based platform that revolutionizes drug discovery. So I did the looking backward on that Express. Let's look forward.
Great.
24 years from today.
Okay.
What does the world of Cyclica really look like? What is the impact that you've created?
We just said our 10-year decade, and now you're asking me to go an extra
Yes.
14 years ahead of that. So for everybody's benefit in the audience and online, Cyclica is a Toronto-based biotech company, and we're thinking differently about how to empower scientists with a cloud-based computational biophysics and AI-augmented drug discovery platform, and then changing the paradigm about how medicines are discovered. And we can spend a little bit more time on that. But the next 10 years for us is democratizing the access of technology to empower scientists and early-stage biotech companies to help them take more steps in the right direction. And by doing that, in the next 10 years, our goal is to participate in the formation or the partnership of over 1,000 biotech companies to create the next biotech pipeline, or let's put it differently with a rhyme, to provide big pharma with sightline to the future pipeline of drug discovery. So decentralizing the discovery of medicines by bringing it onto our platform and then feeding that into the clinic.
I've just been so impressed by that sheer number. So how did you come up with the fact that it's going to be 1,000 companies? How did you get to that place of knowing that this is truly what the industry needs?
Right. So what the industry needs now is a new way of thinking about innovation in drug discovery. Big pharma is exceptionally good at clinical trials, the infrastructure and the capabilities that they have in clinical trials, and to bring molecules to drugs and then to patients. Where they need some support, and this is where biotech companies, research institutions, nonprofit organizations are thriving, is in innovation in drug discovery. What those institutions and organizations don't have is access to capital to be able to afford fair market value of a platform just like Big Pharma would be able to. And so that's where we thought about, well, the scientific problem merits a new solution. How can we be creative in how we approach biotech companies? And so that's where we have taken equity positions in dozens of companies to date, formed joint ventures with many others. And what we realized was there was a need. Our technology was scalable enough and adding substantial enough value downstream to support kind of a compression of drug discovery time without compromising quality. And that we had a fantastic team that was able to then either create or tell a compelling story to existing companies and be like, this is what we can do for you. And so where 1,000 companies comes from was a little bit poetic in terms of 10-year plan, 1,000 companies. But then also each individual biotech company has a 4 to 5% success rate. So we worked our math, did our model, looked at our equity positions that we're looking to take, and how can we be a multi-billion-dollar company?
Yeah.
There's 1,000 companies.
So did I understand it correctly, and you mentioned this just now, is that you're taking equity positions in the companies that you're forming and that you even created an incubator of sorts?
Correct. So one of the exciting things that we're going to talk about today is, in addition to taking equity positions, creating companies. And so we've created a number of companies. Most recently, we formed a joint venture with the Translational Medicine Accelerator, TMA, out of Boston, to create the Rare Disease Medicine Accelerator, which will focus on creating hundreds of companies dedicated to rare diseases. And then today, one of my very good friends and partners from Atai Life Sciences and Cyclica formed Entheogenics Biosciences, which we announced in November of 2019. And Entheogenics, as we'll hear more about from Srini, is focused on creating better psilocybin for mental health disease.
Why was it so important for you to be able to focus on rare diseases and not just necessarily go after the big things that are likely going to be easier for you to win out?
10,000 rare orphan neglected diseases. 8 to 10% of the population suffers from it. 95% don't have access to medication. It requires a spark of innovation, a new way of thinking. An N of 1 is the future, and so let's not just talk about it, let's do it.
Great. So maybe we can bring Srini up to the stage and you can introduce the partnership with Atai Life Sciences. Srini, come on up.
All right. Thank you.
Srini, we are so excited to be able to welcome you to this innovative stage, if you will. And the partnership that you and Naheed have formed has been very fascinating. Naheed, maybe you can actually, let's take it back. How did you guys meet?
You take that one.
Yeah, I'll take that one. This is an exercise or study in serendipity, quite frankly. So I joined Atai in April. There was an AI, machine learning and drug discovery conference in London, actually, at the end of May. And Naheed was actually emceeing this conference. So, we kind of had a little bit of chit-chat throughout the conference, but, obviously he was pretty busy. I don't know how it came up, but it turned out we had flights roughly at the same time, so we decided to take an Uber together. And that's really where it all kind of kicked off. And we found that we had a lot of interests in common, a lot of background in common, certainly a very profound interest in mental health. And at the end of that cab ride, it was pretty obvious it wasn't really a question of if we're going to form a partnership, but really what kind of partnership it would be.
So it all came together in a really serendipitous cab
Yes.
ride. So from a cab ride, I believe that was in May of last year,
Yeah.
and now fast forwarding 6 months, what does the partnership really look like?
The partnership is the aggregation of two companies that are dedicated to mental health, thinking innovatively about what's necessary to actually make demonstrable strides in the right direction there. What Atai Life Sciences has exceptional value in is deep expertise and passion and capabilities in mental health. And what Cyclica brings to the table is a robust, validated computational platform supported by deep experimental and computational science. And so by bringing those two things together, unlike any other organization that we know of today, we're able to ask different questions about what is mental health and how can we approach it with a drastically avant-garde strategy based on an avant-garde platform.
I love that word avant-garde because you're never going to use that in a healthcare setting, in something like this. You just don't hear that. So what makes this avant-garde?
Well, there's a couple of different things. Frankly, even targeting neuroscience, when this whole thing started a couple of years ago, could have been considered pretty avant-garde, right? There's a lot of companies that have left that space, certainly a lot of larger companies that have left that space, the drug development space. There was a marked absence of innovation there, right? So we're talking about the fundamental antidepressant drugs have been around forever, right? They were serendipitous themselves, the discovery of those compounds. And yeah, there's been tweaks, there's been sort of improvements along the way, but fundamentally there were no real changes. And that's really what was, that was really the genesis of Atai and one of the main sort of the co-genesis company, Compass. It was experience with psychedelic compounds and the profound efficacy that was seen there, plus all this more recent literature suggesting that there's, again, profound efficacy in depression. That was the basis for this. And there's a real passion amongst the founders to get psilocybin out, but more broadly to get, meaningfully differentiated therapies out to these patients that are in need. We think about depression, everybody, I'm sure if I asked everybody in the room to raise their hands, everybody's got some experience, personal or one step removed with depression. There's still this huge unmet need. There's so many people that have treatment-resistant depression. we need new therapies. And it's not just these Me Too's, it's something that is fundamentally revolutionary there that we need.
So if you're looking out into a couple of years,
yeah.
I won't go 24 years on you guys, but what are these demonstrable strides that you're hoping to make in mental health together?
Well, let me jump in on that because I think it's important to provide some context. So again, there's this recent push on psychedelic compounds and their efficacy in depression. And of course, psilocybin is something that we're developing. And then there's the other angle that we're looking at, which is a non-psychedelic rapid-acting antidepressant. So we really do want to look at both sides of it. The challenges with psilocybin are one of the key challenges, actually, in terms of being able to deploy it broadly, is the fact that the psychedelic experience is relatively protracted, right? It's on the order of 6 hours. And so these patients have to be brought into a psychiatrist's office, and they basically have to be watched, monitored for on the order of 6 to 8 hours. That is, considering the sheer number of treatment-resistant depression patients out there, that's fine. You're going to address a lot of patients. What we want to do, however, in the context of entheogenics is find compounds fundamentally that are much shorter in their psychedelic effect. And that's really a key point. So now we can fit into existing treatment paradigms, right? So having someone come into a psychiatrist's office and basically be watched, monitored for on the order of 2 hours, that's already an existing model. So we can kind of leverage that. We can get this out to a lot more people, right? And that's really a key thing for me.
Yeah, and but it sounds like everyone's condition is really different. So to develop all of these compounds would take, it takes a long time just to develop one, let alone many. So how does this partnership enable you to do that?
Yeah, so I'll let Srini talk about the partnership, but just taking a quick step back, every patient is going to interact differently with drugs, whether it be for mental health, whether it be for lupus, or for some form of cancer. And so the world of structural pharmacogenomics, understanding how genetic variations in somebody's proteome or how molecules interact with the key elements that are linked to disease and how that's different between people, that's a big space. And that's something that we have integrated within our overall computational platform, is to move beyond the paradigm of designing drugs for proteins and now designing drugs for patients. And that can be enabled computationally. Now, there's no magic to this. It's still very difficult. But again, it's about reducing cycle times, reducing the amount of effort that a scientist has to do in trial and error. And now brought to mental health, this is something that's particularly very exciting.
Yeah, so again, what was the objective, right? What was the objective of entheogenics, or the conception around it? Again, is to find these molecules that are better suited to commercial deployment fundamentally, right? So there's a whole bunch of factors that go into that. Naheed mentioned the proteomic interaction. One of the challenges in neuroscience is that dirty drugs tend to work better, right? So when you have this sort of reductionist approach, you're saying, all right, well, this is the receptor that drives this drug's efficacy. Invariably, you see reduced levels of efficacy. So, for example, again, psilocybin being a perfect example of this. Psilocybin, we think of it as hitting a particular serotonin receptor. Well, it hits a bunch of other serotonin receptors. It hits a bunch of other receptors. We want to recapitulate that pharmacology because we know that it works from an antidepressant perspective. But we want to clean up certain aspects of it and shorten the effect. So this platform is uniquely suited for that particular project, right? Because we want to hit across many different receptors. We want to keep that fundamental profile. We just want to make some additional changes to the molecule. And so this particular approach that Cyclic has got, I mean, at the very minimum is 12 months that we're saving. Realistically, it's closer to 18 months, maybe even as much as 24 months that we're going to be saving.
So patients will be able to access this at least 2 years or 18 months sooner than they would otherwise. And I think that is a wonderful perspective to have, that it's not just about drug discovery for the sake of it. It's not just about creating 1,000 companies, but it's making sure that patients who have rare diseases, who would not have been who may not have been paid attention to by the large companies are now getting attention because of partnerships like this that are enabling them to do so.
That's right. And I just want to leave with one closing remark. So you said a bunch of nice words about myself and Cyclica coming up. You know, every year for the past few years, I've been invited to say something on stage. And I just want to say to Katya and the folks that are in the audience, I see Unity as well, you guys are exceptional. You know, you've enabled entrepreneurs to think boldly about healthcare. And that's not an easy thing to do. And you provided them the resources, the support, and the energy to actually go about it. So thank you.
Thank you so much. You guys fuel us just as much as you think we fuel you. Thank you for all the work that you do.
Thanks.
Thank you. Okay, so in our last founder story, I am thrilled to be able to welcome the next entrepreneur to the stage who, since you saw her on this stage last year, has expanded her reach from 1 state to 40 states, has raised $4 million, and is helping thousands of women cope with symptoms of menopause. Please welcome to the stage CEO and founder Jill Angelo of Genève and Lisa Kaslack, filmmaker and producer of Hello Pause. Please welcome them. Hi.
Hello. Hello, nice to meet you.
Great to meet you too. Well, I am super excited to be having this conversation, and if you don't mind, I'm just going to treat this as a personal session for me where I'm going to ask you all the questions about my future. So, I am in my 30s, and I feel like ever since I was a wee little girl, I've been finding out about my own health and the care that I receive in real time. So everything that has happened to me, this is what you're experiencing now, this is the stage that you're in now, or it's a bunch of timeline-specific boogeyman type of things of you need to have kids by X amount of time, and at some point in time you'll have menopause, and that is it. So why is that?
You know, I think personally part of this like mystery of women's health is that there's no one size fits all. We keep trying to create roadmaps, you know, around first you do this and then that and so forth. So it's part like there's no one size fits all. We're complex because our hormonal nature. But I think also secondly, it's just not studied, and we don't talk about it. There's so much shame associated with so many parts of women's health, and menopause, which is what I focus on with Genève, is probably one of the biggest mysteries, and the first thing we do is just try to inform women.
So tell us a little bit about how you came to found Genève.
So my background's technology. I spent about 20 years in tech, a big chunk of that at Microsoft. I love tech, but I'm a marketing person. And I had a great career and then always wanted more meaning in my work. And I've always had a passion around women and helping them with their health and their development and their confidence. And then I met my co-founder, Jackie Brandwin, who helped build Neutrogena. She's older. She's not wasn't interested in building a startup, but she really had the vision around menopause being a place in women's health that little to no work was being done. And so we started Genève, and here we are.
And here we are. Lisa, I saw you nodding vigorously earlier when we were talking about the challenges within women's health. Did you have a similar experience that I did, or how did you come to find Genève and be a part of Hello Pause?
Yeah, no, exactly the experience that you had. It turns out that the ability to give life is a really complex mechanism, and it has all kinds of implications that start in teenhood with puberty, and then the end of that fertility cycle with menopause. But just as you said, they don't really tell you about any of it until you're actually going through it, and that's what happened to me. I was pretty blindsided by a lot of symptoms that started occurring to me in my early 40s. I'm 50 now, and I had no idea that any of it was associated with perimenopause, and I started to really dig under the hood, and once I scratched the surface, there's really a lot of information. It's a fire hose even, but it's contradictory and confusing, and you don't really know how to wade through it. And I found Genève by chance, really, as I was trying to figure out where to find treatment for myself.
So what were some of the responses that you would get? Who did you even turn to when you were experiencing these symptoms?
I had already seen 2 or 3 gynecologists, none of whom had mentioned to me that any of my symptoms were associated with perimenopause.
Wow.
And then I started to go to one of the gynecologists just started to give me B12 shots. And I started noticing a lot of my girlfriends in the waiting room at the same time. And I thought, okay, there's something more going on here. And I couldn't get an appointment. I looked up menopause specialist, and there was nobody listed. And I live in a major metropolitan area in Austin, Texas. So more digging, and I found the North American Menopause Society. And the 2 physicians that they had listed had waiting lists of over 6 months. And I couldn't wait that long.
Yeah.
And that's how I found Genève. And I met Jill because I reached out to her cold on LinkedIn, and thank goodness she reached back. So that's how I became a patient of Genève. And for those women who live in rural areas or in areas where they can't get in to see a physician, it's a godsend, truly, to be able to pick up your phone or your computer and call Genève for the cost of a copay and get a specialist.
So how does, Jill, if you could tell us a little bit more about how this would work. Is it as simple as picking up your phone and calling, and that's all there is to it, and get an answer?
Yeah, you can come to Genève.com, and you can book an appointment right there in our scheduling system. Last year when I was on stage here, we were in 1 state with telemedicine practitioners. We're now in 41, so even 1 state more. We went up a state since I last gave you the number. So it's great, and it's video chat, it's one-on-one, it's super confidential. More and more, we're even prescribing pharmacy products or prescription products for women that need additional help that a face-to-face conversation can accommodate, where lab work isn't done or a physical examination.
So let's address the elephant in the room around one particular item that gets thrown around the notion of menopause, and it's turned into a bit of a joke, is hot flashes. Anytime anyone gets warm or for any reason, like, oh, you're having hot flashes. And so that certainly stigmatizes the entire experience and doesn't enable us to talk about really any of it. What are some of the other reasons why you think that stigma truly exists, and some of the blocks that we may experience of talking about menopause?
You know, I think, and Lisa definitely add on to this, number one, menopause, yeah, the whole hormonal, like, induced, kind of, whether it's anxiety or rage or hot flashes, none of that's, like, pleasant.
Yeah.
But also, it's been associated with age and aging, and we're a society where it's not cool to say I'm in menopause or I'm having a hot flash and I'm aging. And so I think that's part of, the stigma around it. Women suffer in silence. Every woman goes through menopause. 1 in 3 have a pretty tough go of it. And so it's not, even in the workplace, women are not going to declare, hey, I'm having trouble sleeping, so I can't really concentrate during the day. Can I have some flexibility on when I would come in? Who's going to admit to not being at the top of their game at work? So there's a lot of challenges around that destigmatization that we've got to work through.
But also there's a really big payoff. I mean, the other big time when, women can talk about what's happening with their bodies is during pregnancy and giving birth. And there's a pretty big payoff at the end of that, And we don't yet know, or we haven't advertised well, what the payoff is at the end of, perimenopause. And that's one of the things that we're really exploring is what is the power of women post-40 in our society. And so that's a really exciting thing to look at and explore.
Yeah, that's one of the things that I've been actually so impressed by with Hello Pause is that it's women sitting around in a room and really talking about it, and it's public. You can check out their web series on YouTube, and it's just really honest discussions that are trying to break down through some of those walls. And I think I would encourage everyone not only to just check out the series, but to start having conversations about what can happen in the future. And with those conversations, I think we need some allies. So, Jill, you started to mention the workplace and flex time being something that employers can consider. What are some of the other ways in which all of us could be allies to women during this time?
You know, we recently published the 2019 Menopause Zeitgeist. So if you go to Geneve.com and you search for the Menopause Zeitgeist, it's a report of over 6,000 women who have taken our menopause assessment on our site. And based on that, we've learned a lot from them. And one finding that came out of that was around this notion of support. Over 94% of all women in that survey said, we need to start supporting women more so in so many facets of life, whether that's from your doctor, with your girlfriends, in the workplace, with your partners. 1 in 5 women said, you know, my partner tries to support me, but you know, he or she just doesn't quite know what I'm going through. And so I think a lot of it, whether it's in the workplace or within families or relationships, it's education. The majority of women who come to Geneve say, just tell me I'm not going crazy. Or, you know, please let's normalize it. And we do. Conversation will help drive some of that, but education first and foremost is what will really help.
Lisa, how did it feel to have some of those questions answered, that you're not quote unquote crazy?
Oh man, it was everything, you know, because women are really good at criticizing themselves and kind of turning the lens inward. I was shocked actually to find out that there were thousands and thousands of other women that were having the exact same conversation that I was having, but they were having it behind closed doors. And they talk about it a lot amongst themselves, and it sort of when you get into that little club, then you find out about all those conversations. But I thought this is really important for us to speak about in a wider audience, which is actually why we're going to South by Southwest in March, to bring it to the conversation out in the open. And when we see women's faces talking about this, it really normalizes it.
So one of the things that I've also been so fascinated by is how the power of your message is really to embrace this entire journey. That it's not a death sentence, it's not a pre-menopause and post-menopause, like it's not this black and white thing or a colorful gray thing, which I find to be so liberating. How are you getting that message across it, and how have you been able to share it with people? What has the reaction been?
You know, we often say menopause is the kickoff to the second half of life. Like, we have a whole nother second half. And, you know, our vision is to be the go-to for women's health in the second half of life, starting with menopause, because that is the kickoff. It prepares us. And, you know, you see, you know, predominantly the number of women-owned startups or small businesses in the U.S. are owned by women 50 plus. Women come into their own confidence. They maybe are more independent, financially independent. And in that Zeitgeist survey, you know, 76% of women said, I'm happier today than I was 10 years ago, and I've got a more positive outlook on life. So there's a lot to offer. And so we just want to really try to remind women and help them through this part that might not be as great.
Yeah, I really felt like there's I don't know, I think when those weights come off, that's when you really understand how much weight there is in our culture and pressure put on women to perform, to be mothers, to nurture others, to look good, to be thin, to do all of these things. And, you know, when you go through menopause and you hit 50, all of those weights come off, and suddenly you just feel free to be true to your own nature, and that's a really powerful thing.
Yeah, I think that is an amazing note to end on, because honestly, Jill, because of you and Lisa and your story, it has made this entire journey, for me at least, a lot less scary looking forward into the future. And to be honest, it has given me an appreciation of women who are in the generation above me, about what they may be going through that I had no idea about, because they were doing it behind closed doors. And so I truly appreciate you sharing this story with us. Thank you so much.
Thank you.
Please welcome back to the stage Stephen Krein and Unity Stokes.
Wow, what an incredible day. It's amazing. I think there must have been 40 different people up here since 10 o'clock this morning. Incredible talks. I want to thank everybody, not only who's here in this room, but everybody on live stream who have stayed tuned and focused on the incredible patient stories, partner stories, entrepreneur stories, and the conversations that I think get to the core of why we're doing what we're doing.
And for those of you who have not been upstairs, literally thousands of meetings taking place up there. The energy is palpable, absolutely extraordinary. It's still going on. So looking forward to tomorrow. We have another jam-packed day tomorrow. Doors open at 8 Pacific. The programming will start at 9. So see you tomorrow.
AM.
AM, that's right. Thank you all for being here. Thank you all for doing what you do, and look forward to seeing you tomorrow.
Thank you very much. Still on.
Day one.